Sanibonani. Good morning to everybody. My name is Anele Yawa. I am the General Secretary of Treatment Action Campaign, also the Chief Accounting Officer of Ritshidze. We are going to start now, but before we start, I would ask Comrade Simpiwe to be short to invite God to be with us today, so that all the discussions are guided by the will and the wish of God. Over to you, Comrade Sim.
Can you all stand? Thank you. We can close our eyes. Father God, in the name of Jesus, Baba siyabonga ukuthi wena usivumele sonke ukuba khona phakathi kwale ndawo. We invite your Holy Spirit to be with us here today, so that whatever discussions we do are blessed by you and we can see improvement from that. We ask in your mighty name that as we go back home, we get travel mercies from you. In the name of Jesus, amen.
Thank you, Comrade Simpiwe. Before we start, I think I will have to afford the comrades next to me an opportunity to introduce themselves. I will start from my far right and go this way.
Good morning, comrades. My name is James Oladipo. I'm a researcher on the Ritshidze project.
Greetings, everyone. My name is Londiwe Kuzwayo. I am the Key Populations Organizer for KZN for the 4 key pops that we monitor, that you'll hear about when I go through my presentation. Thank you.
Sanibonani futhi. My name is Simpiwe Xaba. I'm the project officer with Ritshidze, supporting the KZN province and Mpumalanga province. Thank you.
Thank you, Comrade Simpiwe. Makabaneke from time to time, zoshaya kanje, shaya Konglish, mang shaya Zulu, mpini shaya English, so that I can accommodate everybody. But I must mention ukuthi, as we are starting here, there are other comrades who are viewing in different sub-events. We've got comrades at Inanda, at Umlazi, at Uthukela, and we've got 2 at Umgungundlovu in Zululand, at King Cetshwayo and Ugu. Let me welcome those comrades who are joining us online as well. Also, in our midst, we've got comrades from CTC. Welcome, Comrade Chat, and welcome to all comrades from CTC, both South Africa and the headquarters. We welcome also comrades from UNAIDS who are here with us. I am told that the office of the HOD said they're gonna send someone because we had a meeting with HOD of KZN Tuesday night from 8 p.m. until 10 p.m. And then he promised that he's not going to be available. As well as the MEC, we were supposed to meet with the MEC yesterday. Unfortunately, because of other commitments, the MEC could not meet with us. But the report that we are going to present here, it has been presented with the HOD, as well as we shared it with the MEC. Also, within us, we've got leadership from NAPWA, we've got leadership from Sanarela, we've got leadership from PWN, and we've got leadership from Treatment Action Campaign. Also, we've got community members who are public healthcare users. Let me welcome you, my comrade. Today, we will listen, we will share our stories, we will hear other stories that will be recorded here, but also we will hear the recommendations that we are presenting to the KZN Department of Health, all partners who are working together in their response to HIV in KZN. Without wasting any time, we will shoot straight to our program, where I will hand over to Comrade Tusimpiwe. According to my program, we're gonna be focusing on issues of staffing and waiting times. Over to you, Sim.
Thank you, Jess. Thank you. This is the second edition of the KwaZulu-Natal State of Health Report. It was developed using data from Ritshidze community-led monitoring. Ritshidze monitoring takes place on a quarterly basis in 131 facilities across KwaZulu-Natal, 67 in eThekwini, 1 in Ilembe district, 13 in Kinketshwayo, 15 in Umgungundlovu, 11 in Uku district, 15 in Utugela, and 9 in Zululand. Additional quantitative and qualitative data is collected within the community specific to service acceptability and availability for key populations specifically. Data are collected through observations as well as interviews with healthcare users, public healthcare users, people living with HIV, key populations, and healthcare providers, that being facility managers and pharmacists. Data in this report were collected between July 2022 and August 2022. That is a Ritshidze Q4, as is displayed in Table 1. Interviews took place with 128 facility managers. Observations took place at 130 facilities. Interviews took place with 7,973 public healthcare users. 52% identified as people living with HIV, 68% identified as women, 22% identified as young people under 25 years of age. Additional quantitative data related to key population was collected between August and October 2021. Data collection took place across 3 districts, eThekwini, Ugu, and Umgungundlovu districts. The table outlines the full number of surveys captured. A total of 878 surveys were taken, combining 171 gay men, bisexual men, and other men who have sex with men. 284 people who use drugs, 221 sex workers, and 202 trans people. Ritshidze is not a research project. We are not testing hypotheses. Community-led monitoring is more like independent monitoring and evaluation than research. Limitations include that results are from the facilities monitored and may not be generalizable to other facilities in the district or province. Secondly, that facility results, even at the district's level, are heterogeneous. Challenges and successes should be approached as facility-specific unless results consistently identify poor performance and policy-level issues. And lastly, public healthcare users identified and interviewed at the facility are not necessarily representative of individuals who may have stopped accessing services at the facility. As such, further qualitative data is collected, as you will hear today from community members testifying, to capture their experiences of people who may have already disengaged from care. The first set of issues are on staffing. Ensuring that we reach the UNAIDS 95 targets depends mainly on having enough qualified and committed staff in place. Last year, 19% of facility managers in 26 facilities reported that there were enough clinical and non-clinical staff to meet demand. This year, not much has changed, with 18% of facility managers in 23 facilities reporting that they have enough staff. Of the facilities with data in both reporting periods, 17 facilities have improved across the time period, now reporting enough staff to meet the needs of patients. However, 20 facilities have worsened, now reporting not enough staff to meet the needs of patients. There is still a way to go to fill the human resources gap, as 81% of facilities monitored remain with too few staff to meet demand. The interviews with public healthcare users show that there has been improvement since last year on this indicator. In this reporting period, 55% of public healthcare users interviewed reported that there are always enough staff at the facility. There is considerable variation per district. 59% of respondents in eThekwini say there are always enough staff. 59% in King Cetshwayo, 83% in Ugu, 16% in Umgungundlovu, and 52% in Uthugela, and 37% in Zululand. This has improved from last year's reporting period, where 45% of people said there were always enough staff, and 52% said there were never enough staff, or only sometimes there is enough staff. KwaZulu-Natal scored best across all provinces monitored on this indicator this year. However, there is still a long way to go. According to facility managers, the most commonly understaffed cadres were professional nurses at 91 sites, enrolled nurses at 66 sites, enrolled nurse assistants at 60 sites. Of facilities reporting shortages, 42% of facility managers blamed there is not being enough open positions on staff shortages, while 50% blamed staff shortages on one or more unfilled vacancies. Following an initial decline in the number of unfilled vacancies reported, in Q3, we saw an increase to 490 vacancies, back down to 449 in Q4 across 124 facilities. This means that key positions still remain open, creating gaps in capacity to deliver quality services. The most common vacancies by cadre are professional nurses, 178 vacancies across 55 facilities. Enrolled nurses, 94 vacancies across 35 facilities. And enrolled nurse assistants, 44 vacancies across 26 facilities. 37% of facility managers we spoke to specifically wanted additional human resources for health support from PEPFAR, District Support Partners, Broadreach and Health Systems Trust. However, PEPFAR's funding for critical HR posts has only reduced in recent years. Overall, in KwaZulu-Natal, while public healthcare users report improvements over the last year, not much has changed from the perspective of healthcare providers since last year's report. A gap still remains between the staffing needed to ensure high quality services and the staff present each day at site level. As I said earlier, public healthcare users identified and interviewed at the facility are not necessarily representative of individuals who may have stopped accessing services at a facility. As such, further qualitative data is collected. We will now hear from community members who have spoken to in the community about their experiences.
On the day, they usually close. Then they work only with abangaphakathi. And then my challenge was that then how do one get a assistance? Because I'm here already and it's before 4 o'clock, which is mentioned as his part. So good finally value at the premises. He indicated which unfortunately it's not up to him. Yena has got orders. That's how they operate between 2:30. If there's no traffic, they close. But Hiona institution has been working very well. Beside that experience I had, but it was just not very convenient. There were people already locked outside. I was not the only one. They were locked outside. They were not assisted. Then how do you chase away umuntu esefigile kwi-facility? And it's within working time. Uthi akahamba angatholi izinto zakhe. If I understand that I will report the case. That did not even scare them. That was my biggest frustration. If umuntu esho njalo okay angithi hayi uzothi hayi at least ngenaki hayi bona cha. It felt like it's business as usual. That's how they operate and they're not willing to change. Ama facilities ethu. Maybe we need to retrain ama duty bearers. And also ama security that works Google systems in it. If they're there for a community, not for themselves. It's not about collecting a paycheck. At the end of the day, if we do not use the facilities, angeke abekhona, then it becomes worse. Umongena mali like myself, you find yourself suspended your last cent. That is so unfair. It's actually human rights violation, and we cannot tolerate that at this day and age. The local facility is a duze ikwadine, and that facility is always packed. And beside the facility, ukuthi hlezi packed, service yakhona is slow. No, CCMDD makes life convenient, ne? Because if you're stable, you do your things right, queues are not very long. You don't have to wait and sit and keep on ulandela queues amade. But my frustration with queues now a clinic, I think we also need to work on that. I've seen people abasebenzisa abo discount clicks and alternative points. I think it's more convenient there. Kodwa nje hayi ema-clinic ethu, I think it's the service which is a problem. And I would like to see kuba khona some capacity building to staff. The staff need to understand their role in the community. They're there not to collect our paychecks. They're there to service the community. And this is a Batupili principle that we need to observe and uphold as our institutions. If we're failing to do that, then we're doing disservice to our people. That's the first point of departure. Number two, our institution, maybe they need to have sessions, your workshops, your awareness sessions, dialogue sessions. They need to dialogue with the community, make them aware of what is your right. If they are not informed, we find ourselves begging for something that should be, and it's our right.
The reason ngingasebenzisanga ifundo Arnold was indlela engibona ngakhona abantu betreateka ngakhona, so I decide from the get go ukuthi I will not use le clinic le rather ngihambe ngiye Potchefstroom. I-medication engiyithathayo yaka chronic, into enzeka ka chronic abantu bafika ekseni ngo6 but kushaya o4 abantu bengasetshenzwanga. Cha, angisebenzi, ngiyabeka imali made kuyinsuku zama grant ezingane, ngisave imali ukuthi ngikwazi ukuhamba ngebhoro. Akukho right because phela umuntu asebenzi lo mali you can do something else, but futhi ne medication igazi yalidinga, so akukho right ukuthi ngithathe le mali encane enginayo ngibe nginayo isibhedlela sangasekhaya ngihambe ngiye kwenye indawo. Angazi no mhlambe staff usidinga training mayelana nokuphatha kwabantu ukuthi abantu babaphatha kanjani, but ime ukuthi ngasethiwa istaff asithole ukufundiseka ukuthi ama patient abalekile, mhlambe bangashintsha istaff or babafundise ukuthi abantu baphathwa kanjani.
We will now proceed to the community stories in the room.
Good morning. Igama uSipesihlwa Kabengu. I come from a community called Umlazi section. The story that I'll be sharing is with regards to a clinic that I normally use, which is U21 Clinic. First and foremost, the service is very slow. There's a tendency whereby securities are the ones that give out rules instead of nurses, whereby lines start from so I live next to a Department of Education, which is across the clinic. So the lines will start from there at 6 o'clock, but end around 4:30 to 5 o'clock in the afternoon. And then, masuko line labo, you would have to, you're being told, okay, if you're going to chronic, you're going for an issue with your health, or maybe you're just going there to fetch your medication, whatever medication that you're taking. Ufakwe line, and then afterwards, ungene, it will take maybe an hour or two. After that, you need to go for vital signs. Nakhona will take like 2, 3, 4 hours. Still sitting, guys are older the whole day. Some people have diabetes. I've witnessed a person that has fainted in front of me at the clinic. And we on a facility, leo yama vital signs. There's no privacy at all. There's like 4 or 5 nurses here, ni bondelana as patients. There's cleaners here. If you're part of the LGBTQIA community, there will be nurses that will have homophobic comments, and the cleaners will also have a comment in what the nurses are saying. And then once you get to the consultation room, especially in the chronic department, nakhona it's the same thing. Whereas if you're in the LGBTQIA community, there's a lot of attitude. There's a lot of back chatting. You're not allowed to ask any questions. Some of the LGBTI community members are scared to even take any condoms or lubricants from the clinic due to the rudeness of the nurses. And also, it was 2 weeks back, we witnessed a death within the clinic due to the negligence of the nurses, whereby they did not want to stabilize the patient for over 6 hours, and the patient passed on the spot. And Mangeza, apparently the nurse has been fired. Not fired, I'm suspended for now. So for me, using the clinic, it's not benefitable at all, because you you don't feel comfortable, you firstly think, because some of the nurses, I know them personally, some of them are my neighbors. But I keep quiet and not say anything because I don't want to seem like I'm rude. So I changed the clinic that I was using and went to Orem Institute, of which I'm very happy with their service. It's an in and out situation, 10 minutes in, 10 minutes out. You receive your results, you are run through on what is going on, when is the next appointment, when is your next chronic taking of your medication. Thank you so much.
Mina bekade ngifika ekliniki inkinga ukuthi bekade sifika khona ngekhathi zasekuseni uthi uyavuka ufike ekseni ngoba usuku uyitshela ukuthi uzohamba early ugcina uhlala isikhathi eside kuze kube isikhathi sokuthi uye la ekucheckwa khona ama BP umufika nakhona kumbondelene abantu baningi ngaleso sikhathi ayikho indawo la ukwazi khona ukuthi ube no nurse khona nibe one on one nihlala khona nihlala isikhathi eside ngendlela ukuthi khona la kwakhona omunye wabakhona waze waquleka khona nomunye ngelinye ilanga wabakhona waze washona unesi wayekade em-attenda ngalelo langa lelo in charge of lo muntu loyo kuze kushona ezeshona okwamanje usamisiwe emsebenzini so ukuya kuleya clinic akusayona into emnandi ngoba manje uyabikelwa ukuya kwakho khona ukuthi engabe namhlanje kuzokwenzakalani and kumina kubukhuni kakhulu ngoba mangabe ngiya khona ngiba nenkinga ngoba abanye abaningi bonesi bakhona ngiyabazi bahlala ngasekhaya so kuye kube naloko ukuthi ngiyobona labantu laba engiphinde ngibabone futhi nangasekhaya so nje kuleya clinic ayisizi ngalutho siyahlala lapha yana asinakwa ile inkinga esibhekene nayo.
Ngiyabingelela. I am anonymous. I'm reporting Eddington Hospital, the clinic. I went there. I was from work. It was about 2-3, and then the nurse was saying to me, "Indaba ngifike ngalesi sikhathi bengingafiki ngane ekseni because sekuyisikhathi sokuthi sebezovala manje bana bayaqoqa bayahamba." I then said ngisuka emsebenzini and benginaso ilesi sikhathi enginaso sokuza lapha eclinic kwathi no abantu bayavuka mabeza la eclinic ngathi mina so mangabe usho kanjalo ngeke ngize ngilithole yini usizo wathi no sengiyacacisela ukuthi nje mangabe uza eclinic uyavuka ngasethi mina so kahle kahle nivalu 3 iyona into enifuna ungitshela ukuthi nivalu 3 because mina ngifike la before 3.
Okay, my leader, wait for us, please. So what she's been saying is that she had a challenge at the facility. She happened to arrive before the facility closed at around 3 p.m. When she got there, she was told that she should always wake up to come to the facility and that she shouldn't come to the facility late.
Okay. And then ngiyangibikile ukuthi yini engiphethe and then wanginikeza only amaphilisi einhlungu.
I went into the consultation room and explained how I was feeling and I was only given pain medication.
Ngathi ngithi ngicela amanye amaphilisi wathi kanti kahle kahle uzo order lapha.
When I asked for extra medication, she asked me if I'm placing orders at the facility.
And then I went for a testing, like an HIV testing.
Ngaya for HIV testing.
Mangifika khona nurse ingibuza ukuthi where is your boyfriend?
When she got into the consultation room, she was asked where her boyfriend was when she was going to test for HIV.
And then ngithi mina ayikho la. Njengoba ubonze ngihamba ngedwa nje ngizoyitestela mina ngihamba ngedwa.
She indicated that she's coming alone. She didn't come with her boyfriend. She came to test by herself.
I say okay, was it okay? Wangitesta and then wafihla my results
She tested me and she hid my results.
And then wabhala phansi ayekubhala and then wathi lalela ke siswami akusho ukuthi njengoba makwenzeka ube negative akusho ukuthi uzoba negative forever. Wena nje kumele uze la ne-boyfriend yakho into esidingayo leyo.
She then said to me, she wrote a few things in my file, and then when she was giving me the results, she told me that, look, you're never going to be negative forever. The next time you should come with your boyfriend when you come to test for HIV.
Ngimese ngibuza ukuthi what if anginayo?
I then asked, what if I don't have a boyfriend?
And then ngase ngithi mina what if mina ngiyayireporta yonke lento isho kumina because mina ngilindele ukuthi mhlambe at least okokuqala bengizobona ama results ami i-right yami ukuthi ngiwathole. Mangabe kuthiwe ngiyareporta athi uzongireporta kuphi unesikhathi bo.
I then explained to her what would happen if I decide to report what you're doing to me. She responded by saying, where would you report me and why would you report me?
Yeah, there was my story.
Thank you. Number one.
Sanibonani. Igama lami uNombuso wakamthembu. Ngihlala efolweni. Istory sami namhlanje simayelana neNtsimbini clinic.
My story today is about Ntsimbini Clinic.
Ngithe mangifika khona ngoAugust 5. Mangifika khona ngabo 11.
When I got there around 11,
ngiyafika sekuthiwa umuntu ogcina akasekho umunye othathwayo.
they told me that I was the last person
Ngizolanda
and they
amaphilisi.
weren't taking any more people.
Bengizolanda amaphilisi
I had come to fetch my medication.
lapho ngathola ukuthi fanele ngiphindele emuva because akusasetshenzwa. Then bengibuza ukuthi ngabe yini isizathu njengoba sekuvaliwe.
Then I had to go back home because they were no longer taking any more patients. Then I ended up asking them what was the reason for them not accepting me because I had come to the clinic.
Bangitshena ukuthi inkinga amanzi awekho.
They told me that the problem was that there was no water.
Because umuntu engambuza isekela lamphathi walo clinic ukuthi why nithi amanzi awekho because akhona ama-jojo tank.
The person that I asked was the second in charge of the facility manager. I asked them why she had told me the reason for them not closing early was because there was no water, because they had septic tanks.
So ngaphindele emuva kanjalo amaphilisi ngazange ngize ngiwathole awekho futhi asekhaya sephelile bekwi-date yami.
I ended up going back home with no medication, and I stayed at home with no medication. Up until now, I don't have any medication.
So lokho kwangiphatha kabuhlungu ngoba ngalala ngazange ngize ngiwaphuza amaphilisi ami ngalolo suku.
That made me very feel hurt sore because I slept at night without taking any medication that night.
Then i-story sesibili ngithe mangifika ekliniki ngifike kahle nje ngisuke i-asthma because ngine-asthma.
Then my second story is when I arrived at the clinic because I had asthma.
But i-asthma yami mangabe icheckwa ayitholakali kodwa mangabe ngifike ekliniki ngike nginibulizwe.
When they do check at the clinic, they can't pick up that I have asthma when they test, but they do have.
So mangifika ekliniki bangiyenze ngingene lapho kucheckwa khona ama-BP nama-weight. Then bese bengifaka kulo nurse lo. Unesi osanda kufika kule clinic eNtsimbini.
So when I arrived at the clinic, I went to the vital section to get my BP checked and all that stuff. So I went there and I found a nurse who was new there.
UyiXhosa owesilisa yedwa kuleya clinic usanda kufika.
He is Xhosa, he is male. He's the only male nurse at that clinic.
So uma ngena phakathi engibona ukuthi ngivuke i-asthma, umuntu nakanjani uvuke i-asthma uyakwazi ukumbona awuzubuze.
So when I went inside, you could tell that I was having an asthma attack. You didn't have to ask me, but he ended up asking me.
Bese ngiyamtshela ukuthi i-asthma ngikhuluma umoya uyaphela.
I ended up telling him, gasping, that I have asthma, and I was out of breath.
Ebese nginikeza amaphilisi.
He then gave me tablets, medication.
Ngimtshele ngithi mina amaphilisi azongisiza emva kwesikhathi.
I told him that the tablets would help me after some time.
So mina into engiyaziyo ngoba kusiyo into engiqala manje le into ehlezi ngivuka uma ngifike kule clinic ngisiza ukuthi nginibulizwe iyona into engisizayo leyo bese ngitshena ukuthi yena.
So normally when I have this asthma attack, what helps me is when I get to the clinic, they nebulize me.
So mase ngitshena ukuthi bengiyapi eclinic uma kuukuthi ngiyazazi ukuthi yini engifunayo.
He then asked me why I had come to the clinic if I knew what I wanted.
Ngaphuma lapho ngaqala phansi ngaya ka doctor.
I went out. I started going to the doctor, to a private doctor.
Uyacabanga ukuthi nale mali engiya ngayo ka doctor kumele ngiboleke because ayikho kodwa ngiyagula.
The very same money that I had to go to the doctor with, I had borrowed it, but I had to borrow it because I was sick.
Yeah, isona story sami leso ngaphatheka kabuhlungu.
Sanbonan, I'm anonymous. Into engiphatha kabi eclinic engasekhaya kwaMashu.
What hurt me the most about the clinic near where I stay at KwaMashu,
eGoodwin's clinic.
at Goodwin's clinic.
Yebo. Lapha eGoodwin's niyafika ekseni ngabo 4 and then depende ningasetshenzwanga.
I arrive there as early as 4 o'clock. Sometimes we end up going home without being assisted.
Ubabonile ukuthi bakhona kodwa bahleli abasebenzi bahleli ngale endaweni zabo.
You do see that they are there and they are not doing anything to assist us.
Bayihlalele bayechethela ababodwa baphumayo bayakamakhelwane bayozosela inyama.
They are seated there. Some are walking around. Some are going out of the facility to go and buy some meat.
Mangabe uthuthu uyabuza ukuthi kanti wenze njani bakutshela ukuthi istaff asiphelele kodwa ubabona baningi.
When you ask the reason for this, they tell you that they are short-staffed.
And ngaze ngathi mina ngcono ukube kuthiwa abafana no sister sister Umvelo no sister ubani. Kodwa bayithu nje sister abathe kuba ngcono lapha eclinic okuyibona abasebenza kakhulu.
I ended up telling them it would be better if they were like the other two sisters who were much more better than them in behavior, like Sister Mvelo. I've forgotten the name of the other nurse.
It's on story sami leso.
That's my story.
Sanibona. Ngeke ngiseshe igama. Bengisebenza eMpumelelo Clinic.
I use Mpumelelo Clinic.
Yebo, bithe bengigula ngavakashela khona eclinic ngiyothola ulwazi ukuthi ngabe ngiphethwe yini because amandla ayingiphelela ngijuluka nasebusuku ngingakwazi nokudla.
I was very sick. I ended up going to the clinic because I was also very weak. I was also sweating a lot. So I really wanted to know what the problem was.
Yebo, ngathi ngifike eclinic ngicabanga ukuthi kwaku-March 18 kanje noma 16 anginayo ishow.
When I got to the clinic, I think it was March 18. I can't really remember.
Mengifika khona ngithi ngizocela usizo ukuthi bengicheck ukuthi nginani because ngangenalo lwazi ukuthi ngiphethwe yini. But then bathi kumele ngikhwehlele isikhwehlela sangaphuma bathi ngiteste i-HIV ngayitesta ngaba ngithola ukuthi ngi-negative.
When I got there, I told them that the reason for me being sick, I do not know. They told me to take my sputum so that it could be checked, and they also took an HIV test, but they didn't find anything.
Ngaya khona bathi ungenane bangibhalele incwadi unesi wathi ngizowenza x-ray esibhedlela. Mese ngibuya naye ngolwesithathu sengizobona udokotela bese uboyena osho ukuthi ngiphethwe yini.
The nurse then gave me a transfer letter to go to the hospital so that they could check what was wrong with me, and then I could come back on Wednesday.
Ngabuya ngolwesithathu ngoba unesi wayishilo mengifika ngihlale ngilinde amanye ama patients azobona udokotela.
When I got there on Wednesday, as the nurse had told me to come back, I went to the clinic, I waited with the other patients.
Ngathi sengena sokuyisikhathi sami sothi ngiyobona udokotela wangibuza udokotela ukuthi bese ngibhukhile yini kanye nonesi wayehleli naye ngasho ukuthi cha mina angazi nanokuthi kuyabhukhwa bengabhukhwanga bangicheck phansi bangalithola igama lami bathi no ngeke bekwazi ukungisiza ngaloso sikhathi because angibhukhile.
When it was my turn to see the doctor asked me if I had made a booking to see him. I told him no, I had been sent to come, and he told me he couldn't attend to me because I didn't have a booking.
Ngangiworried because unesi wakumele ngitshene ukuthi ngingenani ngalo suku wakumele ngibhukhe ukuze for ukuthi ngibone udokotela but yena kanjena ngalutho.
I was very worried because the nurse had told me to come back on Wednesday to come and see the doctor, but I ended up not seeing the doctor.
And so ngazama ngalinda ukuthi okay ngibhukhela unesithathu ozayo.
I then made a booking for the next Wednesday.
Khona ngikula ngonjalo kwathi kufika uLesihlanu umoya wami wasunqamuka ngelendlela ukuthi ngazi ngicabanga ngisho kufanele isibhedlela ngilanda iambulance.
But as I was waiting, when it was Friday, my sickness was getting worse. I was out of breath. Then we decided to call an ambulance.
Well, so I phoned an ambulance, but then I fear so ngathi no ngizolinda ngenani ngize ngiye clinic mhlambe ngomsombuluko ngizame khona ukuthi ke singihambisa isikhwehlela emothi kanjani.
When I did call the ambulance, the ambulance never came. So then I resorted to waiting for the whole weekend to end so that I could go back on Monday and check what was wrong with me.
Ngaye clinic, so mengifike clinic bathi bazongenza nebulizing angazi indlela ukuthi bakwazi ukuthola isikhwehlela sami. Ngaxa ukuthi indaba ongenzanga lento last time because ngangikhona lokho ngifike clinic belokho bethe ngifike kodwa bengangisizi sonke lesikhathi.
When I got to the clinic, they took my sputum and nebulized me. But what got me thinking, I started wondering why they hadn't done that the first time I had been there, and them doing it now.
And iwari yami eyayingihlupha ukuthi onesi babekhona babebona ukuthi no emzimbeni ngiyehlile kakhulu and ngabatshena ne-weight yami engangiyishaya before babona ne-weight esangiyenza babona ukuthi no vele ngiyehlile emzimbeni but still abanginikanga something ukuthi mhlambe ngikwazi ukuthi ngibe ngcono.
My main worry was that I was losing weight, I was weak. I told them what I had previously been weighing, my body weight previously was. So they did see that I had lost weight, but then they ended up not helping me.
So ngafika umhla 20 March ngaya eclinic so basithola isikhwehlela and then saba tested.
On the 20th of March, I went and my sputum was tested, and
bathola ukuthi ngine-tuberculosis and then wathiwa komele ngiphinde ngibuye ngo-24 sizoqala i-treatment ekuseni ngingafike ngingahlili.
They then, when they finished doing the test, they then found that I had tuberculosis, TB. They then told me to come the following Wednesday so that I could go for the necessary procedure.
Ufika wami khona ngalinda ngicathi kwaze kwashaya o3 kodwa kuthiwa angifike early morning ngingadli because ngizoqala i-treatment ngalinda kanye namanye ama-patients still ngaze ngathola isizo mhlambe around ko3 kanje.
When I got there, I waited until it was 3 o'clock, and they had told me to come there without having any food intake. So I ended up waiting for so long, and until I went in to see the doctor.
Khona ukuya kwami eclinic kundimaza kakhulu because bengumuntu bengasebenzi first kodwa ke ngathola umsebenzi ngenxa ukuthi kade kumele lokho attend iclinic ngesikhathi countless times into engenasidingo ngagcina sengilahlelo umsebenzi.
So my going to that clinic ended me being unemployed. because I kept on going there and not receiving any help, so it was causing problems at work.
Isitori sami sesibili sokuthi kunonesi angazi noma ngizothi sister yini odila amafile ekliniki igama bathi uNtombi.
My second story is when I went to the clinic, the staff member who deals with the files,
Ngathi ngifika khona
her name is Ntombi.
Ngathi ngicela ukuthi ngisize mhlambe ngefile. So mengifuna ngisize ngefile wangitshela nje indlela yakhe yokweyisa engekho kahle. Angazi noma mhlambe ngafika ngesikhathi strong noma ecasukile noma kanjani kodwa angiphathekanga kahle ngendlela wakhuluma ngayo. Wathi angilinde phandle so like ngendlela nje ehashly.
When I told her that I had come to create a file, she answered me in a very bad attitude, and that made me feel very hard. So I ended up going outside.
Benza a duplicate file yami ekliniki, and as yena usisimele edile nama files banginike ifile empty kukhona ifile nama records yayikhona sengena ekliniki. Ngathi sengiya ku sister usister wangitshela udinga ifile nama records sengilindile kulayini.
Then when I went to the sister into the consultation room with the file, they gave me a duplicate file which was blank. Then I went into the consultation room. The nurse then said the file was blank and they had to see what had been happening to me or with me previously, but they couldn't pick that up because the file, the original file had been lost or missing.
Ngababuza unesi khona esibhedlela eklinik ukuthi ifile yami likuphi balokho bengiphusha kulona lo nesi.
When I asked all the nurses what had happened to my file, they just gave me the runaround.
Ngaze ngagcina ngicela omunye ubhudi osebenza ka-HIV khona ngenxa ukuthi ngiyamazi ngimazela ngasela engihlala ngakhona ukuthi angisize.
I then ended up asking one guy that I know of who works in the HIV department because he stays near my home. I asked him for assistance.
Wangisiza ke ubhudi wangicingela ifile wase walithola ngase ngagcina sengikwazi ukuthi sengiya ku sister nakhona bekade ngilindile.
This guy then did assist me. He helped me by looking for my file, and he did find my file. And then I ended up going and getting help. I ended up being admitted.
Thank you.
Thank you, comrades. You know, before I read the recommendations, I think I need to acknowledge the presence of Ubongi Wemsomi, the sub-district coordinator, the presence of Comrade Siabonga Zungu from KZN Civil Society, as well as Spesihle from KZN Health Department. As I am reading these recommendations, there are two, but also I was listening from the videos and from what people were saying, and I was asking myself, what is the problem? We met with the HOD to present this report. And if in South Africa really we've got a constitution, who must respect that constitution? Because in South Africa, we've got Section 27 of the Constitution, which gives us, as the citizens of this country, a right to access quality healthcare services. In South Africa, there is what is called Patients' Rights Charter. In South Africa, there is what is called a Bill of Rights. And all of these, as I'm listening, are being violated. But also, when our rights are violated and we take legal steps against our government, and government is found to be on the wrong side of the law, and they have to pay either for medical negligence or for whatever reasons. Where do they get that money? From the same budget that is meant for service provisions. But also, what role all of us, Department of Health, implementing partners, trade unions of the healthcare workers, what role are we playing to sensitize some of these nurses who are violating us in our clinics? What programs are there to sensitize them, to make them understand that to live with HIV, to be poor, to be part of the key population is not a shame or a crime. And all what we demand is to be treated with dignity and respect. That's all what we are asking for. And if we can be treated with dignity and respect, many of the people who don't want to go back to clinics again, it is because we feel ill-treated in those clinics. And that's where services for health are, in those clinics. And if we do not go to these clinics because of the attitude of some of the nurses, what does that mean? It means either we go and buy medicines or we allow ourselves to die. Something must be done as a matter of urgency. Here are the recommendations. By June 2023, the KwaZulu-Natal Department of Health should fill 70% of vacancies in the province, including the 449 vacancies reported at the Ritshidze sites, and fill the remaining 30% by end of 2023-24 financial year. And secondly, the KwaZulu-Natal Department of Health should produce annual reports on the number of healthcare workers by cadre employed in each district. These reports should also include year-on-year comparisons from at least 2020 of the number of filled posts in all districts and cost of these posts to the government. Thank you.
The next set of issues are on waiting times. Positively, waiting times have reduced by 41 minutes in the last year in KwaZulu-Natal. In this reporting period, public healthcare users reported that they spent an average of 2 hours 51 minutes waiting in the facility. This includes the time before the facility opened, of which an average of 2 hours 39 minutes is waiting after the facility opens. The province remains the best performing with the shortest waiting time of all provinces monitored by Ritshidze for the second year in a row. 30 facilities have had average waiting times after the facility opens under 2 hours, as shown in here in the table. However, some public healthcare users still spend hours at each visit to the facility. The average waiting time was over 3 hours at 31 facilities monitored, over 4 hours at 8 of those, and over 5 hours at 3 of those. This is a very long time to spend at the facility in which public healthcare users are usually only seen for a very short consultation. And this is a major source of dissatisfaction for those who experience the long waits. While overall waiting times have reduced, 48% of public healthcare users interviewed in the province still think the waiting times at the facilities are too long. Positively, this has reduced since data collected between October and December 2021, where 55% of public healthcare users thought the waiting times were long. KwaZulu-Natal has consistently scored best on this indicator, with the fewest reports of waiting times being long, but more progress needs to be made. This varied dramatically across districts. 50% of respondents in eThekwini think waiting times are too long, 36% in King Tetwayo, 37% in Ugu district, 67% in Umgungundlovu, 23% in Ukutela, and 64% in Zululand. The most frequent reason provided by public healthcare users for the long waiting times is that there is not enough staff, 38%. Staff are not working or working slowly, 29%. And it takes long to find files. The filing system is messy, files are lost, 18%. The average earliest arrival time was 6:04 a.m. However, 69 facilities had average earliest arrival time of before 6 a.m. and 4 of those facilities had average earliest arrival time before 5 a.m. The reason public healthcare users begin queuing early in the morning is in an attempt to get seen more quickly, often so they can make it to work or take care of their children. A circular was issued in May 2019 by the National Department of Health, calling on facilities to open by 5 a.m. on weekdays and 8 a.m. on Saturdays. Unfortunately, none of the KwaZulu-Natal facilities monitored are reported as opening by 5 a.m. on weekdays. 8 facilities were reported to open by 6 a.m. KwaZulu-Natal was the only province with any facility that reported opening before 7 a.m. Only 21 facilities opened before 8 a.m. on Saturdays. Commonly, when this issue is raised at facility level, facility managers tell us that they are unable to extend opening hours due to insufficient staffing, no provision of overtime payments, staff reliance on public transport to get to work, which starts operating at 6 a.m., and that the same safety issue that face public healthcare users getting to the clinic apply to the staff. Ukutukela is the only district that attempted to implement the circular, but stopped after facing these challenges. Of the 2,627 people who arrived before the facility opened, 57% reported feeling safe or very safe. 17% reported feeling unsafe or very unsafe while waiting for the facility to be open, down from 24% last year. KwaZulu-Natal again scored the best on this indicator across provinces monitored by Ritshidze. However, still more must be done. No one should be put in unsafe conditions while trying to access healthcare. Key measures such as opening the grounds early and spacing out appointment times throughout the day should be put in place to ensure that people are not put in danger or unsafe conditions while waiting for healthcare. Last year, 81% of the filing systems in 108 sites were observed in a good condition, and the province performed best on this indicator. However, through Ritshidze's observation, this has worsened this year, with filing systems observed to be in a good condition in only 76% of sites. That's 94 sites. The province now scores number 2 across all provinces monitored. 12 facilities improved in the year, while 19 facilities got worse. Messy and disorganized filing system observed at 23% of sites, which increases the delay of healthcare users being attended to and increases the burden on already overstretched healthcare workers. 18% of public healthcare users blamed the long waiting times of files being lost or taking a long time to find. We now move to our recorded community stories.
Mina ngilanda amaphilisi e-clinic eCaluza, ama-ARVs. So ama-ARVs ngaqala 2017 bengilanda ku-Straight eclinic. So ngenxa ukuthi-ke iy'mali zokugibela-ke kuyefika i-date ukuthi ngeklinikhi uthole imali anginayo. Ngase ngicela i-transfer so ukuze ngizokwazi ukuza eCaluza ngoba ngibona iseduze nami. Kanti angazi ukuthi ngifaka enkingeni. Then bekuhamba kahle, then last year uma uyeCaluza nje uvele ungazi ukuthi kumele wenze njani. Uvuke ekuseni untanta endlini kodwa kufanele eklinikhi ngoba awazi ukuthi wazi kahle ukuthi njengoba ngihamba manje ngo-5 ngizobuya ngo-8 ebusuku ngizobuya sekulalwa lapho. Noma ngeklinikhi uthola ukuthi nje ngempela uthola ngisho imali egwini yakhe uyohlala uzulambe eklinikhi abakusizi balokhu bentanta nje lapha phambi kweni bekhuluma nafoni bengena ko-WhatsApp kwaze ngaze ngayekade nje ukuthi uma kuthi kufanele ngivele ngibikelwe nje nga-defaulter then last year. kwathi singabuyela nakhona ngibuyela nje nginalokho zangazi ukuthi ngayaphi kwiklinikhi ngoba Ashdown kudingi nami kwathi kunalonyaka befikile la ekhaya bengilethela amaphilisi mabefika ekhaya bangashiya amaphilisi ngima base kwifile babhala ukuthi bangishiyele amaphilisi then mangisengiye ekliniki athi unesi yakhe into yokusiza ngayo ngoba kwifile kubhala ukuthi unikiwe amaphilisi wena mina ngenze njani ngizobhalani kwifile wabakubhalele any date ukuthi ubuye ngayo kodwa amaphilisi abanginikanga anginawo ngamtshela sithi anginawo amaphilisi ngizokwenza njani ke mina bathi nayo into azoyenza ngoba kwifile phela kuthiwa bashiya amaphilisi kwazathi wangidabukela kunesi wanginikeza amaphilisi kodwa nje icaluza Nkosi yami angazi noma kufanele ivalwe noma angazi kufanele njengoba phela iyaphuma nasemaphepheni ngenxa ukuthi badembesela ukusebenza abafuna ukusebenza kodwa ngiyaxaka ngoba phela baningi abantu abasebenza khona lapha kodwa abakufuni ukusebenza uzuyeke ngisho amaphilisi ngenxa yabo futhi mase ubuyela bafike bakuthethisa ukuthi ubungeza ingane ekliniki mase futhi uba ukhuluma nabo bathi uyadelela sokusiza kanjani ubudelela
ngilanda amaphilisi eCaluza clinic so mengihambile mhlawumbe ngivuka nama ngo5 ukubuya kwami ngibuya mhlawumbe sekulethe mhlawumbe ngabo 3-4 lapho late nje benza kancane ngesikhathi lesimanga sokuthi bangabe behamba bephuma bese bayodla lunch bahamba mhlawumbe ihour lonke sihleli silindile nomphathi wakhona akakwazi ukuthi enalekelele ukuthi mhlawumbe athi abantu abasheshisi kangoba abanye abantu abasawalanda amaphilisi eCaluza ngoba enqena ukuthi kwenzeka kancane amaphilisi ngwalanda emgazini so mengwalanda khona kuyashesha ngoba abantu bakhona bafika ngo9 mhlawumbe ngo9 so sengihamba ngilanda amaphilisi eCaluza clinic amaphilisi HIV ngaqala khona ukwalanda ngo2010 so shuthi kwahamba base bengitesta igazi bathola ukuthi i-viral load ikhona eclinic bangisa emgazini la ngilanda khona athi bese besichazela ukuthi njengoba i-CD4 counter iphansi akwakeze uphuma la eclinic kodwa njengoba iphezulu i-CD4 counter ku right usazophindela khona lapha esayithini yakho bangishiftela ngala emgazini cabanga ukuthi kwaku April ngasikwaku-April base sebengishintsha u-April sebenginikeza amaphakethe awu4 ngo-October kufanele ngiphindelise ngoba lokhunja futhi ngiphinda futhi ngothatha amagazi khona ngo-October ngosikhathi ngiyothatha amagazi ke bafika akusheshi futhi nakhona benza kancane njengoba benza kancane besilethela amaphilisi besinikeza amaphilisi
ngisothuthwini eduze kwekliniki uthuthwini angihambi kuyona ngoba ngazi ukuhlukumezeka kwakhona ukuthi awukwazi ukushesha usizwe khona kusho ukuthi ngisebenzisa yase Sunport ngisebenzisa amaphilisi ashukela nawe BP bayanakekelana khona kahle bayakwazi ukusheshisela usheshe ubuye le ngayishiya ngoba khona uhamba kuseni ngabo 5 kuze kushaye 4 ungakabuyi khona usizo ungalitholi mangiye Sunport ngigibela ngo26 rand nginamanga ngigibela ngo76 rand kwabuyeke kwaze kwafika isikhathi sokuthi ngihole impesheni kusho ukuthi ngiyengazi ukuthi ngisebenzise mangiholile ngishiye ukuthi ngikwazi ukuthi ngihambe ngekliniki akungiphathi kahle kungiphatha kabuhlungu ngoba phela imali ziningi idingo zayo engabe leyo mali ngisebenzisa ezinye izinto kuyona lengigibela ngayo ngingathanda ukuthi abasebenzi bakhona bakwazi ukuthi basinakekele ngendlela efanele singadlali kuze kushona ilanga khona bayenza ukuthi bathi imithi iphelile ayikho mangabe lo muntu kufanele uthole nako ukuthi bangakhulumi kahle ngesikhathi somsebenzi baxoxe bebodwa nje isikhathi sibe siqhubeka benganinakanga
ngisebenzisa injustice clinic inkinga esibhekana nayo ukuduka kwamafayili kwesinye isikhathi uyayithola kwesinye isikhathi ungayitholi ngile eklinikhi last month ngoJuly 23 ifayili yami ayitholakalanga base bangifonela besho ukuthi ifayili yami ayitholakalanga ngokuthi ngase ngisizakalile ngalithola usuku lami engizobuya ngalo injustice clinic ngisebenzisela ukulanda i-treatment yami ama-RVs
Enye inkinga engibhekane nayo implant iyangihlupha, kwesinye isikhathi ingalo iba buhlungu, kwesinye isikhathi ayisebenzi. So bengingacela ukuthi bengisize ngizokwazi ukuyikhipha. Usista engangimtholile wale ukungikhipha wathi sengizophinda omunye umntwana. Ngaphatheka kabi ngokungatholi usizo. Ngoba kwesinye isikhathi angikhoni ukusebenzisa izandla zami zombili, ngayifaka kwisandla sokudla. Kwabona bakuhlalisa uzube late mina ke ekhaya la eduzane. Kodwa nje ngihamba ngenyama ngeklinikhi eCaluza. Ngiphuma ngo5 ekhaya. Uma ngiphelezela ngishiya enzansi nayo uyasaba phela. Kodwa mase ngizobuya ngiyamfonela sekumnyama ngisenza ubuya kanjani. Awuphinda ngihlangabeze. Bayazi phela bothi baneemoto kulula kwabo. Bazophuma bangena emotweni abasicabange thina sihlala kude ukuthi sihlalaphi. Awunalutho awazi uzodlana. Uhamba ekseni ngo5 buye ngo8 ebusuku ulamba usuku lonke. Uma behamba futhi leyo lunch yabo bahamba undwendwende nje isikhathi into ongayazi. Iclinic iCaluza Nkosi yami. Bese ngifisa nje nami kuyeka kodwa ngazi ukuthi ngempela ngathi ngiyapi mangithi ngiyiCaluza ngendlela enenkinga yakho babuye balahla ama-file. Uthi uya kule nyanga ifile yakhe ayisekho kodwa last month ubuyile yatholakala ifile wakusebenza. Next month mase ubuyela ayisekho ifile. Bathethisa wena ke futhi lapho. Wena uhlangana naphi nefile ngoba phela bona bakhipha ama-file. Bathethisa wena lapho uthi ifile yakhe asiyazi kanjani. Hayi angisazi indaba eCaluza Nkosi yami. Nami ngike ngathi impela ngiyafuna ukuyeka kodwa ngazi ukuthi ngizoyapi mangithi ngiyayeka. Uashdown kude kakhulu nginami. Amagazi ngiyawathatha. Kodwa mase ibuye kwifile ngizibonela mina ngoba sonke sengiphenqa ifile abasho lutho bona. Ngesikhathi ibuye ifile ngithi ngisahleli phela lapho waiting area ngiswe ngiyiphenqela. Ngiyabona lapho ama-results. Mase ngena ngaphakathi hayi into abayichazayo. Ngifela bad because abasinaki ngathi abanandaba nathi into abanandaba nayo ukuthi umholo wabo. Ukuthi lento abayisebenzayo cha abanandaba nabantu shini. Angifuni uqamba manga abanandaba nabantu. Futhi nje bonkone sibakhona akekho engazi ukuthi ungcono kunomunye ngoba bonke bayafana benze ngento eyodwa. Ukuthi ngempela yini engasishini mhlambe ke mangase kushintshe mhlambe noma umphathi ke. Mhlambe ongaba strict nalokho khona asazi mhlambe nakekho strict mhlawumbe mase kushintshe yina kumphathi. Because suggestion box sihlezi ikhiwe. Mhlambe ungase ucele yina kumphathi kodwa futhi nakhona babuye bamfihleke. Mangabe ku late sebe complain phela abantu bafuna ukuhamba bathi bacela umphathi. Uma epho umphathi uvela athi onesi bazama ukusebenza bathi into abayizamayo ngasobentanta lapha phambi kwethu sibabuka. Ayikho into abasobe beyisebenza.
We now move to our community members who have joined us here today.
Sanibona. Anonymous. Izokhuluma iclinic yangakithi impumelelo eDankop.
I'm here to speak about my problem that I have at Mpumalelo Clinic at Dorinkop.
Ngangile eclinic ngiyocela usizo ngifike ekseni ngo10:30.
I went to the clinic for assistance. I arrived in the morning around about 10:30.
Ngifike ngobambe ulayini.
I joined the queue.
Ngihambe ngize ngifike kulomuntu lo kumele ngisize uqala phambili.
It was until it was my turn to enter the consultation room to get assistance.
Ngithi mangifika kuyena ngimchaza isitori sami ngisondele kuyena ngoba ngiyamhlebela ngoba ngifuna ukuzwa abantu abaningi.
When I got to them, I started whispering because I didn't want the rest of the people to hear what my problem was.
Yena athi suka abengithethisa ebeyibhadlaza lento wonke umuntu la ebeyizwa lokho kuqale kungikhulu.
She started shouting at me, yelling at me until everybody could hear what she was saying and what my problem was.
Wathi suka lapho wathi thina sizingane ezincane asizwa njengamanje uzogcina ngami ngiyakwazi ukuqala ngami ngoba sinenkani.
She ended up saying that us young ones are very troublesome. They would have to attend us last.
Angitshela ukuthi ngihlale phansi ngitshela ukuthi uyadlala ngihambe ngohlala phansi ngithi uma ngibuka ngempela ubiza abantu abangemumva nginami.
She told me to go sit down. At first, I thought she was joking. And then I ended up seeing that she was serious and she was calling everyone else in front of me but myself.
Kuze kufike isikhathi sabo selunch, ehambe elunchini mangaphosisi kwaba i-hour no half engabuyi.
Until it was their lunch time. If I'm not mistaken, it was for about an hour and a half.
Bumebuya aqhubeke nayo lento yakhe bekade yenza lapho ngiphambili.
When she came back, she carried on with what she was doing. And at that time, I was at the front of the line.
Kwaze kwashaya iy'khathi zabo 3 ngaze ngagcina ngidikila nami ngishiya phansi ekliniki.
Until I waited until it was 3 o'clock, until I resorted to going back home.
Yebo lo igama lakhe lo sisi uke wakhuluma ngabhuti la emuva, Sister Ntombi.
The name of that staff member is Sister Ntombi. Someone else here has spoken of that person before.
And ukusuka kwami lapho azange ngicabanga ukuya kwenye ikliniki ngoba ngabona ukuthi kushuthi nakhona ngizothi ngiyafika bephinde benze lento abayenzile emumva.
Ever since then, I've never thought of going back to that clinic because I always think of what had happened previously, so then I end up not going back there.
Usizo ngaze ngihamba ngolufuna kumuntu wesiZulu.
I ended up receiving assistance from a traditional healer.
Wilanga lithola khona ke story sami iso leso.
That is my story.
Good day, everyone. My name is Noganda Pongopi. Clinic.
I'm here to talk about my story that happened at Chesterville Clinic.
So it happened, I was an EA by that time. If an EA usebenza Monday to Friday, and I was told clinic. So on that day, February.
It happened at that time. I was working as an EA, and when you're working as an EA, you work Mondays to Fridays, and you don't find time to go to the clinic.
So on that day, it happened umuntu aphume ku1:30. So
that day it happened that we finished work early, around about 1:30.
So I decided let me not go back home and get clinic straight because angizizwa kahle.
I then decided to not go home since we had finished work early. Since I wasn't feeling well, I wanted to go to the clinic. I went to the clinic.
So into ngifuna clinic, I wanted to check status sami, HIV status, and ngifuna ukuhlela family planning, and I also wanted to check ukuthi angikho yini pregnant.
What I wanted to get from the clinic, I wanted to get contraceptives. I also wanted to have a pregnancy test and also check what was wrong with me, and also have an HIV test.
So, mengifika clinic yaseChesterville, security lang attender, lang balisa phansi, and lase lang niki number yongena ngaphakathi.
When I arrived at Chesterville Clinic, the security guard attended to me and he gave me a number so I could enter into the facility.
Uma ngena ngaphakathi ubhuti osizayo ukuthi ifiling phakathi wathi angiqale ngiye kusisi ozokwazi ukuthi angicheck for HIV.
When I arrived inside, the staff member who was at the reception told me to go to the lady who was doing HIV tests.
So ngaya kusisi erumini yakhe wangitest usisi.
I went to this staff member to get HIV to receive an HIV test.
Mengifika usisi angitest right. So usisi mengitesta it happened ukuthi uzongitesta nge-rapid test. I-rapid test kwaphuma ulayini owodwa. Angithi if u-HIV positive fanele kuphuma ulayini about 2. Mina so waphuma ulayini owodwa. And then usisi wathi I need to start some ARVs. Okay.
When she gave me the test came out and it only had one. She gave me a rapid test, and the rapid test only gave one line. So when it gave one line, she told me that I had to start taking ARVs.
So sismengitshela lezo indaba ngase ngaqala phansi ngafonela back ka-MRC because mina ngiyiphese siphensa ka-MRC.
So when she told me of that, I then gave a call to the MRC to tell them what had happened.
So uka-MRC bathi bekuvele kungafanele ngabe ngihambile ngawutesta eclinic because ngajova ama-antibodies aka-MRC kwi-research esiyenzayo e-Arkekana. So usisi akanalo ulwazi kahle. Mina fanele ngibuye ngize back e-Arkekana ngizo-check-a because eclinic basebenzisa i-rapid test kanti e-Arkekana igazi lami liyelapha.
So when I went to the MRC, when I called them at the RRC, they told me that I wasn't supposed to go to them in the first place because they only do rapid tests there. I was actually supposed to go to RK Khan.
Yeah, so bangitshela ukuthi angime kancane bazobuye bangifonele. Ngamchazela usisi
They told me to wait a bit until they called me.
So ngangisengilinde i-call yase-Arkekhan ukuthi bazongibhukhela ngize mhlambe the following day. Akhathi ngisalindile bangitshela ukuthi angihambe ngiyo-testa for umchamo and do family planning kunesi othize khona.
So when I went there, they told me to wait, and then I went to RK Khan. I did the test, the pregnancy test, that they took my urine so that I could have the pregnancy test.
So uma ngiyena kusisi lo ozongithatha umchamo ne-family planning, then I receive i-phone call yasisigugu wase-MRC engichazela ukuthi from now on kuzoyenzakalani or ngizofika ngaluphi usuku. Akhathi engichazela usisigugu ngacela usisi lo onesi ukuthi ngibesacela ukuphendula le call because ibalekile because usisi lo ngale waka-HIV usa-insista manje ukuthi ngithathe ama-ARVs ekubeni mina fanele ngizwe from i-Arkekhan ukuthi do I really need to take ama-ARVs or I need to check qala nabo before ngithatha ama-ARVs?
So when I went to the MRC, I received a call. I asked them to go outside so that I could take my call. I took my call, then I came back inside. Then I spoke to the other staff member and I told them, and I asked them if I really had to take ARVs since the rapid test had only showed one line.
So ngisakhuluma ke nosisigugu wase-MRC unesi lo okakufanele athathe umchamo wami angenze family planning waqoqa into zakhe waphuma wahamba ngangitshethe uyabuya not knowing ukuthi useyahamba uyaphuma ngesicapha because vele nami ngafika around about 2. So shuthi kakuseyisikhathi sabo sokuthi bahambe. Wathatha impahla zakho sisi wathatha isikhwama sakhe waphuma wahamba thinking uyabuya because ngimile mina la ngimene nojeke lo umchamo ngitshethe uyabuya wahamba phindanga wabuya sisi kwaze wafika istaff sakhona sathi sisi sekhanjiwe lekhaya usungahamba nawe. Kathi mina how kwathi usehambile umuntu adeksize and siyavala manje lapho bavala it before 4.
So when I came back into the consultation room after taking my call, as I entered the consultation room, the staff member was coming outside. When I saw her going outside, at first I thought she was coming back. I sat down and I waited. I waited for long until another staff member came in and asked me why I had been sitting there since the clinic was now closing. And at that time, it wasn't the closing time.
Yeah, ngase ngaphuma ke ngahamba ngiyababona bonke bayahamba bagibele emotweni zabo ayibo ngempela kuyavalwa la yimina ngedwa sesele ngaphakathi ngathi ayi okay shuthi sengizolinda i-MRC ukuthi angifonele bangifonela MRC ngaye Arkekana kathiwa vele nawe kasekuqaleni ubungeke vele uteste nge-repeat test igazi lakho seliphumelephi kuthiwa umzimba wami unama-antibodies that is why i-repeat test ishowa uline owodwa.
So I then went outside. I saw all the staff members were all taking their transports, moving away from the clinic. So then I went to the MRC to tell them my story. They then told me that since I had antibodies, I wasn't supposed to take the rapid test because it was going to show that one line because I have antibodies.
Yeah, just a clinic ayingisizanga ngalelo langa ngaze ngasizwe i-MRC Arkekana. Ngiyabonga.
I was not assisted at all at Chesterville Clinic. I ended up being assisted at MRK Khan.
Ngicela, comrade.
Sanibona.
Greetings.
Zokhuluma la ngeclinic yangasekhaya Impumelelo.
I'm going to speak about Mpumelelo Clinic.
Ngaya lapha eclinic shothi ngithunywe uma ngimthathela amaphilisi ARVs.
My mother had sent me to go collect her ARVs at the clinic.
Isikhathi ngithi kwaku3 ntambama nje ngoba ngaqala nami ngasebenza shothi ngase ngiphuma elitohweni ngaphuthuma eclinic.
I first went to work, and at about 3 p.m., I decided to go to the clinic to go collect those ARVs for my mother.
Mangifika eclinic shothi kunalo sisi igama lakho Ntombi shothi uyanisiza ngamafile.
When I got to the clinic, the lady who deals with the files, Untombi, was there.
Angibuza ukuthi kade ngihlelephi isikhathi sokufika eclinic nileso 3.
She asked me, why did I take the whole day to come to the clinic? Why am I only coming to the facility at 3 p.m.?
Hayi ngimchazela ukuthi mina ngiqala emsebenzini shothi ngasheshe ngaphuma ngase ngikwazi ukuthi ngiphuthume eclinic ngizothatha amaphilisi.
I told her that I started at work and then decided to knock off early so that I could come to the clinic to collect the pills.
Shothi sesintombi ke angithethise Nkosi yami nami ukuthethisa shothi akuyona nje into engathi ngiyayithanda. Shothi angithethise nje isikhathi eside ukuze kuqhamuke omunye malume osebenza eclinic shothi umakhelwane angibize ngiye kuyena.
Ntombi and I had a bit of an altercation where we had a back and fro about why I'm coming to the facility at that time. Luckily, there was a man who works at the facility who is my neighbor, who is the one who came and assisted me.
Malume lo shothi angibuza ukuthi ngize ngane eclinic ngimtshela mina ngizolanda amaphilisi ama.
The neighbor then asked me, what am I coming to do at the clinic? And I explained that I'm here to collect pills for my mother.
Shothi ke ngithi ngisamile umalume shothi acela ikhadi lamakhadi amancane la khona eclinic la ukhiphe ifile ahamba ungicinga le file anginikeze shothi ngidlulele phambili.
So he was the one who asked for the small card that we used to take out the files. He took out the file and I was able to get into the queue.
Mangiqhubeka shothi ngilo ngibamba namulayini ngize ngene phakathi nginese yangineza amaphilisi.
I was able to go through the line and able to get into the consultation room and was given the pills.
Sinye seyitori zami ngeke ngaya futhi khona la eclinic angibanjwe ibhandi.
I have a similar story where I had shingles.
Shothi mangifika la eclinic ngivule ikhadi elincane kuyena sesintombi nje. Buye ekhulume ngendaba le yami endala yabo nje thethisana nje kwakhe shothi nje ngisho nothi umuntu ongekho right Nkosi yami.
So when I arrived at the clinic, Untombi once again raised the previous issue where I had come to collect treatment for my mother at 3 p.m. I there felt that maybe she had some of her own personal issues which she was now bringing to work as well.
Angisize ngiqhubekele phambili mangifika kunesi shothi afika ngineze amaphilisi endlungu kuphela angangijovi anganginikezi nje nama amaphilisi ngicanga ngizowathola.
So I eventually got a file open and was able to consult with the sister who only gave me pills for pain. I didn't get any form of injection, which is what I was expecting because I was in a lot of pain. Thank you.
Sanibonani.
Greetings.
Igama lami nguNosihle wakwaDlamini. Ngisebenzisa iclinic lala eMlazi kwaN.
I use the Umlazi clinic in N.
Inkinga yami engabhekana nayo eclinic kwaN ngathi ngelinye ilanga ngingazizwa kahle ngadecide ukuthi ngeclinic.
I had a challenge with the N clinic here in Umlazi. I wasn't feeling well one day and I decided to go to the clinic to consult.
Yeah, shuthi kwakwi-date yami yokuthi ngiphindele khona ngiyopreventa futhi.
I had an appointment for the day to go and do family planning as well.
So ngenxa yokuthi mangabe uzopreventa uqale wenza ama-test uma kuwukuthi kusuke ngeyona i-date yakho. Mina ke kwakuyi-date yami so ngacela ukuthi bangenze i-pregnant test because ngangazizwa kahle.
The protocol is that when it's not your date or when you're starting to do family planning, you would need to do a pregnancy test. And those who are just returning usually don't get a pregnancy test. She then asked or requested for a pregnancy test on that day because she wasn't feeling well.
Yeah, so bavuma bangenzisa ama-test. I-test yaphuma ithi ngi-pregnant.
I did the pregnancy test, which came out positive.
Ngathuka ke cause ngiyapreventa ngiyazi ukuthi angikaze ngeqiwe i-date yami yokupreventa. Ngazibuza ukuthi how come ukuthi ngingazithola ngi-pregnant.
She was quite shocked because she does know that she's on a form of contraception and was very surprised to find that she is pregnant after all.
Ngacela ke ukuthi ngicela usister owayengenzisa i-preg test ukuthi ngicela ngenzise futhi cause angikholwa ukuthi ngabe ngi-pregnant okwangempela.
She asked if they could please repeat the test because she couldn't believe that she is pregnant.
Usister ke wanqaba wathi hayi sisi ngeke ngize ngikwazi ukuthi ngikuphinde ngikwenzise i-test. Lama results aphambi kwakho iwona awekho amanye ozowathola.
The nurses said to have refused and said, I won't do another test on you. The results that you see are the test results, and that is it.
Yeah, so ngahamba nalawo base bengicela ukuthi next month ngibuye ngizoqala i-clinic ngizoxukuza. Ngagoduka ke ngaye ekhaya kwakuthi kumele ngidecide ukuthi ngibuya sengizoqala i-clinic ngizoxukuza. Uma sengibuya
okay
ngizoxukuza ngathola ukuthi
translation antenatal care. They then told me to come back the next month so that I could start with my antenatal care. I then did go back the next month to start that antenatal care.
Yeah, uma ngifika ngenyanga elandelayo la ngithi ngizoqala khona uxukuza baqale bangiphinda benza ama-test bathola ukuthi angikhulelwanga.
I went for my very first antenatal care visit and they retested me for a pregnancy to find that I am not pregnant after all.
Yeah, istory sami nje ileso.
That is my story.
Sanibona.
Greetings.
Mina ngizokhuluma ngePrince Mshiyeni.
I'm going to speak about Prince Mshiyeni.
Okay, mina story sami sikanje. Mina ngijwayele ukuthi ngiphelezele usisi wami ukuthi ayo collect amaphilisi epilepsy.
I usually accompany my sister to collect her epilepsy medication at Prince Mshiyeni.
So if uzo Prince Mshiyeni kumele uvuke kakhulu. Uyavuka nje ngo past 3 khona.
When you visit Prince Mshiyeni, you need to make sure that you get there very early. We usually wake up at about 3 a.m.
Okay. So if uzoya khona uyazi na ukuthi kumele ukuthi uvuke kakhulu ngobani ufuna ukuba at least i-top 5 yakhona lapho ngoba usufuna ukushesha ugoduke.
You usually wake up very early so that at least you can get to the hospital or that clinic by 5 a.m. so that you can quickly finish with your consultation and head back home.
Inkinga yesiba nayo lapha ukuthi amakhadi nje ayalahleka.
The main challenge is that files always get lost.
So inkinga yami mina angikuthandi ukuba lapho kodwa ngiphoqelekile because usisi wami angimele ahambe yedwa because ngaba nomnini. So inkinga
I personally don't like going there all the time. However, my sister needs someone to accompany her. Since she's epileptic, she could fall at any time.
Okay. So one time sisahleli nje khona sasu number 2 or 3 ngisakhumbuli kahle. Sahlala nje around 5 safika around 5. Kwagcwala nje impela kwaze kwashawa 7. Mekushawa 7 sekunikwa amakhadi. Sixake ukuthi hayibo thina indaba singaniki ikhadi. Naba abantu abafike ngemuva kwethu banikwa amakhadi kodwa thina sihleli.
There's a time where we got to the hospital very early. We arrived at 5 a.m. It then started getting quite full, and cards and files started being distributed to people. However, all those who came after us were given their cards and files while we were still waiting in the queue.
Siqale-ke sibuze manje ukuthi hayibo thina indaba thina siwu number 3 kodwa singalitholi ikhadi naba abantu bengena befike ngemuva kwethu thina kodwa sisahleli lana.
We then started inquiring to understand and find out why don't we have our file when we were the first people to arrive here in the morning.
Usisi ulo wayesizayo khona uneso khona athi nayi ucela ukuthi asibhekele ikhadi.
The lady who was assisting us then said, look, I'll just go and look for your card.
Abuye kuthina asho ukuthi ikhadi ngathi selilahlekile ucela ukuthi asenzele elisha. Inkinga ukuthi uma wenza ikhadi elisha laphayana kumele uqale phansi ukuthi uyobona odokotela and all of that.
So she came back saying that they could not find and locate the card and asked if they can open a new one for her. The main challenge with that is that once you open a new file, you need to go and see a doctor and undertake new tests altogether.
And it's in main reason yes lapha so collect amaphilisi ngobani uyazi ukuthi uma collect amaphilisi uyashesha. But if ikhadi lakho maselilahlekile sekumele uhambe ubone udokotela shuthi uyazi lapho ushuthi uzohamba ngabo 2-3 lapho.
So we know that the only thing that we're really going to do is to collect the medication, which should be a very quick task. However, if the file is now missing and you have to restart everything from the beginning by seeing a doctor, you know that that is going to take the whole day. Thank you.
Thank you, thank you. We will go to recommendations now. But as we are going to recommendations, as I'm listening, I'm asking myself, what must we do as the public healthcare users? Once we go to the clinic early, nurses are complaining. When we go to clinics within time, they are complaining. If we wake up at 4 a.m., they say, hi, you're coming ill. If you go to a clinic before 4 o'clock, services are not there. But I think also, comrades, as we are moving with these engagements, we need to invite trade unions of nurses, your NEHAWU, your DENOSA, your HOSPESA, your PSA. They must come here. Because when they fight for salary increase, we are suffering as patients in those clinics. When they have disputes with the department, they disrupt services, we do not get treatment. I think we need to talk to their unions. If the authorities are failing to sensitize these nurses, we must take it upon our shoulders to engage with them. But also, as I am listening here, colleagues from CDC, UNAIDS, Department of Health, PEPFAR, Global Fund, civil society, everybody, we need to ask ourselves, why are we not meeting the targets as South Africa? Maybe these grants that are coming from Global Fund, PEPFAR, are invested into wrong reasons. Maybe we need to invest money in our Global Fund, PEPFAR, and everybody on a program of sensitizing healthcare workers, in a program of engaging them to respect the constitutional rights of the citizens, to respect the patient's rights charter. Because at the end of the day, listening to all these stories that are being shared by the people, we're gonna leave you with your clinics and your medicines. And we will decide to stay at home and die there. Because going into those clinics, it therefore means it does not serve us. So you need to decide where do you want to invest your money. You want to invest your money in clinics that will be empty, purchasing medicines that we are not going to take, deciding to die, because we are being stigmatized, because we are being insulted in these clinics. If it means, as the communities, we must take that decision, let it be. But when you go to all these platforms and report, you must tell the truth as to say why South Africa is not meeting the targets. You must tell the truth. Going to recommendations, comrades. From November 2022, ensure the updated 2020 adherence guidelines are implemented that state that files are not required for RPCs, facility pickup. People living with HIV should go directly to the pickup point in the facility to collect their antiretroviral treatment refill. By November 2022, improve the functionality of the filing system in the 29 facilities observed in a bad condition. By February 2023, open the grounds for clinics by 5 a.m. to ensure safety of public healthcare users waiting to access services in the early mornings. By April 2023, extend facility opening hours as per the National Department of Health circular from 5 a.m. to 7 p.m. on Monday to Friday. People living with HIV should be able to use these extended opening times to pick up their ARVs. By April 2023, appointment system should be put in place, including appointment times, to ensure efficient service delivery and to reduce waiting times. Appointment times should be spaced across the day and make use of afternoons before the facility closes. By April 2023, the KwaZulu-Natal Department of Health, Broadreach, and Health Systems Trust should work together to reduce the burden on facilities by getting more eligible people living with HIV out of the clinic and into external pickup points or community adherence clubs, and extending ARV refills to 3 and 6 months supply.
The next group of issues are on ARV collection. The revised National Adherence Guidelines, Standard Operating Procedures, note that time constraints are a challenge to many people living with HIV, and that efforts should be made to support people living with HIV with suppressed viral loads to receive extended refills and or be enrolled in repeat prescription strategy. Implementing this is vital to supporting improved long-term adherence. Unnecessary trips to the clinic just to collect an ARV refill can contribute to people living with HIV interrupting treatment or disengaging from care altogether. Ritshidze data reveals that there has been a major improvement since the last year, with 49% of people living with HIV interviewed reporting a 3 to 6 month ART refill this year, up from 31% last year. KwaZulu-Natal performed second best on extending ARV refills after Mpumalanga, which is the best performing province, where 59% of people living with HIV reported to receiving 3 to 6 month ARV refills. However, only ensuring that 49% of people living with HIV are receiving a 3 to 6 month supply is low in comparison to other provinces, and very low in comparison to other PEPFAR supported countries who are implementing multi-month dispensing much more rapidly. For example, while 51% of Ritshidze respondents in KwaZulu-Natal still received refills of less than 3 months, only 20% of people living with HIV in other PEPFAR-supported countries had refills of less than 3 months. Between October and December 2021, in 21 PEPFAR-supported countries, 44% of people living with HIV received 3 to 5 month ART refills, and 36% received 6-month ART refills. South Africa is far behind in most countries in terms of maximum duration of ART, both as a national policy and a COVID-19 adoption. Repeat prescription collection strategies can simplify and adapt HIV services across the cascade in ways that both serve the needs of people living with HIV better and reduce the unnecessary burden on the health system. Most of people living with HIV interviewed collected at a facility pick-up point, that is 38%, with 35% collecting at standard medicine dispensing, 25% using an external pickup point, and 1% using an adherence club. From interviews in April to May 2022, 91% of facilities reported having facility pickup points, and 91% have external pickup points available to decant stable PLHIV too. In order to be effective, repeat prescription collection strategies should make ARV collection quicker, easier, and more satisfactory for people living with HIV than waiting in long clinic queues. Out of 1,594 people living with HIV interviewed using facility pickup points, 94% thought that they made ARV collection quicker, and 83% of people were either satisfied or very satisfied. Out of 1,051 people living with HIV interviewed, 97% thought external pickup points made ARV collection quicker. 85% of people living with HIV were either satisfied or very satisfied with external pickup points. This is positive and shows that pickup points are working. It is important to ensure that as many clinically stable people living with HIV as possible are voluntarily enrolled in repeat prescription collection strategies that suit their needs. Once enrolled, reassessment should take place at each clinical consultation to understand if people living with HIV are satisfied with their pickup point or adherence club. People living with HIV who are not satisfied should be offered a different option that better meets their needs. In addition, once enrolled in pickup points, every effort should be made to keep people living with HIV active in their chosen model with facility-required rescripting for continuation taking place when due. Of 4,160 people living with HIV interviewed, 41% we spoke to wanted to collect ARVs closer to home. So we should be voluntarily decanting more people living with HIV to external pickup points and community adherence clubs closer to their homes. By getting more people living with HIV out of the facility, we will ease congestion, therefore shortening the waiting times, as well as ease the burden on the people living with HIV who will need to take fewer trips to the facility. All this will help us keep more people living with HIV on treatment. In terms of adherence clubs, these declined dramatically with the onset of COVID-19, where clubs were suspended or reduced to a pickup point. Contracts of adherence club facilitators were then not renewed. The KwaZulu-Natal Department of Health must work together with PEPFAR district support partners to ensure that clubs are revived at all sites, as they play an important role in providing adequate treatment literacy information to ensure people living with HIV stay on treatment. We now move to our recorded community stories.
Ngihlala eTatane.
No, not from there.
Ngasegeza isikole. Iklinikhi engisebenzisayo ngisebenzisa nje isuthi. Ngisebenzisela uma ngabe ngiya nyodokotela noma ngithatha amaphilisi khona. Ngithatha amaphilisi e-HIV. Ngithathele nomzukulu naye awe-HIV. Kenzeka ngelinye usuku ufika ifayili lakho lilahlekile lingekho. Bakwenzele iphepha. Mase sobuyela mhlambe ngenyanga elandelayo ifayili uyalithola iphepha lelo kade ulenzile ngenyanga endlule ulifice phakathi. Kenzeka ufika ekseni uhlala usuku lonke ekliniki. Suke kunzima. Kunzima ngoba mawuvuka ekseni wahlala ilanga lonke. Kwesinye isikhathi usuke ungasiphethe isikhathi ngoba utshela ukuthi ngoba uvukile uzoshesha ubuye. Kungenzekile. Mhlambe nje lize lishona uzubuye. Mangabe kukuthi angikho ekhaya ngihambile. Abantwana engihlala nabo abazukulu ngibashiya kwamakhelwane. Mhlambe mangenzeka ukuthi ekliniki mhlambe sithole amaphilisi enyanga ezintathu noma ezu6. Mhlambe kungake kube nomehluko kube ngcono. Yebo siyalithatha igazi. Basichazela ama result ukuthi mahle noma awekho right. Iphepha ufica phakathi. Ama result akho afica phakathi uyabonela. Hayi cha angikwazi ukuthi chaza. Ngibona nje inamba ukuthi hayi kushuthi ngconywana. Kuyasho la eceleni ukuthi CD for
Before bengisebenzisa idindeli bengilanda imedication yami ama ARVs khona including ne medication eBP. So izinto za right ke idindeli yase yathi iyangirefer to my nearest clinic, which is iCaluza clinic. Mangifike eCaluza clinic hayi ngifike ngivule file kube right. Kuthi after maybe a month okokuqala ngayithola kahle nje medication yami on my second appointment ngibatshela ukuthi because benginetohe kade ngilitholile ngabatshela ukuthi leli toho leli ngigada umntwana and umntwana ubuya ngabo 12 kasi mina imanisho kanjalo it's okay ngadlula honest ufanda ukuthi lo 12 angishayela khona. Okay, after that ke ngangabe ngisaba consent ukuthi ngikwazi ukuthi ngiqekelele ukuthi ngilande medication yami because so ne medication as well ngiyidinga but into ebaleke kakhulu ingane ifuneka zibe nempilo. Ngiyafundisa, ngiyarenta, ngiyenza yonke into ngemali. So ngadecide ukudefault. Kuyimanje mina ngidefaultile just because of iclinic. Ukube yes okay angisho ukuthi kanjani nami ngiyazi ukuthi umphefumulo wami lo impilo yami. But at the same time abasimithe halfway. Medication nje ayiyona issue uma ngazeli uzothatha amagazi medication mangifice sengilindile ngithatha into yami ngiyaphuma ngiyahamba simple lento nje ayidingi nokuthi kuze kube kanti even ngathiwa uzothatha amagazi ngiyangena uthi sengathenda ngithatha amagazi ami ngiyaphuma ngiyahamba ngetohweni ukuze kwazi ukuthi impilo ukwazi ukuthi iqhubeke ngoba siphethe into eningi empilweni asiphethe into eyodwa kodwa bona bakwazi ukumithana nedingo zethu halfway ukuthi basebenze ngokuzikhandla. Kuyimanje mina bese ngithi ngizoqamba amanga ngihambe ngekwimobile lefika la ngasemakhaya ngolesithathu but this September njoba ku September manje ngenza unyaka so I'm almost 10 months ngingekho kwi medication. Bayawalka nje bayawalka bas attend bayawalka bashonale bathatha ikhoma zabo bayelantshini abuya attend 4 patient emva kwalokhathi nizobona abantambama hlaleke manje nolento sister abantambama hleli nengane la mayiquleka lengane awuna ngishishumi mayiquleka lengane izokwenzakalana uzothi ubungayiphathelile ngane isikhaftini kwasekhaya uphuma kulona bayazi ukuthi kwenzakalani.
Mina ngisebenzisa iclinic. Ngisebenzisa iclinic imedicine. Ungisebenzisela ngilanda treatment ama ARVs. Ngiphume kodwa njengamanje sengiwathatha ekhemesi. Mangiwathatha ekhemesi eclinic sengiya ngokuyothatha amagazi nokuyovuselela. Ngizothini kumina ku right kimi kwathatha ekhemesi ngoba imedicine iyasiqhelaza kakhulu. Uyafika ekseni ngo7 ukube uyophuma ntambama ngo4-5. Yefana nje kugcwele nje kuyinto eyodwa kule clinic. Nje kuyangijabulisa ukwathatha kwami ekhemesi. Bathi benzela ukuthi ngingezu ekhemesi ngoba kubanjwa layini. Ngingezukuhlala. Ngizofika nje ngithathe parcela yami ngiphume ngihambe. Nihleli nibambula yini ukufanele uthi ungene iminyango ukufanele ungene lapha eroomini kuzongena omunye azongena azoxoxisa ungene elinye inesi ezoxoxelisa elinye inesi uzokhulunywa uzoxoxa nje indaba lapho ke nina ke senihleli kanisalo kuza awusaqhubeka kulayini nihleze edulweni linde ebona besaxoxa. Akusiphathi kahle kodwa phela manje ke isuke ingekho into esizoyenza. Siyabekezela sibezela ukuthi nje uboze besinaka ngaso isikhathi abasinaka ngaso.
Mina njengami njengoba nje ngithatha ehholo. Ngakhishelwa ehholo. Makwenzekile yangishiya imoto ngayifica. Manginaso isikhathi ngoba iyashesha ukufika. Ngiyayilandela ngaleso sikhathi. Ngiye eclinic. Akuba nankinga ngifike nje ngikhiphe ikhadi nginike into yami. Mafike ehholo imoto ifike nje ime inike ivule ngemuva ngikhipha amakhadi. Anbize ngizothatha amaphaseleni. Besibiyathi.
Sanibonani. Greetings. I'm anonymous from Efolweni in Mbumbulu.
I'm from Mbumbulu.
So umsebenzi engiwenzayo, it's a very busy job. I'm deployed as what commits. I'm also work as EPWP. So kwangijabulisa kakhulu ukuthi seso collector our treatment kwa sharp left.
I was very happy when I was decanted to sharp left.
So usually I collect a treatment yam khona kwa sharp left, of which makes me happy because I don't stay isikhathi eside and I take a medication yam and go, and I get time ukuthi ngibuyele emsebenzini and deal with my job as always.
Overall, getting the treatment at sharp left has been quite easy. You get there and you collect your parcel and you're even able to go back to work.
So into eyenzakalayo eFolweni clinic, if sekufanele uvuselele, because even though we take our pills there, we have to go inside the clinic enkulu and uvuselele or mekusuku lakho lokuthatha amagazi.
So there is a slight challenge, especially if it's time for you to renew your script or it's time for you to take your yearly bloods.
So last month, September, I had to go collect amagazi and also take ngivuselele.
In September, I had to go take my yearly bloods as well as renew my script.
So when I get there, there's this nurse, Sister Makanya, of which she's a very big problem to almost wonke ama patients as a following clinic.
Mangfika ngathola uSister Makanya and uyinkinga to abantu abaningi abasebenzisa iclinic.
And then, inkinga yaqala when I get there around about 6:30 to 7.
The problem starts, and mainly it starts because I arrive at the clinic at about 6:30 to 7.
Ngingene ngifake ikhadi and then ngathola file around about 11 to 12.
So even though I've arrived at about 6:30 to 7, I'll only receive my card at about 11 a.m.
So, uma uthola ifile ngaleso sikhathi, you know ukuthi vele you will start to kusetshenzwa around about 01 ngiyale, because go 11:30 to 12 by lunching vele suke sesilazi udaba.
So you do know that if you are to be given your card at about 11 a.m., you know for a fact that you'll only be seen after 1 p.m. because between 11:30 to 12ish, people are all going on lunch.
So when I get in around about 01 labo, Sister Makanya, there was a patient coming out, and then when I was going in, then this patient said, okay, you can come in because uthe ungangena. And then mangingena, and she was like, "Huba uthengena?" I was like, "I patient ephuma ithe uthe ngingangena."
So there was a situation where it was my time to now consult with the sister inside the consultation room. As the previous patient was walking out, she said, "Oh, the nurse says that you can come in." When it was her turn to now go into the consulting room, the nurse asked her, "Who asked you to come in?"
And then mangena ungibuza kanjalo, I was like, "I patient ithangeni wathi I patient ifanele ikutshele noma fanele utshelwe yimini." I was like, "So yena bedlulisa umyalezo to me osho when." And then
she then explained that, I then explained to her, "No, the previous patient told me to enter the room." The nurse then responded and said, "Who is supposed to tell who to enter the room? Is it the patient or is it myself as the nurse?"
So kwaba ukuthi masengenile ke sibe naloko khilizisana ukuthi usaid angene in, and then wase wangithumela ke ukuthi okay, then ngiye emagazini and all of that ngaye emagazini.
So
And then
after our mini altercation, she then sat down with me and told me to go and get my bloods done and sent me to all the various departments that I had to go to in the clinic.
that is when after September, and then ngomhlaka 1 this month I had to get my results. The very same nurse, Sister Makanya, that's being getting gimbon, of which I was so shocked ukuthi my patient didn't want to go with room like they were denying with my files able to go in with room like they wanted another nurse.
On the 1st of this month, I was meant to go and collect my results. And what I've actually found at the facility is that a lot of patients don't want to be seen by Sister Makanya. A lot of patients avoid her, and this really surprised me in the beginning.
So, mase ngifikile ke kuyena, and then waphenya my file, wabuka my results, what's my very low, my viral load is low, I should go and see counselor.
I then went into the consultation. She opened my file and explained to me that my viral load is low and that she's referring me to counseling.
And then I asked Uguti, okay, my viral load is low, I should go and see counselor. What is really a problem? Because I've been taking my pills very well. So yeah, now what is the problem that I bonai? Because I don't even understand lama results lao.
I then ngambuza ukuthi okay mawuthi uyangirefera for counseling yini emoshakele, what is the problem kahle kahle? And I tried to get her to explain to me what is wrong with the results, because I didn't understand what was going on and why she was referring me to counseling.
So wang refer, then I took my file we counselor, and then when I
got my file and went to the counseling as I was referred.
Mangfika ku counselor. First thing eyang shocker is that a counselor is a very private person, but when I get there, there's someone kukhulunywa naye izinto ezi very private kuvula umnyango.
What shocked me when I went to go see the counselor is that I understand that counseling is a very private thing. However, when you walk into that room to get the counseling, the door is wide open.
And then bese kuba ilo munye ke usisi who's a counselor then called me in ngangena and then wavula ifile yami wangibuza ukuthi okay what is going on.
So I was then called into that room. A lady opened my file and then asked me, okay, what is going on with you?
And then I was like, mhlambe I should be the one asking what is going on. Because number one, I've been given a file, ngatshela ukuthi my viral load is low, angizela. So I think you should be the one briefing to me ukuthi what is happening. Two, I don't even understand ukuthi why you wena obuza mina instead of me asking you. So wayivula ifile wabona what everything be right in and then wathi why ngingayidli treatment yami kahle.
So she opened my file and we had a bit of an altercation where she asked me what was wrong. I said, well, I should be asking you what is wrong because I'm here to understand more of that. After that, she then asked me, why are you not taking your treatment properly?
So do you understand ukuthi file is about your life, but you patients make I file nempilo yakho kube ngathi iphethwe ithina more than you. Ngathi mina
I was told that by her that you should realize that this file is pertaining to your own life, but as patients you tend to make the staff accountable for your own lives through these files.
Then that's when I revealed to ukuthi they are not even explaining to us ama results ethu ukuthi achaza ukuthini.
I then told the counselor that, you know what, the nurses don't even explain what these tests mean each time we take them.
Because I've asked a previous nurse that I've seen ukuthi, what is going on? What are these big words mean? Because I need to understand my results achaza ukuthini. I have to know what this means. Okay, I can know what this certificate count mean. But what are these other big words mean? What should I do? What I should not do? How I should do? And all of that. Because I'm blank. Otherwise, the answer from her was, you should be asking. I should not tell you because it's your responsibility ukuthi wazi ukuthi kwenzakalani ngapha. Ngathi ekugcineni kodwa kukhona konke, you are the one who should explain wathi if sithule singakhulumi ngama results akhe sebuyile, that means are right, but uma futhi esebuyile sakhuluma, that means are wrong.
So during the altercation, what came up basically was that the counselor said to her, you should be responsible for your own life in a nutshell, and that you should be asking questions about your tests and how that is going. And in most instances, if there's nothing wrong with your results, then we won't say anything. We'll only raise it when there's something going wrong. Thank you. Thank you.
Sanbonani.
Greetings.
Anonymous. Kodwa before ngichaze ngestory sami saseclinic yangakithi ngiqhamuka eGroundville.
Before I get into my story about my clinic, I am from Groundville.
Ngizocela ukuthi ngiqale ngichaze ukuthi why ngibe anonymous ngoba akuyona into engijwayele ukuba anonymous, ngijwayele ukuthi into ngiyiface.
I want to explain why I've chosen to be anonymous. I'm usually not one to shy away from being public, but I want to explain why I've chosen to take this decision of being anonymous.
Eminyakeni angazi emingaki edlule ngeke ngaba nenkinga noneso sasitenge sibhedlela.
A few years ago, I once had a challenge or a problem with a nurse from Stanger Hospital.
Kushuthi awaye ngihlukumeze ngakho ngasuke ngakusho emagroundini kukhona ngisho nabaphathi basisibhedlela.
She abused me to a extent that I was even arrested in front of the managers of that specific hospital at a sports ground.
So ke kusho ukuthi lapho ke umphathi wesibhedlela saseStenga wayesethi kufanele ukuthi ngivule icala ngalivula icala.
They told me to go and open a case, of which I did do.
So ke mase ngilivulile icala ngithe ngisathi ngisalilandela ngiloke ngiya esibhedlela bengifonela engifonela umphathi wesibhedlela iStenga loke ngiya. Kwatholakala ukuthi ngagcina ngingasayi khona icala la kusho ukuthi kwaba ukuthi liyashabalala loba ngangasal attend ngenxa ukuthi unesi wayesengithengele inkabi sengifunakala ngaze ngabaleka ekhaya.
So even though I was told to go and open the case against the hospital, my life was no longer in danger as I was basically sent, there were hitmen that were sent to assassinate me.
So that's why ke ngingakwazi ukuthi ngiphumele ubala ngoba ngiyasaba ukuthi mhlambe ngase kubuye kungiphinde lokho kangenzayo before.
That is why I've chosen to be anonymous, because I want to protect my life.
Okay. Mina ngisebenzisa iGroundville ngilanda kuyona ama ARVs.
I use Groundville Clinic, I collect my ARVs.
Before bengi right bengifika ngosuku lwami ngingekho idate engijombayo.
In the beginning, I used to stick to all of my appointment dates, and I used to make sure that I don't miss any of those days either.
Baze bagcina ke benginike leli khadi leli ngingazi ukuthi MD bani lele wenza ukuthi uyowalanda emalukhuzana emakhemisi amaphilisi akho.
Eventually, they did decant me to CCMDD, and they gave me a card for that.
Amaphilisi ami ke bengalanda eDiscam izikhadi lami before lalikade libhalwe uClicks ngahamba ngaye eClicks bafike bathi awekho amaphilisi ami lana angihambe ngiyobheka kwenye indawo ngaze ngayobheka eDiscam ngawathola khona shothi babebhale ikhemisi wrong.
So initially they had written that I must collect my pills at Discam. When I arrived at that particular pharmacy, I got there and they said that my pills are not available and that I should go and check which pharmacy that they've sent the medication to.
Okay, kwaba mnandi ke ngoba ngase ngithola ukuthi akusekho kungisondeza eclinic eGroundville.
It was a very good experience because there was nothing that made me go to the facility continuously.
Yeah. Kodwa manje into efike besiqalekiso ilapho sokufanele ukuthi uye khona eclinic yangakini uyothatha igazi uphinde ulokhuze uphinde uvuselele.
The challenge comes when you have to go and do your yearly bloods as well as renew your script for the pharmacy.
Ngihamba ke ngibe nenkinga yokuthi kunenkinga yokulahleka kwama files.
The main challenge is that there's issues of files getting lost when you're visiting the facility.
Bebengenzela ke ilokhuzani ifile entsha ukuthi special leso uma ngabe sengiphinda sengibuya ngiveza leli khadi leli labo uthola ukuthi sokubuya le yendala futhi ekade yalahleka.
So each time I would go, I would get there, they'd say my file is lost, and they would create a new file for me, and then I would use that file. When I go back the next time, my old file is then recovered for me to use on that particular visit.
Yeah. Manje ke khona la ke abuya khona ifile yami ngathola ukuthi ifile yami isibuya isumqumbala lomkhulu isingangeBhayibheli ngaxaka ukuthi ngabe senginezifo ezingaka yini lezi seyigcwelele ifile le ngashawa uvalo.
So there's a particular instance where my file came back and it was very thick. I also became quite worried as to say, how many illnesses do I actually have that my file will be this big?
Ngayivula ifile phakathi ngathi ngiyayivula eCenter ngathi ngithi ngiyafunda ngathola ukuthi kuthiwa ngine TB kwabaliwa nje zonke izifo engingazazi ke manje.
I then decided to open the file and I went right into the middle of the documentation and I found that they said that I had TB and other illnesses that I wasn't even aware of.
Kuthama ngiqhubeka nokuyifunda ifile ngathola ukuthi ifile akusiyona yami le phakathi ngifunda izifo zomunye umuntu engikhola ukuthi zimfihlo yakhe nonesi nodokotela hayi ukuthi zaziwe na yimina ile file ifakwe phakathi lana ingakho amafile abantu engatholakala.
I then realized that no, actually this is someone else's file which happened to be put in the middle of my own file, and clearly this is information that was only privileged to that particular patient as well as their nurse, which made me realize again that actually the files are actually being combined with someone else's file, which is why they get lost.
Ngasukuma ke ngaqonda omunye unesi ngamtshela ukuthi nesi kunefile ela engingayazi ukuthi ekabani ngamfundela igama layo ukuthi kuthiwa ubani lo lapha phakathi ngase ngimtshela ukuthi nesi uyayibona ke into edala ukuthi ama files alahleke na.
I then confronted a nurse and said, look, there's someone else's file inside my file, and even gave the nurse the name of that particular patient, and then also explained to her that, do you see why files do get lost?
Esikhundleni sokuthi angiphendule kahle wangiphendula kabuhlungu ngasigcina ngemtshela ukuthi why uma ngabe bese sebeqedile ngama files ethu abasho ngani sigoduke nawo siyoyigcinela thina abanikazi bawo kunokuthi azolahleka kubona.
Her response wasn't very pleasant, and I ended up asking her, okay, if you can't take care of our files, why don't you just let us go home with them, because we will be able to take care of them ourselves.
Wangitshela ukuthi ngoba mina nakho ke sengazi kakhulu yini pho ngingabi mina engiqoqa ama files la ekhaya.
She then said to me, well, you seem to be a know-it-all, so why don't you just come and be the one who sorts out all the files in this facility?
Ngaphatheka kabi ngoba yena kwakufanele ukuthi abonge ngoba ngimtholisele ngefiles engazi kahle ukuthi kade yayicingwa umnikazi wayo waziwenzelwa entsha.
This didn't sit well with me because I was expecting her to at least appreciate that I found this file, and I'm even pointing it out to her, especially because the owner of the file would probably be looking for it as well.
So ke lokho beyikhona bengenza ukuthi kwesinkathi ngiyithole ngidefaultile ngoba bengibikelwa uma ngabe kufanele ngiye kule clinic. Ngise ngincamela ukuthi ungcono mhlambe mawukuthi kufanele ngife kunokuthi ngibuye usuku lwami solonakele sengikhubekile ngoba ngiyakusaba ukukhubeka.
This was very off-putting for me, and I even stopped taking treatment to a certain extent, and I even started thinking, you know what, I would rather just die than go back to that particular facility because the whole experience was just very off-putting.
Ngelinye ilanga omunye unesi futhi ngiyile khona ngoba phela bajwayele ukuthi kwesinkathi uma ugibela kwiscan uyayikhumula icathulo kwesinye isikhathi uthi uyabuya ngelinye ilanga sokugitshelwa nazo.
So now I'm going to talk about another experience that happened at the clinic. This is specifically on when it's time to weigh yourself. There are other nurses who will say you must take off your shoes, and then there's others who will say there's no need for you to do that.
Ngagibela kwiscan ke mina ngigqokela amaqhayqhayi ami. Unesi wavana wazobiza abanye onesi wathi wozani phela nizobuka nangu Cinderella akafuna ukukhumulela icathulo wangibiza ngo Cinderella.
So on that specific day I decided to get onto the scale with my heels. The nurse in question then decided to call all of her colleagues and said, come and see Cinderella.
Inhliziyo yami yayibuhlungu kakhulu ngalolo langa. Ngaphinda kulokhu esinye story sesithathu ngazothi uma ngabe ngiya khona lapha ushuthi ngahlala bangenzela futhi ifile isiphinde yalahleka bangenzela elinye ikhadi futhi elisha.
I was very heartsore, and on that specific day my file happened to even be lost, and they had to create a new file for me again.
Mangiya kumbe sengifika la kulandwa khona amaphilisi khona omunye usisi womndiya igama la isibongo sakho uba uphiley ukunikela amaphilisi khona lapha eGradsville omncane nje ngomzimba.
When you get to the pharmacy, there is a pharmacist by the name of Pillay, who is the one who usually gives you the medication.
Sathi sisahleli kanjalo kusho ukuthi ngase ngiphiswe kochama ngahamba ngiyochama yena ehlalele khona lapha ngaphakathi engakabizi umuntu.
I decided to use the restroom very quickly because she was inside the pharmacy, but she hadn't yet called anyone. So I said, let me go and relieve myself very quickly.
Ngithe mase ngithi ngiyabuya.
When I came back,
wazongitshela ukuthi manje mina ngiyangenela.
She told me that I was trying to jump the queue.
Kwalisa mangabe bethi bangikhulumela labe benginabo ukuthi cha lo belandela thina wangafuna ukuzwa lutho wathi ngiphindele emumva kulayini.
When those who I was sitting with in the queue tried to advocate for me and say that no, she was actually sitting in the queue with us, she told her to go right to the end of the queue again.
Nangampela ngagcina ke ngoba kwagcina kugcine yena phela ke ngagcina ngiqale phansi ngayobamba iqueue emumva ngikhala minyembezi.
I then went to the back of the queue and I was in tears on that specific day.
Ngabuya ke wanginikeza wayeseyangikhipha ke lapho ngazi ukuthi ngwalanda elokhuzeni ukuthi ngwalanda ekhemisi la ngangiwalanda khona ngagcina ngenzelwe iphepha elincane nje eliyephephukelayo bathi amakhadi abasenawo lolo phepha kumanje angikwazi ukulanda amaphilisi ngoba selilahlekile angizazi noma sengeqwa ama-date noma sokukanjani ngami ngoba ipheshana nje ongeke ulinake kwathiwa mina fanele ngithenge ilokhuzana notebook.
Okay.
Ngifike ne-notebook.
So it's on that specific day where I was also then decanted to a pharmacy, but I was given a very light piece of paper, which you wouldn't be able to understand if it's got your next date or whatever the case may be. And to a certain extent, I've lost that piece of paper because I was told that I must buy a notebook to put that piece of paper inside.
So le notebook masuyithengile onke ama-date akalandelayo bawabhala kuyona le notebook belokhu bewabhala kuyona izigcwale uma isigcwele futhi uzokwazi wena uzosuka futhi uyothenga enye kuthiwa amakhadi lawa awasekho.
So they say that they no longer have cards to write your next appointment date. So you need to buy yourself a little notebook where they'll write your next appointments. And when that small notebook gets full, you must buy another one.
Manje ngisho uhlukumezekile awukwazi ukuthi ungafaka ilokhuzana isikhalo sakho kwi-suggestion box ngoba bayayivula bakhiphe zonke lezi incwadi lezi ezibachakayo bese beshiya lezi ezikhuluma kahle ngabo.
So even if you do have a challenge, you find that you can't even put anything in the suggestion box or anything of the sort because the facility staff actually open that same box and take out all of the bad things and leave in all of the good reviews that they get from patients.
Uma ngabe kusuke kuzofika izikhulu mhlambe zizosisiza kanjengoba sineyinkinga nje bona basuke sebazi ukuthi isikhulu esithize siyeza.
So generally they do know if some of their managers are coming to either have a site visit or come see the facility. So by that time, they take out all of the bad reviews and only keep in the good ones so that their managers can't act on those things on that particular day.
Khona la ngeke ngafika khona isikhulu besiza ngisazi noma beku usihle zikalala noma bekubani ngalolo langa sasinganakiweke kukhaviwa ama-tracks ukuthi kuza isikhulu esithize sahlala kwaze kwashona ilanga ke lapho.
So there's a specific day, I'm not sure who who came to visit the facility, but I think it's Sihle Zikalala. On that specific day, we were not attended to at all.
Ngiyabonga.
Thank you.
Sanborn.
Greetings.
I'm
not going to say my name. I come from Stenga, Dorenkop. I'm going to speak about my clinic, Mpumelelo Clinic. I use Mpumelelo Clinic to fetch my ARVs, to collect my ARVs. I've been collecting my ARVs from there since 2012. Previously, 6 months ago, I had a challenge when I couldn't go to the clinic to collect my ARVs. When I arrived there around about 9 o'clock before I went to work. When I arrived there, I found Sis Ntombi, who is the one who is responsible for files. She asked me where I was coming from at this time when I was coming to fetch when I was coming to collect my ARVs. So I had to explain to her that I first started at work, to explain that I needed to come to the clinic so that I could get a letter and then come to the clinic afterwards. She then told me to go sit down as I was not serious about my life. I then sat and waited for Ntombi, and then after 2 o'clock I went back.
waphela still waqhubeka kumina wathi kumina uthe uzongitshela mase right angiqhubeke nje ngihlale ephandle ngimlinde.
She kept on saying that she did tell me that she was going to call me when she was ready. I must carry on waiting. She will call me when it was my turn.
Ngabona namhla ayikhathi ziyaqhubeka kuba late ngcono ngiyeke ngibuye ekseni kusasa ekseni kakhulu la bona gojeni ngilathi uzongikhiphela khona.
I could see that it was getting late. I then resorted to going back home until I came back the next morning.
Mangifika ekseni sengafe nje ekseni kakhulu ngenza sure ngafika ngabo past 6.
When I arrived the next morning, I arrived around about 6:30.
Mangifika ke sivula eclinic ngamnika untombi ikhadi alithathe ayogcina ifile ngemuva.
When I arrived there around about 6:30, I gave Ntombi my card and then she went to go and fetch my file.
Mayibuya untombi ngemuva angitshela ukuthi ikhadi lami akalitholi. Mina ikhadi lami ngalibeka kuphi umchazela ukuthi yabo ikhadi ngalibeka la libeka khona mase uqeda ukuthatha amaphilisi.
When Ntombi came back, she told me that she couldn't find my file. She then asked me when I had lost put my file when I was last at the clinic. I told her I put my file where they are normally left, but she told me that she couldn't find it.
Lapho waqhubeka ke wathetha ke wakhuluma ukuthi kwayizona ngimolisa ngekho serious ngempilo yami so yena kadili nje nabantu abafana nami ake ngiphume ngibothi ngize njani.
She then started shouting and saying that even yesterday she was saying the same thing about me, saying that I was not serious about my life. So then I had to go outside until I decided what it is that I really wanted to do.
Ngathi satha ngalosuku ukuyeka stop ukudla amaphilisi.
It was then that when I decided to disengage from treatment.
Kwathi kudlula ke inyanga embili ezintathu ayi kwasho kodwa phela ukugula kukhona egazini.
About 2 or 3 months passed, I then realized that I was feeling that I wasn't taking any medication at all.
Ngahamba ngaya kwenye clinic yangasekhaya edrobheni eStenga.
I then went to the clinic in town in Stenga.
Ngafika khona ngomuntu nje ongazi lutho noma ama-ARVs ongaze benalutho ngaqala phansi ngatesta ngaqala amaphilisi.
I went there, acted as if I had never taken ARVs before. I had an HIV test. They then gave me ARVs.
Kuyimanje ke la ngikhona eStenga bangiphethe kahle badla ngamama ngizathama amagazi bathatha ngesikhathi and mahlezi bengi-adapt ukuthi igazi lihamba kanjani kumina ngiyazathi varalode yami emi kanjani.
Up until now, I'm still using that clinic in Stenga. Everything is going well. When it's time for me to draw bloods, my bloods are taken. When I need to collect my ARVs, I can get my ARVs.
Ngiyabonga kakhulu.
Thank you.
Sanibona.
Greetings.
Nginenkinga yeklinikhi yakwaMashe eGoodwins.
I have a problem of the clinic I have a problem at Goodwin's clinic at KwaMashu.
Ngiqala amaphilisi ngo-2008.
I started taking treatment from 2008.
Ngawadla until ukugcina kwami ukwadla ngigcine kunyaka ophelile ngoMeyi.
I started taking them until it was last year in May.
Sengidifothile sengingasawadli.
I then I had disengaged from treatment because I wasn't taking anymore.
Ngesimo sokuthi kwakhona unesi owuthi mawungenile eromini yakhe abe nokukuhlukumeza until namanje usekhona.
The reason for me doing that was because there was this one nurse who had a very bad attitude. So up until now, she is still there working for that clinic.
Ngithe sengingasawadli kunyaka odlule waluka esho umngani wami ethi awu sanibani usawadla yini amaphilisi.
When I continued to disengage from treatment, my friend then did notice and then started asking me if I was still taking treatment.
Wathi ngiyakubona amaphilisi awusawadli bengisazi ngesikhathi sethi sokugwinya ubungakhohlwa isikhathi sakho kade ngagcina ukuzwa uthi yolanda amaphilisi.
She told me that she could see that I wasn't taking my treatment anymore because when it was time to take our treatment, we would take our treatment at the same time, but that was no longer happening.
Ngamchazela ngathi hayi mngani wami amaphilisi angisawalandi ngesimo sokuthi bengithi mangene eromini lo assistant ngamchaza ukulwa sesituyeyisa mawungene kuyena uthi mawuzongena kuyena uyabikelwa.
So I explained the reason to my friend that I had disengaged from treatment simply because there's this one nurse who has a very bad attitude. As soon as you realize that you need to go to her for assistance, then you start getting worried as to what is going to happen next.
Washo wathi mngani wami cabangela impilo yakho nengane zakho uzofushiya ingane zakho.
My friend then told me that I should think about the status of my life, the seriousness of my life, and my children, and actually take care of my life.
Wathi usunesikhathi esingakanani ungawadla amaphilisi amtshela senguqedile unyaka.
She then asked me how long I had not been taking treatment. I told her that I had not been taking treatment for a whole year.
Wathi ngicela ukuthi kusasa ekuseni imini ozoyihlupha ngawe ulungise ube ready sohamba nawe uzothetha kudlule kodwa uzobe kunikile.
She told me that we would wake up the next morning and she would accompany me so that we could go to the clinic together, so that she would make sure that I get treatment.
Engangoba ngathi mhla ngigcina khona ukwalanda amaphilisi ukugcina kwami nje ngci bangitshenta ifile yami ilahlekile until ngaze ngayeka khona bengitshenta ifile yami ayitholakali.
Up until the time when the last time I went there, it happened that my file had been missing, and it happened that they told me that my file was missing, and up until now, they haven't told me anything tangible.
Amaphilisi bengiwalanda ngephepha nekhadi lesiqephu.
When I collect my treatment, I just have a piece of paper.
Ngithe sengihamba nomngani wami still futhi ngabatshena athi ukugcina kwami ngagcinani ngabatshena ngathi ngahamba la ekhaya ngilahlekelwe ifile namanje bathe malibheka balitholi bangenzela ngephepha senting namanje lisekhona.
So when I arrived on that day with my friend, I told them that the last time I had been there, they had told me that my file had been missing or lost. So I had not been taking any treatment. I had disengaged from treatment.
Wathi engiphelezela umngani wami sihlele emabhentshini kanje ngathi sengizawungena eminyangweni ngacabanga ngafikela ilokho uthi uNkulunkulu wami ngiyobona lo Satan walo nesike manje.
As we were seated in the waiting area, I started dreading the fact that I had to go inside the consultation room and face that nurse.
Ngithe masengena mina hayi mangifika ngenhlanhla akusiyena hayi ngathi awuthi ngiyitshela inhliziyo ukuthi hayi mhlambe yaza khuluma into eziningi.
When it was my turn to enter the consultation room, to my luck, when I entered the consultation room, it wasn't that nurse that I thought was there. It was a different one. So when I got there, I explained my story.
Igama lalo sister igama lakho uMvelo.
Her name is Sister Mvelo.
Uyena umuntu wangwelikhama kahle akazaza afike la ngoba wangibuza ukuthi hawu ngoba wena ikhadi leli lesiqephu liyasho ukuthi ubuklinika la sonke lesikhathi ngoba kuyasho ukuthi ugcine nini ukuthatha amagazi ugcine ukulanda amaphilisi la ubukephi.
She gave me a very warm welcome. She started looking at the piece of paper with the dates and could see that, she started looking at the card and could see that I am a patient of that clinic, and asked me, and actually could see when the last time, when last I had taken my treatment. And so she asked what the problem was.
Ngayi ukuthi mhlambe uzongithethisa ukungibuza kwakhe.
I thought she was going to shout at me since she did ask.
Ngase ngiqamba manga ngathi mina bengekho bengise Eastern Cape nginakekela uma kwathi pho amaphilisi ubuwadlaphi vele unomngani wami ubeloko engipha amaphilisi kanti sengidla amaphilisi aronke angahambiselani negazi lami sengasathatha igazi.
I then lied to her and told her that I had gone to the Eastern Cape to see my mother. She then asked me where I had been getting treatment from. I told her that I had been getting treatment from my friend, of which she had been taking the treatment that I was not taking, of which it was the wrong treatment.
Wangibuza ukuthi uyazazi ukuthi wahamba udla wapha amaphilisi la ekhaya Nhloboni ngase ngiyamtshela kwakuyinhloboni awukhalo.
She then asked me if I could still remember what treatment I was taking. I then said yes.
Ngase ngiyamtshela ngathi mina ngiyazazi wanginikeza wona wasewathi ngakusasa ngibuye ngizothatha amagazi ngabuya until namanje ngisana ama results angikaka ukwalanda ngifune ngize ngiyobheka-ke ukuze uyabona kodwa wanginikeza wona le nhlobo engahamba ngidla khona.
After telling her the treatment that I had been taking, she then gave me the treatment without any hassles. She then took my bloods were drawn. Until now, I am still taking the treatment.
Bothi mawuthi uyafika khona uyalibika udaba lakho kade ufike ekuseni emabhentshini mhlawumbe ufike nivika amaphara nivalelwe ngaphandle niyoze nivalele ukuthi ningene ngaphakathi eyadini ngoba sekukhona bona.
When you
Nifike
get there,
ngomnyama.
you are seated outside for a long time until they decide to call you in.
Bawuthi mawuthi sicela umphathi bathi nange ayiyakuyena khombisa ukuthi abamsabi ngokusemncane.
When you ask them if you can see the manager, they just point to the manager and show you where she is to actually show that they don't care.
Mina nje ngizokusho nje kodwa nje umuntu engimbonga kule clinic umvile unayo impatho yabantu.
All I can say is that I can thank Sister Velo for that. She's very caring and she does attend to patients' needs.
Yabonga.
Thank you.
Sanibonani.
Greetings.
Igama lami nguSisile Shezi ngwaseHammersdale.
I come from Hammersdale.
So, but I've got a short steward voice. Comrades, my apologies. Comrade, you're gonna come now, ne? But we've got colleagues from CDC. They are supposed to be leaving us at 1 o'clock, but since they are here, I felt that it's important before they leave to say something to us. So I'm told that Comrade Diana is gonna come and talk on behalf of CDC. But before Diana comes in, comrades, thanks to Sister Velo, we want people like Sister Velo to multiply in all clinics. We must appreciate where a good effort is made. But to other nurses who are rude to their patients, we can't keep quiet. Comrades, we are coming from far. We are coming from the time of AIDS denialism, where President Thabo Mbeki, Mando Chabala Msimang never wanted to give people living with HIV antiretroviral treatment. In that era of Thabo Mbeki as a state president and refusing to give people living with HIV treatment, more than 300,000 people living with HIV died. Today, South Africa has the highest number of people living with HIV, but also of people who are on treatment. It is not because our government wanted to do so. We had to fight with our government. We had to be arrested. We had to be shot. It can't be true that after we have won a victory of having ARVs for everyone who's living with HIV in South Africa, we will still have nurses who are ill-treating us. If it means that as people living with HIV, as a civil society, let's identify these nurses, name and shame them in our communities, make them popular in our communities for their bad attitude, let it be. But at the end of the day, we cannot die because we are running away from our clinics because of some few nurses who've got a bad attitude. If our government is unable to deal with these nurses, let the people deal with them. We will deal with them in the best language they understand. Over to you, Dan.
It's very difficult to follow that. So I'm Diane Moroff. I'm the Associate Director of Programs for CDC in KwaZulu-Natal. I'm really honored to be here today. I'm going to just put a couple of comments out there on behalf of PEPFAR and CDC. And I just wanted to reiterate, we are committed to program quality. That is essential and at the heart of everything we do. We support the initiative and community-led monitoring. The experiences of clients are essential to knowing exactly how we're doing. We value the accountability that is provided by the community-led monitoring, and data are essential complements to all the other routine program data we have. In particular, today, what I've witnessed, what I've heard, long lines, issues with filing, issues with privacy, clinic closures, respectful care or lack of respectful care, assumptions about relationships, about who you are as an individual, accountability or lack of accountability, discomfort with providers, access to medical providers, limited access in that case, receiving the correct medical care in a timely fashion, recurrent visits to get the medical care you need, at the ability of maintaining your employment or maintaining your relationships or maintaining your family. A dearth of communication, health communication, not being given your results in a way that you understand and have the time to review them so that you can manage your health care. And then the need for decanting, the real need to get clinic visits less frequent so that you can spend your time doing other things that are important. We're reassured by the improvement in staffing in KZN, the 45 to 55%. That's good. We're trending in the right way. I tend to be a glass half full person, right? 55 is not where we want it at all, but we're moving in the right direction. The needle is moving. The reduction in waiting time, also good, but 48% still say it's way too long, which is unacceptable, right? We want waiting times to be reduced. We believe that these data are critical, as I mentioned before. They complement the PEPFAR data, the Global Fund reporting. The care that you receive is a collaboration. The patients should be working in partnership with providers. Providers need to hear these stories. They need to understand from your perspective what's working and what's not working, and to build the empathy that is clearly lacking in a lot of these scenarios, and to understand what you're going through. We want to be able to use these for program improvement. Your voices should be heard and they should lead to change. And so I just, on behalf of CDC in particular, I'm very glad to have been here today. And I'm very glad that Chad from headquarters and Santana, my coworker, were here to listen, because we can work with implementing partners to help make these actions, to give that voice that you have to lead to change. So thank you, and thank you for all the hard work that's gone into this.
Thank you, Diana. Thank you, colleagues from CDC. Safe travels, Comrade Chad. Yes, we will proceed, comrades, with the comrade who was Comrade Diana. Comrades, there is a question here. The comrade is having a question for you. Ozangapambili, comrade. Here is a mic.
Hi, my name is Bongega Kumalo. I'm a sex worker and I'm also a recovering drug addict. But my question to you, I'm not sure if you are the right person to ask. I've tried to report this with failure. She's my witness. How do you report it when you have been sexually assaulted in a clinic?
But I don't want this to get lost. And I definitely want to follow up with you with the correct reporting mechanism you safe now?
I'm not so sure because always like acted that they will help, but in the end they don't. I can give you my email address.
So as we are proceeding, Comrade Bongeka, I will need your contact numbers. I will talk to the HOD of KZN today, not tomorrow. And if this matter needs to be brought to the MEC today, your matter needs to get the attention of the MEC. We cannot tolerate this. We must get all the details of what happened, when, and who did you consulted in the department, and why they didn't help you. And then we will take it from there. If it means that heads must roll, people must be held accountable. So where are we now? We're going, thank you, Dan. So comrades, we are going to recommendations now. From November 2022, the KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust must ensure every stable person living with HIV is offered a repeat prescription collection options. People living with HIV enrolled in RPCs must be active on the program. PEPFAR to monitor and report on people living with HIV enrolled in RPCs that are more than 28 days late for script by facility. By March 2023, KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should extend and implement ARV refills to at least 3 months supply for all eligible people living with HIV. By May 2023, KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should establish at least 2 external pickup points at each site in order to provide greater access to refills closer to home and at more convenient locations for people living with HIV. KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should continue efforts to restart and re-establish adherence clubs in the province in order to provide people living with HIV with options for quicker ART collection, together with peer support and treatment literacy education. By end September 2023, KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should extend and implement ARV refills to 6 months supply for all eligible people living with HIV. In COP22, KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should scale implementation of repeat prescription strategies to reach at least 90% of stable people living with HIV and ensure 60% are accessing treatment from community models and 20% from group-based models such as facility, community-based adherence clubs. And also it must be noted that people living with HIV should be able to choose modality that suits individual needs. Thank you.
The next group of issues are on art continuity. People living with HIV lead complicated lives and may well miss appointments and even miss taking some pills. When they do, meeting them with support when they return to the clinic helps ensure long-term adherence. But often, when people living with HIV return to the clinic, they are treated badly. This poor treatment and unwelcoming environment is a significant reason for people living with HIV and key population to disengage from care. Many people we spoke to have never missed a visit to collect ARVs. Out of the 615 people living with HIV who have missed appointments, 39% said that staff were welcoming when they came to collect ARVs, if they had previously missed the visit. And 33% reported that the staff provide counseling on adherence if returned to the clinic. However, 13% said that the staff send you back of the queue the next time you come in, and 10% said the staff shout at them. It is also important to note that Ritshidze interviews take place at the facility. Therefore, these numbers do miss people who have already disengaged from care and are not at the facility, some of whom we would hear from today. This table reveals the clinic with reports of people being sent to the back of the queue if they miss an appointment. According to the National Department of Health, this is not required, and the Welcome Back campaign strategy actually states that people living with HIV returning after a treatment interruption should be triaged into separate streams instead of being sent to the back of the queue. This graph shows data across time with steady improvement in staff attitudes since data collection began in the province. In this reporting period, out of 7,946 respondents, 82% of people thought that the staff were always friendly and professional. This has improved since last year, where 75% of people thought staff were always friendly and professional. KwaZulu-Natal is performing best out of all the provinces monitored by Ritshidze on this indicator. However, there is still a way to go to ensure all public healthcare users and key populations are treated with dignity, respect, and compassion at all times. Because Ritshidze interviews take place at the facility, people who have already disengaged from care due to poor staff attitude, some of whom we will hear from in our community stories, would not be at the facility to interview. The department, Broadreach and Health Systems Trust must implement welcoming services to ensure that all people living with HIV and key populations are able to start and stay on treatment, including people returning to care. 78 people interviewed by Ritshidze have been denied access to services for not having a transfer letter across 29 facilities since we started collecting the data last October. This represents just 1% of all public healthcare users interviewed. But given that most people interviewed are unlikely to have attempted to transfer services, it continues to point to a larger problem regarding the communication and policies regarding transfer letter. All sites should be investigated. However, in this reporting period, we are particularly concerned with the following sites. Marburg Clinic, with 15 reports of people being refused services without a transfer letter. Mfundo Arnold Lushaba CHC with 10 reports. And Umzinto Clinic with 10 reports. A reminder that transfer letters are not required in the guiding principles of the re-engagement SOP, which states, if a patient comes from a different facility, transfers in, do not require the patient to provide transfer documents or delay restarting treatment as per procedure in the 2019 ART clinical guideline. 88 people interviewed by Ritshidze has been denied access to services for not having an identity document across 32 facilities over the last year. All sites should be investigated. However, in this reporting period, we are particularly concerned with the following sites. Again, Marburg Clinic, with 14 reports of people being denied services without an identity document, and Mfundo Arnold Lushaba CHC with 8 reports. The majority of facilities monitored in KwaZulu-Natal had 0 reports of people being denied services because of no transfer letter or having an identity document. And it's among the province with the lowest reports. However, again, it is important to note that Ritshidze interviews take place at the facility. Therefore, people who have already disengaged from care due to challenges accessing the transfer letter or not having an identity document would not be at the facility to interview. Psychosocial support is a critical element to ensure long-term retention. When people living with HIV disengage from treatment for any reasons, clinicians need to be sensitized and attempt to expect that and normalize treatment interruption. This way, the narrative between people living with HIV and the clinician will be punitive and more supportive. Will be less punitive and more supportive. Ritshidze data shows that 88% of people living with HIV interviewed in KwaZulu-Natal do know that psychosocial support is available, and the province is performing best on this indicator. The KwaZulu-Natal Department of Health, Broadreach, and Health Systems Trust should ensure that the remaining 12% of people living with HIV also are aware of support services they can access. In addition, again, while KwaZulu-Natal is performing best on this indicator, full packages of psychosocial services are not yet available at every clinic. A full package of services should include provision of individualized quality assured counseling to patients, peer-led patient navigators acting as a bridge between clinicians and patients, mapped network of referral services, optional support groups, and food parcels. As part of psychosocial support, support groups should also be linked to each public health facility that are critical to provide counseling and support services to people prior to testing, post-testing, pre-testing, and those struggling on treatment or re-engaging in care after a treatment interruption. Treatment literacy improves linkage and retention rates as people understand the importance of starting and remaining on treatment effectively. 97% of PL-HIV we spoke to have gotten a viral load test in the last year, and 87% of participants reported that they knew their viral load. In this quarter, 89% of people living with HIV agreed with the statement. Having an undetectable viral load means treatment is working. And 82% agreed with the statement, having an undetectable viral load means a person is not infectious. This remains similar to last year's report, when 89% agreed with the statement, having an undetectable viral load means the treatment is working well, and 80% agreed with the statement, having an undetectable viral load means the person is not infectious. KwaZulu-Natal performed best across all provinces on people living with HIV understanding how treatment impacts their health, and second best after the Eastern Cape in terms of people living with HIV understanding that an undetectable viral load means you cannot transmit HIV. 87% of people living with HIV reported that a healthcare provider explained the results of their viral load test results, down from just 89% last year. The department, Broadreach, and Health Systems Trust must continue to ensure that healthcare providers properly explain the results of viral load tests and use this time to explain treatment literacy, including U equals U, to ensure that people living with HIV understand the benefits of adhering to treatment. Positively, 53 facilities, as shown here, actually had perfect scores where all people living with HIV understand why an undetectable viral load is good for their health. However, at some sites, a substantial proportion of people living with HIV did not fully understand that an undetectable viral load means treatment is working well. 0 people living with HIV at Impelinque Clinic. Yeah, thank you. Just 3% at Willow Fontaine Clinic and 4% at Pata Clinic. 47 sites had perfect scores where all people living with HIV understand why an undetectable viral load is good for ensuring you cannot transmit HIV. Yet at others, few people living with HIV understood that an undetectable viral load means you cannot transmit HIV. Only 3% of people living with HIV at Willowfontaine Clinic understood, and only 4% and Pata Clinic and Taylor's Alt Clinic. The Department of Health, Broadreach, and Health Systems Trust should investigate and ensure that these sites offer adequate treatment literacy and viral load information during health talks and during people's consultations. We would now move to our recorded community stories.
Hayi bayathetha phela. Mangeqisa idate yengane. Ya bayabuza. Bayabuza ngisho ukuthi hayi. Bengakabi nayo imali ukuthi ngize iqondana idate ngingenayo imali. Mawufika ekseni uyama uze kuphele bonke abantu abaseclinic ngoba weqiwe idate. Hayi ngathi nangithi ngicela ukuthi idate yami neyakhe ibe yodwa bathi angithi yena uyaqala. Kumele aqale. Ngase ngithi ngicela bayahlanganiseke nalo munye. Engathatha naye nesifo sokuwa. Ngathi ngicela bayahlanganisa ama-data abo babili.
Nje uva kwakhona kimagazini ngabona amakhono ukuva nje lokuthi mhlambe nje la kama STI yabo kukhona kimagazini vele manje STI make sure kumele uye clinic vele angihambe ngiye clinic mangiye clinic ngidla level ngiqonda neneselo mfana ngitshena ethe imfethu azi kanje ngikwazi ukukhulekela kule yazi ngimule into kanje mhlambe bekuphuzekile ngayithola ngilesi simo manje ngicabanga ukuthi mhlambe iclinic vele yona ngisiza bo kwase yasho lo mfowethu ke ema kanjena kumele ngikuthathe gcina ngithathe negazi yabo nokufunda nje phela emaphepheni yonke into yabo hawu mfethu kangicheckeka yabo mfethu ish mayiqeda kungichecka lo mjita lona thola imline embili ukuthi vele ngipositive hawu ukuthi kumfethu sekushaya isikhathi sakho usayashayisa emsebenzini ungishiya ngihleli kanjalo njengomuntu ngathi ngifuna ngibone ukuthi ngizoya kuphi yabona into leyo ngise confused ingqondo isadingekile vele ngitshela ukuthi ngipositive yabo kufanele uqala amaphilisi makunjena kodwa manje usayashayisa hawu ngicela uthathe inqomo ngayibuza hayibo kanti mina wayelo muntu mhlawumbe ngabibikho mhlawumbe ukuthi anginike isikhathi esanele or abizo omunye umuntu okhona emsebenzini nangumuntu kanje wangiletha ngiye ngakuphi ufike ngisho ukuthi ke kulesi simo umuntu umuntu engasangena nje ongasena nendaba nje nokuthi ke kwenzakalani nalo muntu ngiyaqala nokuthi ngicheck ngathi mina kumanje ngiyazizwa ngihlukumezela ngaze ngawatshela manje ndokunamba yazi mina zekhhlalo namphathi nje uzohlala nami ngazi nje kahle ukuthi ke HIV positive ufune mhlawumbe ungahlangana nomunye umuntu ufuna ukuyivikela yabo kunye ngikuthola sengitholele endleleni nje sengiyibuza uthi khhlalo lami phezulu mhlawumbe bathola amabebe checke ifile lami uthi bebuza ukuthi uyaphuza nephe man yabo basethola njalo ngathi mina yazi sikaza ngisithole isiluleke esanele yabo ngothi phela kwathiwa kwakunomjito wayefika ngaleso sikhathi yabo ngabona ukuthi ke vele yabo ngabona vele ukuthi ke egcineni vele kuzoba sengathi umuntu usanda kufika usephele lo msebenzi ngenxa yami kumele kuphela kulandelelwe ngazizwa ngakwakuthi angiyeke nakhona xa ngihlalele phansi mhlawumbe kube khona umuntu ozoba nalo 2 minutes wami ke yabe ngadvise noma mhlawumbe isikhathi sakhe sasishayisa naye sasho ukuthi yona challenge sengabhekana nayo kakhulu ukuthi angitholanga ukuthi ke nginakekelwe kahle.
Ngisebenzisa ikliniki yasehlobane ngathi nje amaphilisi ngiqala ukudla amaphilisi 2006 so ngase ngivuma kumukela ukuthi ngidla amaphilisi mangivuma ukuthi ngidla amaphilisi ngawadla amaphilisi abanginika amaphilisi apink abanginika wona ke makhambe emva kwesikhathi base bengishintsha banginika amaphilisi amhlophe mabenginika amaphilisi amhlophe angigulisa last year unyaka ophelile angigulisa ngahamba ngawo report ngathi amaphilisi amhlophe enginika wona ayangigulisa bathi awana lutho ifame eshintshile ngaqhubeka ngabatshela ngathi hayibo ngiyalimala bathi ayikho lonto engishoyo uthe ngisuka ngase ngiya kudokotela unkosi usemondlo ngaya kuye kodwa udokotela amaphilisi engiwadlile arong angilimazile ngaphakathi ngabuyela ngabatshela ehlokwane ngatshela uBJ enenye intombazane isengikhohliwe igama layo bathi udokotela wami ungitshela amanga kabatshela ngathi ayangiblock ngibenga toilet ngingachami uma ngabe ufuna ukuthi ngitoilet nje ngisuka lapho ngakhukhumala isisu mangikhukhumala isisu ukudla kuhlalela esikikileni ngiphalazi angasatoilet ngiphalazi njalo nje daily of ngiphalazi nje ngisuka sengicela ngathi ngicela bangishintshe uthi banginike amaphilisi la ehlobana mhlambe ngenzela ukuthi mhlambe bazoyeka ukunikela amaphilisi amhlophe ngathi abangishintshe ngoba futhi khona nongezwani bese ngaphethe kahle ngashintsha bangishintshela kwaZakwe lapho esengolanda khona kwaZwane benginike amaphilisi onke awe BP namanye engawazi benginika amaphilisi engawazi uma sebengitshela kwaZakwe abasanginike lawo maphilisi ngadefaulteka emzimbeni ngagula still namanje ngiyagula namanje ngiyagula la isisu sami singamkala la angizizwa ngapha ngezansi la ngezansi ngigcwala amanzi la ngezansi la cause nala ngemuva ngigcwala amanzi nala ngemuva mangiyobatshela nje bade ngile nginyanga ephelile ngiyovuselela ngiyabatshela ngiyagula ngivuvukele la emkhathini nala eswini ngize ngilimala umthungu angisazi ukuthi ngifike njani sisibhlungu ngiyasha ngaphakathi noma ngifaka ukudla ngiyasha bathi ngithatha igazi bazongitshela imphumela yami ukuthi ithini still namanje ngisabheke khona ke uma ngidla nje ukudla ngiba ngisho ukuthi ngigcine ekseni lokho ngigcine ekseni ngidla isiti nesinko ngiyaphalaza ukudla kuhlala iswini uma ngiya kodokotela bathi odokotela nginelonda ngaphakathi nginama-ulcer uma ngibatshela eklinikhi odokotela bathi nginama-ulcer bathi odokotela bayabheda ayikho lento abayikhulumayo manje angikwazi ukubika udokotela ngiyosho udokotela uthi udokotela uyabheda hayi abathi anginalutho ekubode kubeni ngiyazizwa ngiyagula and ihlobane ngihlukumezile kakhulu ngengiqamba amanga ngengize ngiqamba amanga isikhathi esiningi bengibhukhela udokotela mhlawumbe omunye angibhukhela athi ngibuya nge-1 omunye athi bobuya nge-28 uma sinyanga nge-28 udokotela usehambile kuthiwe ngiyayisayinela mina kanjani ngoba phela ifayila sala kubo ngisayina kanjani mina ingane yami yazi mina ngazi ukuthi ngathi yiluphi ushintsho ngoba noma ngathi uyobika kumphathi wakhona ushintsho ngikubona sibaningi akusimi ngedwa sibaningi sikithi masihlezi lapha emabhentshini sixoxa sisonke thina bale number 2 esinenkinga sesibalekele lapho kwaZakwe lapho uma ufika kwaZakwe ufika ukhipha ikhadi bahambe bobheka ikhalibhodi lakho bakunike ungena indlela
ngize ngiye ekliniki eyaka-G ngangihamba nosisema omncane siba u2 ngithi ngiyolanda amaphilisi ami masifika khona okay ukuhamba kwami ngangithi ngiyothatha amagazi funa khona esifike khona okay ngiwathola amaphilisi kodwa amagazi bagcina bengithathanga bathi angize ngolona usuku okay ngafika nangalolo suku lolo bathetha nje mina lonesi lo owasho njalo wathi angilo mase sengifike ekseni futhi ngingawujoyini ulayini ngivele ngene sengiqonda straight nje kena lonesi lo laba abaseqaleni abanikezana ama-file uyena uqala wathetha wathi ngingafika ngeqe bonke labantu laba abahlelana mengisathi ngiyamchazela hayi nje wangayizwa nje kwamele ukuthi ngiqale emaphansi ngiyangaphandle futhi ngiyobamba ulayini bangithatha amagazi kodwa ama-results angazi ngabona bangineza amaphilisi ipackage eyodwa kodwa bengathanda ukuthi uma abantu befike ekseni basheshe beba-attend kungathi funa khona uma mhlawumbe sekushaye isikhathi sabo selunch behambe bonke emva lokuthi nasi sihleli kumele kube khona nalabo abazosi-attenda bangenzela lapha phakathi ney'nsuku sometimes sisuke sesiqalile ukubhala amaphepha soyeke-ke mina ngisuke ngingekwazi ukulova iphepha ngekhona ekliniki kukhona la engangihamba khona
engangeqe khona i-date lapho sasibhala lapho ngoba nisiyabhala kodwa wathetha futhi omunye unesi wangiphikisa wathi nginamanga nje benginqena.
Ngihamba ekliniki yasemshiyeni la ngithatha khona amaphilisi ami ama-ARVs kwaku June ngithatha amagazi 2022 and then ngifuna ngilanda ama-results ami on July month kaJuly. Mengibuyela month kaJuly ngizolanda ama-results bathi amagazi amawabonakali kufanele ngibuye ngizokwenza amagazi for the next month. Bangenza amagazi mengibuya ngo-August ngizolanda ama-results. Early August ngizolanda ama-results ami esibili kaJuly. Udokotela abuye ama-results ami athi i-viral load yami i-1450 and lokho akungiphathanga kahle neze ngoba kuyo yonke iminyaka since last year ne-previous iminyaka leminye edlulile ama-results wami ayekhombisa ukuthi elami igciwane alisabonakali. So ngambuza udokotela ukuthi kanjani i-viral load yami isikhuphuke kangaka. Wathi wangibuza ukuthi yena ngiyaphuza yini utshwala else ngiyalala yini without a condom. Ngathi mina konke lokho kusho udokotela ngikwenzi but I'm surprised ukuthi igazi lami selingavele libe ne-viral load engaka. Wayesithi ke yena ke usho ukuthi ke ngizokuphindisela emuva kwi-pill count and then ngiphinde futhi ngikuphindisele kwi-counseling. Ngathi mina ngikwazi ukuthi ngiphindele kwi-counseling ngoba ngakutshela lokho kudlula ukuthi ngangade ngi-admithiwe esibhedlela ngoba ngigula nokugula kwami futhi kwaku-related nezinto ezila esifubeni nasemphinjeni. So ngale ngathi ngiyamkhombisa ngizivula isikhwama sami ngifuna ukumkhombisa ama-results ami. Abe udokotela athi get out ngikhuluma nawe unginakile get out of my office, get out of my room. Bese ngiyabuyela kina ngiyambheka ngithi mina why dokotela ungikhiphele iminyango ngoba phela ngisabheka mina ukuthi ngifuna ukukhombisa ukuthi ama-results ami athini lawa kathi ngibuya ewodini. Athi yena hayi okay ngimkhombiseke ama-results kodwa ame lapho udokotela ekutheni ungiphindisela kwi-pill count counseling umphathi ukuthi ngomreportela ngoba angiphathekile neze kahle ngoba indlela udokotela akhulume ngayo ngami okokuqala ngimbheke umphathi mengamfika umphathi ofisini lakhe bese sengicela inamba yakhe umphathi banginikeze ngikoduke ngekhaya ngithatha amaphilisi ami ngiphatheke kabi ukuthi i-viral load yami isikanjena olalonga ngadingekho kanje. Mangifika ekhaya ngimfonela umphathi ngeSunday. Umphathi angitshela ukuthi akekho off sick angobuya ke bese ngibuya ngizombheka. Ngibese ngibuya umphathi ngimbheka ngithola ukuthi umphathi uphuthuma emeetingini. Abese umphathi ucela ukuthi ngikhulume ngingene kulo muntu udokotela ngingangeni kulo dokotela nesingazwanga naye uDr Phatani. Ucela ukuthi ngine kulo munye udokotela. Ngimchaze udokotela usikwenzakalani ngikhipha ifile incwadi leyana naye ngimkhombisa. Hayi udokotela ngichazile kahle yonke into angichazile kahle. Abese uyacela ukuthi mengiphuma ngimlinde umphathi ngoba ngabe ngizwile nangamanye ama-patients ayacomplaina ngayo udokotela lokuthi akawaphathi kahle ama-patient la esibhedlela unokukhuluma nje ngethone engekho right nama-patient. So kuze ube manje ke ngisalindile ukuthi ke umphathi angibize sizohlangana naye umphathi nodokotela lo so sizokwazi ukuthi silungise indaba yami naye udokotela. Nje engathanda ukubona lenzeke emaklinikhi ukuthi istaff sifundiswe naso ngendlela yokutrisa ama-patient. Indlela yokuthi mase istaff sikwazi ukukhuluma kahle nama-patient ngiyacabanga mhlambe namanye mhlambe angenzi kahle kwi-treatment angagcine nawo eyenza kahle kwi-treatment ngoba ukungaphatheki kahle eklinikhi kwenza umuntu ukuthi agcine esiba nokudikibala lokuthi aphindele eklinikhi. Once istaff safundiseka kahle ukuthi
ngihamba iklinikhi yaseHlobane ngo-2008 ngihamba ngamaphilisi ama-HIV. Bekuhamba kahle nje ngihamba eklinikhi isikhathi sami ngigcina kahle nabo bangibeka isikhatheni kahle. Inkinga isuke ngo-2018 mangihanjelwa umfana wami owadunwa abantu bamshuphula lapha phesheya. Ngaba naleyo nkinga ngeqisa inyanga usuka kufanele ngithi ngiye ngale klinikhi anganga ngoba ngangisastressekile mangifika ngafike ngathola inkinga bangithatha nje bangithethisa ngabathi ngiyayibeka inkinga yami ukuthi hayi bengingekho right 2021 ngaba nenkinga futhi ukuthi yena ngashiwa isikhathi ukuthi ngayi clinic afike futhi nakhona bangithethisa bengenzeka kanje bengihambe amaphilisi ami bengwalanda ngo3 months bese ngithumela umfana wami siwalanda kanye kanye amaphilisi uma kuyidate yakhe kube nguye uhamba phambili yena kube nguye oluza idate yakhe azolandela mina ngakusasa futhi kwaphinde futhi kwaba nenkinga ngaxolisa ukuthi lakhona mina kuma ngabe ngike ngaphatheka kabi ngiba neyinkinga bathe mase bengithatha igazi lami alaze lapho abazi futhi nalapho bangiphatha kahle ngangaphatheka kahle angizenzeli umzimba wami onaleyo nkinga ukuthi ngalokho ngize ngadecide ke bantu abami ukuthi ngingabe ngisawalanda amaphilisi impilo yami ngiyayazi baqale kungilethela njengoba nje kade sengingasayi nje ngololo nje balethe basalethile basebethi ngifike basebenza nje njengani abakwazi ukuphatha abantu ngisafisa nje hlobana nje kube nethenda abantu bamukeleke kahle mina ngicela ukwemukeleka kahle hlobana abantu abangisekhona umhlongo
ngokuhlala mina ngihlala endaweni yase-NPA and bengisebenzisa umzinto fix clinic ngade ngithatha i-medication yame-chronic ama-ARVs so kunaloko nje ukuthi uma ngabe ngise-clinic kube khona lokho ukuthi kube ngathi ngachaza ngokuthi kube amandlela abasithatha ngayo abuye unesi sometimes athatha ifile ame phambi ngomnyango la ngaphambi kwabantu afunde ifile yomuntu wabese lo nesi wangibuza ukuthi how sisi namanje lento isakuphethe ngithi mina ya isangiphethe yabona nje uyahlambalaza into eyenzeka esefayilini uyikhuluma phambi kwabantu ngoba lento bekade ngimtshela yona ngasese bekufanele ukuthi into esefayilini yami igcinelekele private ngangaba nokubaba esifundisa ngasese yabo that's where afikile na abuka ifile yami wabona ukuthi nini bekade ngicomplain about isifo socansi wabese wabuza ukuthi hawu namanje sinjani lento ayingiphathanga kahle mina i-chronic ka-ARVs ahlukene abekwe wodwa eceleni wonke umuntu uyabona ukuthi wena uyolanda ini naleyo ukuthi umuntu akubuza ukuthi how come uyi-lesbian and then you have a HIV lokho kwangenza ngo-2019 ngimane ngilokho ngibekezela okubekezeleni kwami ngaze ngagcina sengibona ukuthi no uyabona ke manje sekufikela ngikhathela khona mayelana into enza ukuthi ngize ngihluleke ukubekezela kwangempela ile ukuthi uma ngabe ngibekezele la i-privacy ayikho confidentiality ayikho kodwa ikhona i-room yonesi ne-patient kufanele ukuthi ngabe yonke into i-disclose khona kodwa yena ubuye bakwazi ukuthi bayi-disclose nje noma kanjani nga-2019 ngaye ukuthatha i-treatment ngadla amaphilisi anginawo aphele lo maphilisi into engingafisa ukuthi yenzeke iyodwa mina ukuthi ama-chronic it's either HIV I mean any chronic disease bayithathe ndawonye i-treatment ifile ngedate yakhe uyifica ngaphakathi kunesi njengase-gateway e-gateway ifile ngiyifica pha ngaphakathi kunesi angiphathi ifile ayikho umuntu ongibona ukuthi ngiyokwenzani
Sisiyazi la kwenzeka kanjani kushuthi yena ngihamba ngaya eThekwini sengihambile ngalanda amaphilisi la bangizamela icredit yami ukuthi bela elokhulana ehlobane kanti mangihamba ngeThekwini kusho ukuthi ngithi ngiyabuyela sengifuna ukuyolanda yabo bafike bangithethisa yabo nethi banginikeza kodwa bangithethisa kakhulu kuthi the same time yabo ngoba umuntu ungasahlaliseki phansi yabo kunendawo la ekufanele ukuthi yena ngikwazi ukuthi ngamatoho okay ngihambe futhi ngiphinde futhi ngihambe angethukela fela mangifike ethukela fela nakhona yabo bangithena nje ukuthi yazi thina ngesikwazi ukunikeza amaphilisi ungaphethe namakhadi njengamanje nje uyabona kahle kahle fanele ngikhuluma iqiniso nje amaphilisi ngiyaboleka sefanele hayi mangatholanga mhlambe kumngani wami mhlambe kubani uyabo so manje namaphilisi engiwasebenzisayo ahlukene namhlanje ngidlela ihlaza kusasa ngidlela iphinki elifana nalenza kusasa ngidla eshintshile elimhlophe yabo manje kunzima ukuthi ngcono nje ukuthi mhlambe esibhedlela mangiyakhona noma ngiyalapha neklinikhi ngcono nje ngiye nje mhlambe sengifele ngcono
Ngihlala la eMzinto NPA informal settlement ngisondelela ukusebenza treatment yami engisebenzisa ama ARVs I was diagnosed of HIV I think about 2018 uyafuna uqala manje uzobuya so ngaqala that same day baluza i-patient confidentiality bayasithethisa ifomisile ukuza uze ulanda treatment yakho awuthethiswa confidentially uwedwa like civil njengomuntu omdala khuluma nomunye basebenzisa amagama hashi why wena ube islima uyakuthanda ukuphila or awufuni so ibuyisa leya trauma yokuthi sengiphila nesifo esingeke silapheke lahle ithemba mina nje I lost hope I fell into depression i-support efamily benginayo nama friends abengiphi support ngayi disclose inkinga yami lack of confidentiality ama waiting hours akhona manje anzima kakhulu kodwa siye sikhona ubekezela because siyazi ukuthi ila usituate khona ngenxa yomsebenzi so awukwazi ukuya kwenye indawo uyafika ngo6 ekseni uyahamba nango4 because of ukuthi iclinic incane abantu baningi i-file room space sakhona asikho conducive abakwazi ukuwafuna at the same time ama files wabantu basheshe bawathola kuneyinhlangano ezisiza ama NGOs eclinic kune NGO yaka Brodridge uyabasiza kakhulu abantu abanjenganabantu baka chronic so usister waka Brodridge wazama ukuphusha iqueue naye kunezinye izinto akumele bazenze sasala no sister waka DOH wasitshela ukuthi sisahlaleleni because ku late mind you bayile for itiye bashiya baya for ilunch bashiya sebeyabuya manje kwamele basicedelele kuze bahambe because besha u4 athi yena uyakude kabe ekhaya kubo kwanongoma sithi uzofika nini if sisahleli la awunayo ichoice ukuthi uzothi ngicela mina ungisize because ngilove emsebenzini ukuze ngibe la awukwazi ngoba urude kuwena imagine there is still 15 or 20 wabantu behind wagcina ngempela ehambile ashiya ngasukuma ngayocela kulabo sisibaka Brodridge because ngangibona ukuthi ngathi unice yena ngathi ngicela ungisiza sisi ngithola medication ngihambe because ngilove emsebenzini and spend the whole day ngihleli la wang attend usisi wabantu then nalabo abanye bathola ukuattendeka angazi wabaqeda or akabaqedanga la emzinto enye into engiyibonile abantu baka HIV nabakathi mostly HIV banenkinga yokuthi baya default because abantu bayasebenza if bela etown emzinto abanye magibelini so bafuna ukuprioritize isikhathi sabo mhlawumbe ngelunch umuntu agijima eclinic azothatha medication makafika esho ukuthi ngisemsebenzini ngicela ningi-assiste akekho yini umuntu ongangi-assista ngiyacela akazwakali bese bethatha izinto zakhe ama-credentials akho bewafaka kwikhompyutha aphophe apho umuntu ukuthi uthatha la ekhaya then sebeyamthatha-ke yena uyobaculisa abashayisa i-queue athi abacule bajikeleza isibhedlela bathi bona ba-default
Sanibonani. Ndicela ukuba ngu-anonymous. Ndithatha i-treatment emzinto, ama-ARVs.
I take my ARVs from Umzinto.
Emzinto kuyagcwala.
At Umzinto, it gets very full.
I-process yabo inde.
The process is also very long.
If ufike ekseni, let's say ufika ngo-6,
If you arrive at about 6 a.m.,
igate ivulwa ngo-7.
the gate is only opened at 7 a.m.
Kuqale kuthandazwe kuqala before kusetyenzwe.
There is a morning prayer before they start working.
Xa nisuka emthandazweni niyahamba niye kunonhlalo oyedwa ozosiza bonke abantu balapha phakathi ekliniki.
Then you are consulted with only one person who's going to see everyone who's in the facility.
Ufika ufaka ama-details wakho bese uyasuka lapho uya ekhompyutheni phakathi uyofaka ama-details nakhona.
You start at one section to enter all of your details, and then you move on to the second section is where you will input all of your details onto the computer.
Xa usuka khona uthole base kusemva kwa-3 hours usabhalisa kuphela.
That process of just registering can take up to 3 hours.
Uyofika uyofaka ikhadi lakho lokukhupha ifile.
You then submit another card, which is used to take out your clinical file.
Nalapho u2 hours ungaphela kufunwa le file uzothi emva kwa2 hours kuthiwe ifile yakho ayifumaneki unikwe duplicate.
Again, that can take another 2 hours for that process to unfold, and at times you cannot even find your original file and you're given a duplicate.
Uyasuka lapho soyohlala emkhukhwini ophaya ongenamuntu onakileyo awunafestile kuba nihleli nje nonke phakathi uyakhohlela okhohlelayo kukhona isicabha kuphela.
You go outside to an old dilapidated zodzo that no one is taking care of, where you will all be sitting in there, people are coughing over each other, and you can see that no one is taking any care in that particular place.
If ngomineyo ufike onesi besemudini because mina xa ndiyile nihleze nifike emudini vele bengekho uyafika ungene kuye xa ufika afike akuphendula isinomi kanjani.
If you happen to go to the clinic on a day that the nurse is on a mood, you'll find that they will respond to you in an unsettling manner.
If uyabuza umzekelo ubutsalile igazi njengoba amapilisi mina sendiwathatha epharmacy. If ubutsalile igazi so uyambuza ngoba ama results akasabhalwa ngeyandlela ibhalwa ngawo ekuqaleni.
If you, like for example with myself, I now collect my treatment from the pharmacy. So when you get to the facility and they've taken your bloods either for viral load count or whatever the case may be, and you try to ask what is going on there, you do not get a proper response.
Into abakuphendule ngayo yileyo ba wena qhubeka udla amaphilisi bazokuxelela bona maseyikhona ingxaki.
They simply tell you that, you know what, you should just continue taking your treatment. If there's any issues or problems, they will let you know.
Kwenye game ndaphiya ekliniki ndimise idate. I think bese kuyiphelile iveki ndingayi.
There's another incident where I missed my appointment, and I think I missed my appointment by a week.
So ngoba nisazi vele phandi yakhona banizofike nithethiswe ndibizwe ngazo zonke izinto ukuthi uyimpilo andiyinakanga ndacela usisi wakwa Lifeline abadla ngokusinceda ngemedication bazisa ikliniki bas advise ngendlela okuziphatha ngezinye izinto.
I knew that the reception was not going to be very warm. I was going to be shouted at and scolded at for missing my appointment. So I therefore asked for a sister from Lifeline to intervene on my behalf.
So safika kainalo sisi kwangcono ngoba yena uyazi uba uline akawumi wabhalisa sahamba songena phakathi kunesi.
Her accompanying me to the facility was much better. I wasn't scolded at all because they know her, so she didn't even, we didn't even queue on that specific day. We went right into the consultation rooms.
So masifika phakathi unesa ivula ifile seyibhalwe ngered pen vele.
When we got into the consultation room, the nurse opened the file and already my file was marked in a red marker.
So andibuze kunesi ba indaba ningazange uzothatha i-treatment uthuthi andiyifuni ukudla i-treatment andinandaba nabantwana indaba ningayinakanga impilo yami ndimdala ndifuna ukuncengelwa i-treatment kodwa mhlana ndiyofuna isifo zange ndincengwe.
The nurse then said to me, why didn't I come to fetch my treatment? Why am I not taking care of my life? Do I not care about my children? And moreover, when I went out to go look for the virus, no one sent me.
Abese ngicela njengoba ndimkhulu kangakani bethe u120 esikalini ingculazi so ndidla ndizoshaya o20.
She then said to me that HIV will eat away at even my body weight. As much as you are 120 kgs, it will eat away at your body until you are only weighing 20 kgs.
So ndibese ndimchazela ngingxaki eninayo ba apho ndisebenza khona no work no pay. If emsebenzini andiyanga andikwazi ukuzithengela into endizidingayo.
I then explained that in the type of employment where I am in, if you don't go to work, you do not get paid. And that is the only way that I am making a living and how I can sustain and maintain my life and myself.
So ndabese ndimcela kuba ndicela andikhuphe eclinic andinike i-transfer letter ndihambe ndiyowathatha amapilisi kwa-Lifeline. Lapho ndazikhona ba even if emsebenzini uyile uyakwazi ukuhamba ngelunch ufike uthathe kwimobile yakhona uphinde emsebenzini.
That's when I asked her to at least transfer me or decant me to Lifeline, because I know that modality is much easier. Even during lunchtime, I can go and collect my treatment and still get back to work.
Wanixelela uba ngekakwazi ukundikhupha ngoba thina siyakuthanda ukuphaphela into ezifikayo. Xa seyiphele ya program yakwa-Lifeline shuthi sophinde futhi sizogcwalisa apha ekliniki.
She flat refused to take me to the modality of Lifeline and told me that we like going or flocking towards things that are extremely new. What happens if the Lifeline modality fails? It means that everyone is going to come back to the facility in any case.
Siphela lapha istory sami.
That's the end of my story. Greetings. I'm anonymous.
Mina bengilanda treatment la eThekwini ngase ngakhulelwa ngamuva ngayestenga kubazali bami.
I was collecting my treatment here in eThekwini. I then fell pregnant and decided to go back home and wanted to collect my treatment at Stenger Clinic.
Ngafika ngingayiphethe i-transfer letter.
I got there and I didn't have a transfer letter.
Bangitshela ukuthi ngeke baze bakwazi ukungi-attenda ngoba ngiphethe i-transfer letter.
They told me that they wouldn't be able to attend to me because I don't have a transfer letter.
Bathi ngitshela ukuthi angihambe ngiphindele eThekwini ngiyothatha i-transfer letter mase ngiyabuya khona bezonginika i-treatment.
They instructed me to go back to eThekwini, get the transfer letter, then come back to Stenger Clinic to be able to access the treatment. Thank you.
Greetings. Ngalisho igama lami akunankinga akekho umuntu ongazizwa la ngihlala khona. Igama lami nguSakhile Wamabuza. Ngicela ukukhuluma ngeklinikhi yangasekhaya eNandi.
I'm going to speak about my clinic, Nandi Clinic, next to where I stay, near where I stay.
Ngiqale ukulanda medication kule clinic last year elanga ngiqala khona ukudla imithi ngonyaka odlule.
I started collecting my treatment there last year. That was the first time that I went there to collect my treatment. At that time, I hadn't been working. I wasn't employed.
But then
But as time went on, I found a job. I was employed. That's when I started being interrupted with going to the clinic.
I
used to always receive questions like, can I not get another person that could come on my behalf and collect my treatment?
But then
I then told them that there wasn't anyone who could come on my behalf and collect my treatment. They then told me of another solution they had.
base bengitshela ukuthi kunalabantu la abasebenza emphakathini ababizwa ngonompilo.
They then told me that there are people who work for the community that are called community caregivers or community healthcare workers.
Bangitshela ukuthi if ngingenaso isikhathi sokufika eclinic ngalolo suku engisuke nginiwe lona, fanele kube khona umuntu ozokwazi ukungilandela ama-clinic ngesikhathi ngase ngimthola ke.
They then told me, should I not be able to come to the clinic on my dates to fetch my treatment, then I need to send someone to collect my treatment on my behalf.
Ngiyawathola amapilisi ngesikhathi, but then inkinga yami basekuthenini makufanele ngilande igazi angibe ngisakwazi.
I do get my treatment on time, but the problem starts when I need to take bloods. I can never take, my bloods are never taken.
Inkinga iqale lapho kusefanele ngiyothatha khona igazi unompilo wami engitshela ukuthi ifile lami eclinic alitholakali.
The problem started when I needed to go and draw bloods, and then the community caregiver told me that my file couldn't be found at the clinic.
Then ngase ngisala okay nganikezwa ama-dates nginayo i-dates kune-dates enginayo, but then still nakhona futhi fanele kufike mina eclinic. Ukufika kwami eclinic angeke ngize ngisizakale still ngoba le file le abayifunayo iyona engenayo and abayitholi. Lokho kuwumsebenzi wami futhi ukuthi itholakale kubuzwa mina ukuthi
I was then given a date to come back to the clinic again, but then the problem was that my file still couldn't be found for the information to be seen, for the previous information to be seen.
Yeah, ilokho bandla bengicela nje ukuthi if kukhona into engenziwa ngale clinic yaseNandi elindelani bandla inkulu inkinga ekhona lapha kule clinic, inkinga inkulu kakhulu inkinga lapha. It's not mina kuphela umuntu onenkinga kule clinic, wonke umuntu oya lapha uba nenkinga enkulu, uhamba right ubuye depressed ngaso sonke isikhathi.
I really wish that the problem at Inandi Clinic could be sorted out, because there is a huge problem there. Everyone seems to be experiencing problems when they go there. You go there with the intention of being assisted, but when you come back all sad because you hadn't received any assistance.
Sanibona.
Greetings.
Ngicela ukuba anonymous. Iclinic engikhuluma ngayo iclinic yangakithi iShaka Scroll.
My clinic that I'm going to talk about is the clinic at Shaga's Kraal.
Kuleya clinic laphana kunenkinga yokuthi isifo besikade sikhona njengamanje sidlula kusona, kodwa eclinic mawuye eclinic namanje nisavalelwe ngaphandle.
The problem when you go to that clinic was because there was a problem due to COVID. There were some restrictions so that you couldn't enter the clinic. So up until now, you cannot enter the clinic when you go there.
Nishambe kuthiwa izulu liyana libalele kunomoya nisuke nje nivalelwe ngaphandle.
Even on bad weather conditions, you cannot enter the facility. They close the gates and you are assisted outside.
Enye into eyinkinga eclinic yaseShaka.
Another problem that happens at the Shaga's Kraal Clinic.
Indlela abakhuluma ngayo nani abakhulumi ngendlela nje right kuba ngazuthi mawuze eclinic usugula nangekhanda.
They speak to you in a very harsh tone, in such a way that you are a crazy person.
Enye into engayithandi ngabasebenzi baseclinic yaseShaka.
Another thing that I don't like about the clinic at Shaga's Kraal.
Uma bebiza amakhadi ene abantu abane HIV kuthiwa ene abeza abantu abanamakhadi amahle.
When they call the HIV patients, they use the term where they say all the people with the nice cards need to come forward.
Manje makushiwo kanjalo eclinic wonke umuntu usuke sefuna ukubona ukuthi lihle kanjani lelo khadi lomuntu.
So when everybody hears that, they start wanting to see who are those people. with those files.
Nangendlela esuke nihlezi ngayo akusiwona wonke umuntu osuke okhululekile ngokuthi aziwe ukuthi istatus sakhe sithini.
Even the way that you are seated there, it's not that everyone that goes there who is comfortable with people knowing their status.
Enye into usuzolokhu buko umuntu ungene phakathi enikusista uzokhuluma no sister akavali umnyango wena ufisa uthi indaba yakhe iphelele la phakathi kodwa lo ngaphandle uyakuzwa uthi ukhuluma naye uthini and naye uyashawuda naye.
So when you enter the consultation room, there is no privacy because the door is wide open. When the sister is speaking to you, they are shouting and everybody outside is able to hear what the sister is saying to you.
Ngoba enye inkinga futhi engiphethe kabi lapha mawuthi uthathe uphathela umuntu abavuma ukuphathe ukuthi uphathele umuntu noma ngabe kuthiwa uthi lo muntu uwumyeni wakho.
Another problem is that when you go to the clinic and you want to take someone's treatment, should they have a problem, they don't allow you to take their treatment, even if it's your husband.
Nisho ngabe kuthiwa uzama ukukhipha i-ID yakhe ke wenzela ukuthi bakhole ukuthi umyeni wakho ngampela ukhipha i-ID uphathe nesho incwadi yomshado manje ngazuthi angase kuyinto enkulu kuthiwa nje umuntu akayizele yena.
Even when you have proof that you came to take the treatment on their behalf, like showing them their ID or marriage certificates, they still tell you that they need that particular person to come in person and collect their treatment.
Ngiyafisa ukusho ukuthi enelento eyenzeka eShaka ingiphatha kabi kakhulu ngoba thina njengabasebenzisi beclinic baseShaka sigcina enesiphatheka kabi sihlukumezeka ungabusazi ukuthi uzokwenza njani ugcine nawe usuyizwela mawuxoxa nabanye abantu ukuthi hayi ama cleaners akhona uyakwazi ukukhuluma nomunye umuntu akuntshontshele manje amaphilisi.
So most of us, when we go to the clinic at Shaka, we are always hurt and saddened to the extent that everyone else has resorted to getting assistance from other staff who are able to take medication for them.
Uma usucela ukuthi lo akuntshontshela amaphilisi njalo hayi ukuthi uzezokuntshontshela mahala sekufanele kube khona something nawo ozomciba ngayo.
So when they are
sesiyawathenga amaphilisi thina manje.
So when they take this treatment for you, it's not because they are taking it, they are actually stealing it, and you actually have to pay them. So it's almost like you are buying the treatment now.
Ngiyabonga.
Thank you.
Sanbanani.
Greetings.
Kamalam Ritshidze. I'm from Hammersdale.
I'm from Hammersdale.
I'm also a sex worker and I also use drugs.
I'm a sex worker and I also take drugs.
I was working in Point.
I was working in Point.
There is a mobile clinic used to come there and deliver my medicines, my ARVs.
Kune clinic efikayo lapha ePoint ifike isilethele amaphilisi.
Since ingasafiki for some time and I decided to go back in Hammersdale to start my medicine from there.
This mobile van hasn't been coming now for quite some time, so I have had to go back to Hammersdale to continue collecting my treatment.
When I reached there, I found a long queue.
Mangifika khona ngifica iqueue ende.
And when I found this queue, I didn't get a treatment that same day.
Mangifika kule queue nangijoyi ngime kuyona ngagcina ngingawatholanga amaphilisi ami ngalelo langa lelo.
And I went again back the second day.
Ngaphinde ngaya futhi okwesibili ngelinye ilanga.
And when I reached there, there's still the same queue.
Mangifika futhi ngalelo langa lesibili still nakhona iqueue isayinde.
I tried to manage till I reached the nurse. I tried to manage till I reached to the nurse.
Ungabekezela ke until ngaze ngafika kuyena kunesi ngithola usizo.
And unesi wangibuza ukuthi what I'm here for.
Unesi the nurse then asked me what my reason for being there was.
And I told her I'm a client of this clinic and I come to collect my ARVs.
Ngase ngimtshela ukuthi mina ngiyipatient yaleli clinic, ngiclient yaleli clinic and ngizolanda amaphilisi ami.
And she say, when the last I came here,
Wayesengibuza ukuthi kade ngigcine nini ukufika khona laphayana.
and I told her it's been a long time because I was taking my medicine from a mobile clinic, I wasn't around.
Ngase ngimtshela ukuthi sesiside isikhathi ngoba amaphilisi ami bekade ngiwathatha kwi-mobile clinic.
And she say, oh, she can't help me. I asked her why, because I'm a client of this house. She said I must come with a letter of the mobile clinic.
Ngase ngimbuza ukuthi sikuphi wasethi ngekaza kwazi ukuthi angisize. Ngase ngimbuza ukuthi sikuphi isizathu sokuthi indaba engekaza kwazi ukungisiza. Wathi kuyofanele ukuthi ngiphinde ngibuye nencwadi ephuma kule mobile clinic ekade ngihamba.
Okay, fine. I went back and ngamthola lo nurse wangenzela incwadi ngaphindela khona futhi.
I went there I went back to the mobile clinic. I found this nurse and she did give me the transfer letter.
When I reached back there and I found a long queue again, I managed till I reached to the nurse.
I went there, back to the clinic again. I found the long queue again, but I did manage to be patient until I reached my turn to get assistance.
And she said, yeah, you want a medicine? I said, yes, I'm still needing my medicine. She said,
Wase wathi ke ya uyawadla amaphilisi ngamphendula ngathi mina yebo ngisawadla.
and uthi, okay, when the last you take them? I say, I told you yesterday that it's been a long time I'm not taking my medicine because Imole clinic is taking some time to come to our place there I am.
Wayesengibuza ukuthi ngigcine nini ukwadla amaphilisi ngamtshela ukuthi bekade ngifikile ngayizolo ngamchazela ukuthi amaphilisi ami bekade ngiwathatha kwi-mobile clinic le ekuyiyona ebekade ingasafiki ingakho ke kade sekuyisikhathi eside kangaka ngingasawadla amaphilisi.
And then wangithethisa wathi I don't care about my life.
She then started shouting at me, telling me that I don't care about my life.
I want to die younger.
She told me that I wanted to die young.
And I deserve punishment because I want to give express the ATM kubo bonke abantu.
Wayesethi ke ngumuntu ofaneleke ukuthi ajeziswe ngoba ngifuna ukubulalisa abantu.
And I was got ALTDs, STIs in my virgin.
Ngike ngase ngiba ne-STI.
I was scared to tell her because the way she's talking to me, it wasn't nice.
Ngasaba ukuthi ngimchazele ngoba indlela kade sekhulume ngayo kumina ibingayinhle.
But I almost tell her and then she laughed and she called the other staff members.
Ngagcina sengimtshelileke wavele wangihleka wagcina ebizile abanyoza kwabo.
And then they come and ask me what I'm here for and I told her my reason why I'm here.
Base ke befika kumina bengibuza ukuthi isiphi isizathu esingenza ukuthi ngibe khona laphayana ngase ngachaza ke isizathu sami.
And bangihleka bathi ngi deserve punishment and they won't give me a medicine. I must take 3 days before I get the medicines.
They then started laughing at me, saying that I deserve to be punished and they weren't going to give me any medicine.
I must come back in 3 days.
Kuyofanele ukuthi ngiphinde ngibuye emva kweinsuku ezintathu.
And they didn't give me the treatment for virgin.
Abazange ke besanginikeza i-treatment yalokho bekwakungiphethe.
Ngiyabonga.
I-STI, ngiyabonga. Thank you.
We will proceed to the recommendations.
Thank you. The time now is 2:00. We will try to shorten our program so that we can finish early. We're going to recommendations. But I think as we are going to recommendations, there are a couple of issues which I wanted to stress here. which in our view are a barrier for or from us as the country not being able to meet our targets. Like this issue of ID documents, transfer letters, it is a problem. The issue of staff attitude, involuntary disclosure, stigma, and discrimination. Patients who had disengaged to be made to sign consent forms or to be made kids to sing. I think as much as some of the things that have been said here, we are laughing at them. But when you think through, it tells that the life of a black person in South Africa is cheap. The life of a black person in South Africa is made cheap not by the white people, but it is made cheap by the same black people. And then we are expected to smile, laugh, as if all is well. It's not well, comrades. To this day and age in South Africa, being a sex worker, it is still a crime. But we say nothing when the politicians are looting from the public purse. We say nothing when services are not being provided to our people, which makes the unemployment rate to go up. When food parcels are taken by councillors and politicians, give them to their friends, not to the needy communities. We're saying nothing. We might laugh, comrades, some of us, sitting in our comfort zones, because some, when they are sick and dying, they can afford to go to a private hospital. And this is the better life that we were promised in our country. A better life that makes an African child to feel like they are foreigners in their own land. Something must be done. Going to the recommendations, the KwaZulu-Natal Department of Health, Broadreach and Health Systems Trust should implement with fidelity the 2020 standard operating procedures on national adherence guidelines. All staff should be trained and held accountable to provide friendly and welcoming environment for all public healthcare users, including key populations and people living with HIV returning to care after late or missed scheduled visit, silent transfer from another facility, or treatment interruption. Overall accountability should be with the facility manager if no improvements are made. Healthcare workers must acknowledge it is normal to miss an appointment and or have treatment interruptions, and support and empower people living with HIV to improve retention after re-engagement as per 2020 standard operating procedure. Any reports of poor staff attitude should be urgently investigated and disciplinary action taken where appropriate. For facilities Ritshidze reports on, the KZN Department of Health should respond within 3 months with actions that have been taken so far. No person living with HIV should be sent to the back of the queue if they miss an appointment. This is not a National Department of Health policy. The KZN Department of Health should send communication to all sites withdrawing this measure and highlighting the Welcome Back campaign strategy that says people returning to care should be triaged. KZN Department of Health should issue communication that highlights that people living with HIV who return from a treatment interruption but have not missed a dose be screened for immediate access to a repeat prescription strategy. Any reports where immediate treatment continuation or restart is delayed by healthcare workers, requiring a transfer letter should be urgently investigated and disciplinary action taken where appropriate. For facilities Ritshidze reports on, the KZN Department of Health should respond within 3 months with actions that have been taken. From November 2022, the KZN Department of Health, Broadridge, and Health Systems Trust should ensure that all healthcare workers, including community healthcare workers, provide accurate and easily understandable information on treatment adherence and the importance of undetectable viral load when talking to people living with HIV through consultations, counseling, outreach, and health talks at clinics. Thank you.
Good afternoon once again, everyone. I'm going to be making a presentation under the key populations. So the next group of issues are those affecting the key populations. One major barrier to accessing HIV prevention and treatment services for key population is being discriminated against at the facilities. Of the 878 KPs that were interviewed in KwaZulu-Natal, a substantial number of KPs we interviewed were not receiving services anywhere, including 26% of gay, bisexual, and other men who are having sex with other men, 14% of drug users, 12% of sex workers, and 12% of trans people. Of those who were accessing services, the majority of key population interviewed who were using public health facilities to access their health services instead of a mobile clinic or a drop-in center, including 80% of GBMSM, which is men who are sleeping with other men, 82% of people who are using drugs, 54% of sex workers, and 73% of trans people. In fact, many KPs we spoke to are not even aware of a drop-in center, including 74% of GBMSM, 88% of people who are using drugs, 84% of sex workers, and 86% of trans people. Yet at clinics, KPs are often treated very poorly by clinic staff who are at times shout or verbally abuse people to prefer to go without ARVs, HIV prevention, and other healthcare services, which means people rather not go to clinics just because of the way they are treated at the clinics. Due to these challenges, KPs have had a very low satisfaction of levels in using their public facilities. KPs have reported poor treatment and unfriendliness from facility staff. Only 28% of respondents reported that the facility staff are always friendly. This is a very low, significant number of people who say they can use the public health services. There is over 70% who we don't know if they are treated friendly as these facilities. And professional towards GBMSM, 19%, towards people who are using drugs, 16% towards sex workers, and 34% towards trans people. Clinical staff were most commonly reported as being unfriendly and unprofessionally by all KP groups, followed by security staff. For those not getting health services anyway, unfriendly services was one of the major reasons given by 29% of GBMSM, 38% of people who are using drugs, 44% of sex workers, and 44% of trans people. Of respondents using drop-in centers and mobile clinics, 50% of GBMSM, 54% of people who are using drugs, 58% of sex workers, and 67% of trans people reported unfriendly services as one of the main reasons that they are not getting health services at all. On the whole, KZN provided the the worst services for key populations across nearly all indicators in our data set. Shockingly, significant number of KPs reported being refused access to services because of just being a KP, including 25% of people who use drugs in KwaZulu-Natal. This is absolutely unacceptable and goes against the section 27 of the Constitution that states that everyone has the right to having access to health care services. Because before being a sex worker or a drug user, a person is a person. We are all human beings. For those not getting health care services anyway, having been refused services was one of the major reasons given by 2% of the GBMSM, 10% of people who are using drugs, and 16% of trans people. For KPs trying to access much-needed health care, including HIV services, being chased away can make it more likely to deter future attempts. While most of the KPs are aware of drop-in centers and can find the taxi fare to travel them, many are not so lucky. They do not have that money. Being refused entry to the only source of health care that you can leave you with no other option than disengaging altogether, or attempting to be given a transfer letter to another clinic, meaning from the very same clinic that you refused services from. Often meaning that's an additional travel cost to a clinic further away from you. This is a complete violation. Many KPs we interviewed did not feel safe at protecting from verbal or physical abuse, verbal or physical harassment, or risk of arrest at public health care facilities. Only 49% of GBMSM, 34% of people who are using drugs, 34% of sex workers, and 55% of trans people felt safe or very safe using this facility. Similarly, only 40% of MSMs, 30% of people who are using drugs, 28% of sex workers, and 38% of trans people felt comfortable and very comfortable at these facilities. For those not getting health care services anyway, a lack of safety was one of the major reasons given by the 24% of GBMSM, 10% of people who are using drugs, 26% of sex workers, and 20% of trans people. Of respondents using the drop-in centers and mobile clinics, 27% of GBMSM, 40% of people who are using drugs, 30% of sex workers, and 16% of trans people reported unsafe conditions as one of the main reasons they were not getting health services at these facilities. Feeling unsafe and uncomfortable at the clinics discourages KPs from going to accessing services, impacting the uptake of testing and prevention services, as well as undermining long-term adherence. KPs must not be made to feel uncomfortable to face verbal or physical abuse, verbal or physical harassment, or risk of arrest when they're using these public health care facilities. KPs were also concerned about ongoing privacy violations at clinics, as clinics staffs were known to disclose people's HIV statuses, or the fact that they are a KP in front of other healthcare users, or to invite other clinicians into the private consultation in order to mock or judge people's symptoms. Service provisions must respects the privacy of people, of public healthcare users, as enriched in the Patients' Rights Charter, which is the Batopile. However, Ritshidze data highlighted that a significant number of KPs do not think that privacy is respected at the clinics in KwaZulu-Natal, scored the worst among all provinces on KP privacy violations. 31% of GBMSM, 48% of people who are using drugs, 61% of sex workers, and 24% of trans people complained that the privacy is not well respected in these facilities. For those who are not getting health care services anyway, a fear of exposure as a KP was one of the major reasons given by 33% of GBMSM, 10% of people who are using drugs, 30% of sex workers, and 28% of trans people. And the lack of privacy was the reason given by 27% of GBMSM, 40% of people who are using drugs, 26% of sex workers, and 40% of trans people. In order for KPs to actually uptake KP-specific services offered at the facilities, spaces are needed to feel private enough to disclose if you are a KP without the fear that your privacy will be violated. Privacy violations discourages KPs from going to access these services, impacting the uptake of HIV testing and prevention services, as well as undermining the long-term adherence. So we now move on to our recorded community stories.
Last year, bengusinawana bengisabhema kakhulu strong. Then bengiphatha ngokuxosha amakhalibhothi amathini irecycle lokala. So kwaba khona umfethu esibanga naye amakhalibhothi lawo siphatha ngawo. Sigcina sesilwa, agcina sengigwazayo ngoba ngistress la. Bengigwaza kanti lakhe kudlula even yakametro. Even yametro ngizame ukucela kuyona usizo kwathi sinayo ke basilamula kuphela wabalekana lomfethu. Batshela ukuthi mhlawumbe bazama ungisiza bangifake evenini bangesibhedlela but nabo basanendlela yabo. I had to walk ngisuke ePietermaritzburg rank ngiya e-Edenton. Ngahamba nga-Edenton. Mangifika e-Edenton ama-security they was shocked to see someone oblida ngale ndlela ezifikela yena. Because ngangifika ebusweni igazi ligcwele nasesifubeni lifika ngisho ey'nyaweni. Ngangena ngaphakathi-ke angingcolile nganginuka futhi. Bangena bangithathe onesi I think noma ama-student I'm not sure bangithathe yangibeka egumbini lakadokotela. Bangifika egumbini lakadokotela so into yokuqala yangiphatha kabi ukuthi they like istaff samanesi akazi noma onesi noma yini but like babe indlela ababengichaza ngayo like babengichazisa komuntu ngoba babesebenzisa leli gama ukuthi sinawana yabo. Fika sinawana hayi sinawana olimele and uyableeda wara so and mase ngithola usizo ke ngathola usizo bangiklina ke isilonda ke ngathuka since 2-3 days ngave ngavuvukala abangaka and kwaba nzima ukuthi ngiphindele khona ngaya eDennis Hill eklinikhi eDennis Hill unesi owayengiqaqa wababasa indlela engithungwe ngayo ukuthi ngithuke kanjani lethiwa ngivuvukele indlela engithuke ngayo ngazi noma itishi babeyifase kakhulu noma kwakwenzeke kanjani so ngagcina sengisizakale eDennis Hill kahle ngoba edingithini indlela abangithuka ngayo angivuvukela ubuso sekuvaleka ngishihlo sengingasazi nami kwenzeke njalo. I feel like you don't have to judge umuntu uma unesi same as uyi-social worker yabo ukuthi umuntu kwesiphi isimo wena you are there to assist.
Isitori sami singehlengisizo clinic. I'm on ARV treatment. It's ne-TB yakangiphatha. Ngisho usizo ngaze ngalithola la ekhaya la because ngase ngifuna amaphilisi ama-clinic babuye basi-treat-e ngokuthi nesibhema ama-drugs basithatha noma kanjani uzokwenzani lana ngizofuna amaphilisi ami hayi ninamaphilisi ezwe ukuthi niyawadayisa nibona ukudayisele labantu abanakhela zona lezi zinto lezi yabo. So ngangifuna kahle ilokhu i-transfer letter ukuthi bangitransfere cause ngase nginokuba one time ngize la eThekwini abanenkinga namaphilisi yabo. Kusho fanele njalo ngizame ngehlengisizwe ngithola amaphilisi ami. Kwenkathi angiwatholi ngize ngithumele usisi wami kube uyena ongilandelayo because mina mhlambe uthi I'm dirty yabo.
August lena last year 2021 yabo rango August ngiyeke khona njobe siqala lento imila yabo njobe siqala imila mangifika khona ngifuna usizo ngilithole from the first day bangidress up iwundi yami bagcobe nemithi leyakhona. Second day mase ngibuya shuthi kune staff nurse esihlala ngasekhaya esiwu-neighbor wami yabo staff nurse sakhona la hlengisizwe clinic hlengisizwe clinic from Hammersdale. Ya mangifika khona athi lo sisayibo uthini lo uthini thiwa hayi unenkinga la umilwa into angayazi kanje athiwa hawu athi akufanele usebenzisa ama-drugs lo. That's why lento yakhe ngeke nje iziziport it won't heal because it's still using the drugs. You must stop the drugs, then we can treat you from this thing. Yabo nje leyo ngeni ngashock ukuthi hawu uthini lo muntu kumele phela iclinic le kusizala wonke umuntu. Wathi futhi nina futhi maphara nihlezi la nize ngathi ngizofuna usizo yabo ekugcineni mase nitholile lo sizo lelo jike nisitshontshele futhi yabo. Ngiyamtshela sonke asifani yabo hayi ukuthi sonke mfethu siyabasiyona leyo nhlobo so until-ke mfethu ngize ngithole umfethu wangasekhaya bejwayele ukuza la eThekwini yabo angitshele ngelento harmful reduction center lapha eMbili TB-HIV step up yize-ke nayo le eThekwini hayi ngihambe ngekhona hawu abona-ke nje laphana ngingathini umuntu onjengathi yabona oyimisele ngokushintsha empilweni onenkinga owilling futhi ukwadla amaphilisi e-HIV bayamthanda bayamnakekela kangangokuba baze bakubuza indawo ohlala kuyona ukuthi where you stay yabo sihlala la ema-shelter-ke thina ematendeni yabo hlala lapho it's where we stay. They even bring the medication to us if kukhona inkinga yabo i-drop-in center le ela eThekwini ngaze ngamuva-ke Hammersdale ngiveza ngala ngoba ngibona ukuthi okay at least ngiyalithola usizo ngala futhi abangicwasi yayibona leyo nto yeah. Hayi bo public in public phambi kwabantu ayithi kubabona uma beqhamuka nelento njani kuthiwa inamafayili la wakhona nisuke vele nulayini lapho mina ngiyavuka ayikho vele into engisuke ngibhizi ngayo yabo uqhamuka nje phambi kwabantu nje la yabo. During that time into nje if ingiphathe kabi bengazi ukuthi nje okay it's a drug elizokwehlisa lesi stress lesi yabo ngoba kwayona le opinion yakhe ngaze ngayithatha ukuthi futhi ngempela lento yami ngeke mfethu ize iphole ngoba nakho still ngisasebenzisa ama-drugs yabo. Okay yena okunye wangisiza ngalo kodwa kwangafanele angihlaze ngale ndlela ya bengingathanda ukuthi nje ngathini indlela esitreatwa ngayo ibe equal yabo so even ilento njana ngathini ilento yomuntu status somuntu bangasimemezi nje noma kanjani yayibona leyo nto ya status babe in privacy nje kahle wonke yabo uma ngase uye ku each and everyone i-drug use akekho oyi-drug use othandayo ukusebenzisa ama-drugs each and every one of us there is no one nje ongathi hayi mina I like to use drugs all of them they are willing to change all of them yabo manje if there is a support yabo uma ngabe umuntu kunokuthi uya-encourage aku-discourage uthi hey leyo nto yakho ngeke iziphole ngoba vele you are still a drug user it won't heal the thing yabo leyo muntu uchaza ukuthi nawe i-drug user leyo nto iya-effecta nje la emqondweni ya ngasho lapho from that time eyishawutha lento yakho ukuthi awu vele nina nisuke nizontshontsha la you are tifu and stuff yabo nenze ngathi nizofuna usizo kanti niyadrayisa ngayisukumela ngabona ukuthi okay okusho ukuthi la sengiyabandlululeka yabo ngoba nalabantu sengihlele emaceleni kwazi lo ukubaboneka abantu iphara balithatha kanjani plus bengisayi hard smoker during that time yabo ngangena kulento methadone yabo same time ngisukume ngihambe ekhaya benginika nemali yokugibela yabo asebenzisayo nake kwayona leyo mali ngavele ngayo ibhemele.
Thank you. We're going to the recommendations. But before we go to recommendations, there is this case, Comrade Ubongeka Khumalo, that she reported here about sexual harassment within a facility. We need to get the details, Comrade Simpiwe, from Comrade Ubongeka, so that we can see how do we take this matter forward. We have endured a lot of injustices, lot of discrimination, stigma, insults, and everything in our clinics. And we cannot, on top of that, tolerate cases of sexual harassment and gender-based violence within our clinics. We need to root them out by all means necessary. The recommendations are as follows. Any reports of poor staff attitude, privacy violations, verbal or physical abuse or harassment, and or of services being restricted or refused should be urgently investigated by the Department of Health and PEPFAR, and disciplinary actions taken where appropriate. Facility managers should be held responsible for unresolved issues. For facilities we report on here, the Department of Health and PEPFAR should respond within 3 months with actions that have been taken. The Department of Health and PEPFAR should ensure that all clinical and non-clinical staff, including security guards, across public health facilities are actually sensitized on provision of key population-friendly services to ensure a welcoming and safe environment for all key populations at all times. Key populations must be involved in the implementation of these training modules. Post-sensitization training, the Department of Health and PEPFAR should complete follow-up to assess quality of key population services at site level to show success of the sensitization program. And from here, we going on.
We are now going to go to the KP-specific services as facilities. The next group of issues are on key populations. KPs are disproportionately affected by HIV. It is therefore critical that KPs can access specific services to meet their specific needs. When we asked facility managers if they provide KP-specific services, in some places they said they do. However, when probed further into the specifics of what services are being provided, it is apparent that few facilities provide the specific services that are needed for KPs. For example, out of 129 facility managers interviewed, only 22 facilities reported offering PEP for GBMSM, and only 19 facilities had lubricant. For people who are using drugs, out of 129 facility managers interviewed, only 16 facilities reported offering referrals for methadone initiation, and only 7 facilities had vaccination, diagnosis, and treatment for viral hepatitis. Out of 129 facility managers that were interviewed, only 25 facilities reported offering sex worker-friendly HIV services, and only 14 services reported offering GBV services for sex workers. out of 129 facility managers that were interviewed, only 5 facilities reported offering outreach services for trans people, and only 4 facilities reported offering psychosocial support for trans people. While PEPFAR and the department have committed to establishing one center of excellence per province, this is entirely inadequate to meet the needs of the key populations. The province is vast and the KPs are everywhere. A minimum package of KP-specific services should be made available to meet the KP-specific needs, and at least two designated public facilities per district. These facilities must be highly sensitized to the needs of the KPs and provide friendly, safe, and confidential services. Why KPs need specialized care from one of these public healthcare facilities is a referral and adequate resources, which means including some things like transports or transport cost should be provided to ensure the uptake of those services. In KZN, KPs are often struggle to access basic prevention tools like condoms and especially lubricants, either because those commodities are simply not available or KPs are questioned for taking them or refused access to having them. Ritshidze data gathered in 122 facilities show that lubricants were only available in 26% of sites in this reporting period. Data collection among key population also found a very low availability, with only 38% of GBMSM, 19% of people who are using drugs, 13% of sex workers, and 36% of trans people using public healthcare facilities who said that they could access lubricant. And this is a very significantly low number of people that can access lubricants. Condoms and lubricants should be available at all facilities and should be placed even in the toilets and other areas of the clinics where people can take them without the fear of being seen by other people. It is well known that oral PrEP is highly effective for prevention of HIV transmissions, as it allows people who are HIV negative to be in control of their HIV statuses. As such, it is a vital tool to support HIV prevention, especially amongst the KPs that are at higher risk of getting HIV. However, despite this, Ritshidze data shows that PrEP is not always made available for KPs in the facilities. PEPFAR is committed to ensuring that KPs who test for HIV are either linked to the HIV treatment services on PrEP. However, our data shows challenges in the implementation of this commitment. Positively, interviews with the facility managers revealed that PrEP was reported as available as all 128 facilities monitored in April to May 2022. However, the number reported offering PrEP to KPs was far lower for each KP group, including just 66 sites of GBMSM, just 54 sites of people who are using drugs, only 72 sites of sex workers, and just 36 sites for trans people. Further, of KPs interviewed, only 41% of GBMSM, 14% of people who are using drugs, 31% of sex workers, and 59% of trans people reported being offered PrEP at their facilities. Having PrEP on site but not educating people on it and offering it to those who could benefit will ultimately not improve the uptake of PrEP services. Harm reduction services are critically important to support people who are using drugs to stay alive and protect their health, including ensuring the accessibility of methadone and unused needles, overdose treatment such as naloxone, and well as psychosocial support and information on safer drug usage. Ritshidze data shows that 65% of respondents wanted methadone to be available at facilities, and 59% wanted referral for methadone services. Unused needles were reported to be available by 2% of people who are using drugs. Yes, 31% of respondents wanted access to unused or new needles at facilities, but they do not get. Naloxone is not available, yet 44% of respondents wanted access to overdose treatment. 57% wanted an on-site drug counseling. Service accessibility must be improved to ensure that the needs of the people who are using drugs are met and no additional barriers are created to being able to take drugs safely or be supported to stop. The availability of gender-affirming services for those who need them is critically important. In addition to those psychological impacts of gender dysphoria, in the context of South Africa, a country with such transphobia and attacks on trans individuals, access to hormone therapy could mean life or death. But gender-affirming care is mostly only available in big cities. Trans people who live in rural areas or provinces without any gender-affirming care must travel long distances to these cities to get these services. This keeps it out of reach for those without access to transport or money to go to those places. 54% of trans people we spoke to wanted access to hormones at their facilities. 34% wanted outreach services for trans people. 21% wants trans-friendly STI prevention and testing, free testing and treatment. And 57% wanted access to psychosocial support services. We will now move to recorded stories.
Bengihlala kaMashu but manje sengihlala la eThekwini ngosizo like ebengilifuna ngesimanga sokuthi bengibhema ama drugs nakhona ama drugs lawa angiholela ekutheni ngicine ngizingidayisa ngomzimba bo. So njengoba ade ngidayisa ngomzimba bengihlala like kaMashu ama clinic like akhona bengiwahamba nawo like izinto eziningi njengama medication izinto obungayithola bo. Then ngase ngagcina sengidlulela kulezi ezinye izibhedlela ngoba since bengisex worker kuthe like ngoDecember bo ngaba nesilonda la ngaphansi abo mangiba nesilonda kwaphoqa ukuthi ngihambe ngesibhedlela bo mangifika esibhedlela like ngahle igama lesibhedlela eAddington yabo lonto mangifika eAddington ngafika ngabamba ulayini kwaze kwa like kwaphela usuku wacaca ukuthi usiza ngilithola mangibuya ngikusasa ngosimanga sokuthi inkinga yami ayiserious ngempela ukuthi angikhona ukuphumula angikhona ukulala ngoba nayo mangabe ngiyo sex worker like ngisuke ngithola imali yabo but then mase ngasaphansi obviously imali angiyithola udinge ukuthi ngiphoqa ukuthi usizo ngiyalithola then ngiqhubeke ngihambe ngiyokwenza umsebenzi wami ukuze ngibe right yabo so then ngaphinde ngabuyela esibhedlela so ngasimanga sokuthi mina bengibhema bo lonto esibhedlela ngabona nendlela abebengithatha ngayo ukuthi no laba bangithathisa komuntu ophilayo yabo babona nendlela engiyona nangendlela engcole ngayo ukuthi no ongenze ukuthi babone ukuthi angene nomuntu yabo ngoba nami isimo engangikusona since mabo mawubhema like kuba nesikhathi sokuthi okay njengoba ngi6 week kumele ukuthi ngiyogeza ngoba kumele ngiyophansi lokho akuzange ngingiphathe kahle nakancane ngoba ngabona ukuthi shusi mangabe uyi-addict uyi-drug addict shusi wena usiza utholi like ngendlela efanele njengabo bonke abantu nanokuthi mangabe uyi-sex worker ngoba angithi ngichaza ukuthi siphila yiphi impilo imali into like ehlezi uyidinga ngaso sonke isikhathi so ngalesikhathi bona bengimisa obvious lapho impilo yami ayiqhubeki yabo lonto
ufika uthola uprep if i-NGO yaka Broadridge ayikutholanga yaka assista usuku uzoba lost ngoba u-DOH awufuni into ehlanganisa no-prep abafundi into ehlanganisa no-prep mawufika usho ukuthi uzocela ukuthatha uprep bathi abayazi leyo nto mangabe sewuzwa kwabanye mhlawumbe ubuza ngaphandle kuma patients akukhombisa ukuthi hambe lapha etendeni bafike bakuchazele and ufica usister ozoku-initiate mase ku-initiate uzoyithola subscription enyanga yokuqala mase kufanele ubuye uyafika ifile alisekho njalo kwamele baqale phansi ba-reinitiate abantu bayakhathala yileyo nto and bayimisele ngokuthi bathatha uprep but abanayo i-support
ngazama ukukhuluma nomunye usisi wayesebenza kwi-mobile clinic yabo ngamtshelisi ngoba bebefika ke bona bezivakashela even though ngayikhumbula inhlangano bebesuka kuyona bo uthola ukuthi basiprovide ngalo ma condoms ngamaphilisi like uthola ukuthi basifundisa nango-prep ukuthi ukuze ungatholi ama like bekunani indawo ke lapha la bengihlala ngakhona eDalton uthola ukuthi banendawo la bebeke khona ama-condoms besizakala nakhona bo but ile ama-STI bibhlungu kakhulu ngoba besingathola ukusizakala sibhedlela yabo thola ukuthi angikwazi ukulokhu nje ukuthola usizo angithi ngibambula yini la nami sometimes ngibona ukuthi hey mhlawumbe ukuhlala kuseni from 6 to mhlawumbe abo 4 5 yabo lonto angidlili anginalutho ngicela nami ngize ngibone ukuthi no angihambe yabo ya ngabona ukuthi mangayisukumele ngoba phela mfethu njengoba ngichaza ukuthi le ndawo iyona bengiphila ngayo yabo
Sanibonani.
Greetings.
Kamera Salim, Sibongo Adam, and I'm gay man.
Igama lami Salim is Fanu Adam and I am a gay man.
So I'll first just give a brief understanding ukuthi ngizokhuluma ngani. So
Ngizobeka i-background ukuthi ngizokhuluma ngani.
I'm part of civil society of where we help gays and lesbians who can't access our health services.
Ngiphathi yes civil society lapho sinceda khona abantu who are under the LGBTQIA community.
So judging from the friends, I once had a friend who went to a healthcare service.
Benginomngani waya ekliniki
and she was a lesbian.
Lesbian.
So the first thing they asked her was, do you have sex with men or women?
Into yokuqala bakubuza ukuthi uba ne-sexual intercourse namadoda or abafazi na.
Then also washo ukuthi no, I only prefer ladies.
Wathi yena une preference for abafazi.
So then babuza ukuthi uphethwe yini in public, not even in an office, public reception.
They then publicly asked her what is her problem, what is wrong with her.
Then washo ukuthi she thinks she has STIs.
Wachaza ukuba ubona ngathi une STI.
Then one Indian nurse nje.
One nurse?
What? It's because we are using the wrong things to do sex with. So what? It's part of because when and you didn't choose to date men, but you chose to date ladies. That's why you are that sick. So as the time went by, she came back without finding any help. Then she came to me since she knows what I work with society and asked what, how can she get help because it's getting worse each time. So then I told her, I'll take you to a clinic where I know they'll help you. we went back to Eshakaskali Clinic. Then I asked, why didn't you all help her? They were like, it was because we didn't have time to waste on people who chose different lives. So I took her to a different clinic, a gravel clinic, where she found a help corner. They treated her. And in the problem we have at Shaga is that we do not have condoms and lubricants. Although they have them, they're in a public space. Some gay men are not publicly out that they're gay. So going in public space, catching a condom and fetching a lubricant, in the reception people like, okay, they know lubricants and condoms, they go together in a pack. So if you take them together, obviously it's well known that these people, obviously you are having sex with the same gender. So ama condoms, where they keep them, it's a space where you are not that affluent or you just see what he's going exactly to those condoms. So our issue was, and I asked, why are these condoms kept in a reception? Because they are just not doing any justice to anybody. So they were like, it's because everyone should know now you chose to be a discrimination or a disgrace in the community. So everyone must know you just don't follow the ways God created everybody to go with. So I then chose, since you have this problem, we will leave the clinic and we'll use a different facility, of which we did find one nurse, Utepi Keswa, from Groundville Clinic. She's an ANOVA champion, so she has lubricants and condom from ANOVA. So she's the one who's helping with condoms for lesbians and gays as well. So we were just wondering, is it possible to have those condoms put it maybe in a toilet, maybe? Because some guys are not safe and don't feel comfortable going in a public space. Then I also got sick and went to a clinic as well, and I got the same response. I was like, okay, which means this nurse is just doing this every time. If you are gay or lesbian, she'll give an attitude. We won't know what this is attitude. Just because she's an Indian and then you are black, she'll just shout in the reception that everyone will know, and then you leave without having any service done unto you. Then it comes to a point of PrEP. PrEP is something that is free for government institutes, but for them, you have to pay for it. It's 50 rands a dose. Yeah, you pay for it. So then we were wondering is there any chance, why do we have to go in a specific room to be known that you are gay? All gay guys go to that room. Because everyone will know now, some guys just don't want to disclose that they are gay. So if you just write on a wall or on the door that says gays and lesbian on that door, it is just so not good to anybody, because some people are not out and about. But we just want to thank Society for the good job they do. It's cool. They do an amazing job. Thank you.
Greetings. Like I had said earlier on, I am Bonge Akumalo and I am a sex worker. I'm also a recovering drug addict. Not very long ago, I found myself needing to use clinic services, of which I chose Addington Clinic because it was closest to me. When I got there, I spoke to a nurse privately, but she advised me to go and wait for her in the waiting area. When I was waiting there, I heard someone shouting, "Oh, Pumqwayizi," and then again she said, "Oh, Blotqwayizayo," but I didn't think she was referring to me, so I just kept quiet. And then I saw her coming towards me, and then she started shouting, "Hey wena, ufika lana ne-pride, awungizi ukuthi ngiyakubiza uthuleleni. Awuyena yini umqwayizi?" And I just kept
She called
quiet.
me into the consultation room and said, initially she shouted out, "Where is the prostitute? Where is the prostitute?" I did not think that she was referring to me, so I did not go to her room. She eventually came out to say, "Why are you coming to the facility with pride? Can't you hear that I've been calling you for all this time?"
Yeah, and then she said, "Awuyena yini umqwayizi, akubona yini lokho okuzele la?" And then she threw at me Panadol painkillers. She said, I'm not gonna go into details with what I had gone there for, but she threw painkillers at me and said, whenever it is painful there, just use those and then go and get yourself morning afters with the money that you get from prostituting yourself. And then because of the humiliation I got there, and because the crowd was already laughing and they all had some things to say, I just left. And I told myself that I'll never go there ever again, because all that experience kind of reminded me of something that happened earlier on in another clinic, because they were treating me as if I was crazy and I had no rights. It was like I was not human, or my rights did not matter. I once met a person called Parker. She was meant to be my psychologist, I think. But, well, the whole incident is something I'm not really sure of, because for one, no one ever agreed to tell me what was wrong with me. They forced me to drink pills that were making me sick. Khona lento le ibizwa ngokuthi i-stroke. Angikwazi ukuyichaza, but umzimba wami mawuzobheka ngapha. Emese ikhanda lami libheke ngapha. Because somehow
I once experienced a stroke. I don't know quite how to explain it. However, my my face basically was not in configuration with everything else.
Okay. Isizathu salokho, it because somehow bagcina bethola ukuthi I am a sex worker, and I also am a person who was using drugs. Angisibonanga isidingo sokuthi ngibafihlele, because angithi mangabe kuthiwa uya eclinic uyothola usizo kufanele ukhulume iqiniso njengoba linjalo, because yona indlela ekuthi uzosizakala ngayo.
I did not see the need to hide the fact that I was a drug user as well as a sex worker, because that is the best way that you can get any type of assistance.
Okay, so ngenxa yokuthi ngesikhathi ngiqala ukubonana naye endlini esasikuyona kwakunabantu, ngamcela ukuthi abakhiphe, because ngangicabanga ukuthi nginelungelo lokuthi ngikhulume naye ngingedwa.
On the first visit with the psychologist, I asked that she request that those who were in the room with us leave the room for us, because I assumed that I was privileged the right to confidentiality and privacy.
Okay, after kwenzeke kanjalo, then ngase ngenza sure ukuthi ngiyambuza ukuthi ngabe konke sokukhuluma naye kuzogcina phakathi kwami naye yini, and she assured me that it was going to be like that.
I even asked her, after everyone had left the room, if our conversation was going to remain between the two of us, and she assured me of that.
Okay. As much as she was not told by me that I'm a sex worker and I use drugs, because it had already been there out in the open, I just decided to just continue and be honest with her, and I told her even the things that she never knew about. Okay. There's a lot, there's nothing I didn't reveal to her, but she waited for me to just finish. The very same minute that I just finished talking to her, she called the people that I had asked to go outside. And then she said, okay guys, I have found out what is wrong with her. I know why she is doing what she is doing. Not knowing that among the people that were there was someone I went to school, starting from grade 1 up until grade 12, of which I never would have wanted her to know anything about me. And now, I think I can say the whole community knows that about me. She then continued, stopping other patients who were passing. Like, if you're passing, then she will stop you and tell you that this is what's going on, who's wrong, who's right. It's not like I was denying that I was wrong. It's not that I was saying I was right. I could have been wrong, I could have been right. But I believe that because I had a problem, or because she thought I had a problem, I had to be honest with her, which is what I was trying to do. I don't think she had a right to go and talk about me to other people. And another thing, I was forced to take an HIV test, and I was forced to reveal my results. And when I got there, a male nurse, forced me to undress myself. He gave me a massage telling me that how angithi uyayenza nje lento lena, I can even point that guy till today. I don't know his name, yes, but yeah. Thank you.
Okay, Sanbona.
Greetings.
My name is Ngubeko Dlamini. I'm from Guamashu. Yeah, I'd like to share my story kwinte eyenzeka kumina kwaMashu Polyclinic.
I want to share what happened to me at KwaMashu Polyclinic.
Okay, njengoba ngihleli la ngizwe izitori zabanye ngiyabona ukuthi ngazo sonke sina something in common leyo kurejecteka emaklinikhi ey'bhedlela.
I see that we have similar grievances at clinics and facilities and hospitals.
Yeah, and futhi ngiyajabula mangibona ama-organization enjengalawa eyilwa lento ngoba masingayilwi manje izoqhubeka nabo nesizukulwane sethu so facana nayo lento ngoba ey'bhedlela kuza nama-students ako-duty oko-what nawazofunda lokho ukuthi athi shuthi uyanesi ukuthi emhliphize nje iclient yabo engamnikeza indawo yakhe.
I am happy that there's organizations such as these who are tackling these issues, because these issues will also affect the future generations, especially with young student nurses also entering the profession in hospitals. They'll all see that it is right to mistreat patients, which is totally wrong.
Yeah, nangale ndlela ukuthi siba expose ngibona ku rise khona like so wenza umhlaba wonke wazi ukuthi yini lesibhekane nayo la KZN.
It is a good thing that we expose them so that it is well known what is happening in the health sector in KZN.
Okay, yeah, nami ngi-part of key population communities.
I'm also a key population community member.
Kodwa I'm a former drug user.
I am a former drug user.
Yeah, mawubhema ama-drugs njengoba ngibona nama-interview abafethu like mawusubhema kakhulu khamba kugcina like usumilwa izinto ongazazi emzimbeni yabo nami lokho sekwenzeka kumina.
So when you find yourself smoking or using drugs quite a lot tends to happen to your body, and that is what happened to me.
And ngokuthi ngalesa sikhathi ngangumuntu like brainwash ama-drugs ngayinaki konke engikwenzayo ngagcina sengihlala newundi yagcina like isi-infected like angazi okuseyisikhathi singanani sengihlalile ngingayo kofuna usizo ngaso.
Okay, I eventually had an infected wound, and I was not seeking any medical help to sort that out.
Okay, shuthi ngelinye ilanga like nama I come back to my senses ngabona ukuthi okay umzimba wami fanele ngihambe ngifuna usizo ngoba yabo.
I came back to my senses and I thought, let me go and seek medical attention for what is happening to my body.
Okay, mangifike polyclinic ngivele like as usual line uhlezi umude yabo wabantu abanamakhadi khona ngoba sengasebenzisa isibhedlela yabo ngesikhathi singemumva nginalo ikhadi la khona.
Okay, so I arrived at Polyclinic, and as usual, there was a very long line, especially where you're supposed to drop your little card so that they can take out your files.
Okay, like ngilandele uline as ngifika ngala kuhlala khona ama-security elinye security leza kumina yabo like la ngitshena ukuthi angivumelekile ukuthi ngihlale phambi kwabantu angisuke la kwi-queue ngiyohlala like on the other side la khona ama-wheelchairs.
I got there initially and was queuing with the rest, with everyone else who was coming to get services at the facility. When I got towards a security guard stall, the security guard came to me and said I shouldn't be queuing with everyone else, and asked me to go and sit in an isolated space where they put the wheelchairs.
Okay, shuthi wakwazi ukuthi ephinde kubuye kumina engitshena ukuthi okay sengangena ngaphakathi ngihambe ngiyobona udokotela.
He then came back to me and said, okay, you can go back in now to go and consult with the doctor.
Okay, like mangifika udokotela angibuzanga ukuthi like yini enze iwundi yini ukwenzakaleni kumina wangisenda kwabanye onesi nje.
When I got to the doctor did not ask me how did I get the wound. He simply sent me to the nurses' stations for me to see the nurses.
Okay, mangifika ngiujoin like iqueue yakhona. Mase ngifika like sekumina zongena. Kusho kwakusoku 12 vele beyelunchini.
When it was my turn to go in, it was unfortunately around 12 in the afternoon, so all of the nurses were meant to be taking their lunch.
Yeah, isangixaka into namanje ngoba bahamba 2 hours beyelunchini futhi bonke bangashiya babe u4 abashiyanga umuntu ozosiza amanye ama patients akuyi queue. Kwafuneka ukuthi sonke silinde bona beze bebuya baze babuya kwakusho uthuma ngicabanga lapho isikhathi.
I was a bit surprised because all 4 nurses all went to lunch. They didn't take any turns or go to lunch alternatively, which meant that all of us as patients had to wait for them to come back.
Okay, like mangifika inside ngimchazele ngoba nami like ngiphakamela umoya sengilambile ngiyabhema ama drugs la ngivuke ekseni ngibhemile sengifuna like ngisheshe nje ngihambe yabo lonto.
When I got in there, I started consulting with the nurse. I was also, quite tired. I'd been at the facility for most of the day. I hadn't eaten anything.
Yeah, khona nje ngisangamkhomba namanje ekhuluma kakhulu ukubona kuyena lo like owangenza ngafeel like nothing like izinto ayizisho kumina yabo.
There was one particular nurse, I still remember her face, mainly because she was the most active and talkative out of all of them. And I still remember her very vividly because of the things she said to me.
Yeah, like mangifika like wangenza ngazuthi mhlambe manje mina like I'm not a human being mhlambe angikwazi ukuyicabangela yabo wenze nje ukuthi wangitshengisa ukuthi lokho ngizenze mina and futhi like angideserve usizo labo uba uzothi uzongidressa engisize ngale infected wound njena yabo lana.
She made me feel like less of a human being, like I did not deserve to be treated at the clinic or to be treated by her. It felt like she was looking down on me and looking down at my wound as well as to why should she be the one to dress and clean that wound.
Yeah, ngoba ethi ufuna uresa nje yini inkinga yakho wena wathi okay yazini inkinga yakho wena imangala wangihlalisa on the side ngangilokho ngibuka nje abantu ebangene basiza phambi kwami yabo like till it got late.
Eventually, she just made me sit on the side and made me wait and assisted other patients. And eventually, it got very late.
Yeah, nami like decide to come ngoba ngiyabona pharmacy sekuvaliwe sekushayo 4 like kakuseqala ngisho kuba emsesibhedlela yabo. Ngangisengibona ukuthi usizo ngengithole la like sengwasted a whole blessed day akukho kudlula ukuthi like ngihambe nami ngiyibone singenza njani.
I realized that I wasn't going to get any help at all. The pharmacy was now locked and the facility was also starting to get empty, so I decided to just go home.
Yeah, lento ingiphatha kabi indlela yenzeka ngayo ngoba kwakuyimina victim yabo into mayenzeka kuwena like ihlaba kakhulu ngoba till today like lokho since that day angibanga umuntu of like angibanga ngisakwazi ukuthi ngicabanga kufanele ngesibhedlela kusengiyakunqena ngoba ngazi ukuthi vele esibhedlela sibhekana nezinto ezikanje.
It didn't sit well with me, and it got to a point where it was off-putting to even go to either hospital or any kind of clinic because I would think of the previous experience that happened to me, so I wouldn't want to go in any case.
Okay, like ngihlale ngokuthi ngihlale ekhaya nabazali bagcina ekhaya sebethi ngize like ngedwadi in town yabo ngiyeke polyclinic kamasho ngoba ayingisizanga lutho ngisola ngisho transfer letter akafanele ngizoqala phansi ngizoqala kabusha like ngedwadi.
Eventually, it's my family who made a plan for me because even the polyclinic in itself didn't even give me a referral letter on where I could get or seek help that I needed.
Okay, mangithi ngiyafika ngoba ngihamba ngedwa kagcwele and ngokuthi ngumuntu like owedla ama drugs ngesikhathi. Mangihamba la ngasembilo ngabona ke ilokhuzana i-harm reduction center like step up HIV care yabo kuhleli nabafethu nje ngaphandle ngazuthi sinenkinga eyodwa yabo bangichazela ukuthi angena ikhona la like engazizwa ngisizakala khona ngoba akufani nasesibhedlela yabo.
I came across a step up from TB HIV care, which is where I felt home. I saw other brothers who were similar to myself sitting outside, and it's the one place where I felt that I was welcomed compared to the hospitals or the clinics around.
Yeah, ngoba lento iyangixaka kufanele bangisizakala khona ngisizakala ngoba umuntu uyafunda esikoleni esofuna ukuba unesi ukuba udokotela kodwa mase ikhona lokho like akakwenza passion lento ayifuna ayifisayo ngempilo yakhe yabo.
It's very sad to see that a person will go to medical school to be a nurse or to be a doctor, but after their graduation, but when it's time to come and render the services to patients with passion, we are not really seeing that.
Okay, ngokuthi ke vele ngabona nami ukuthi ngoba ngilimalanga kwavela kwazenzakala ngabona ukukheshi ukuthi ngoba ngidla ama drugs ngesikhathi bangifaka kwi program khona udokotela like wangidress isilonda nginikeza into engizoyicleana ngaqala imethadone.
So when I went to the TB HIV care where they at Step Up at Umbilo, there's a doctor who helped me to clean up and dress up my wound, and then I was enrolled for methadone.
Yeah, like njoba ngiqhubeka ngemethadone ngamanager ukuthi like ngwayiyeka nje ama drugs completely la vele ngangahambisani nawo. Nalesilona like sayipholela sona bangisadinga dokotela.
With the use of methadone, I was eventually able to wean myself off the drugs, and then even the wound that I had even healed as well.
Okay, okunye engifuna ukuveza sengihlala phansi lama drop-in center ayasiza mina like imethadone ngiyiphuzile yabo ingisizile and futhi
The drop-in centers, they do really help us. Methadone really did come through for me.
ya ngiyafisa ngazuthi singakwenza kube easy for nalaba fethu abasemalokishini ukuthi bebe na access methadone yabo.
I would like there to be access to methadone, especially to people who are using drugs who are residing in townships and locations, so that they are able to also access a service like methadone.
Ya ngoba kwamina akusefuna like ngigibele on daily basis. Umunye umnganami nje kuze kube manje wahluleka kena wagcina se end up la estradini.
On a daily basis, I need to get into a taxi to go and collect my methadone at TB HIV care. And I mean, I have a friend who wasn't able to continue with that journey and even landed up on the streets.
Ya ngoba like kunzima like kufanele ugibele on daily basis just like ukuphuza like ama meals.
It's very difficult for you to have to get into a taxi and travel to another place for you to be able to drink the methadone on a daily basis.
Ya ngoba nami I was a drug addict sabo for isikhathi eside and futhi ngakwazi ukuyeka nge short period of time nginalo ithemba ukuthi baningi abangayeka mase kuthiwa nje senze ukuthi lo muthi uba available kubantu babazi ngawo.
I have hope that if methadone is made available to people, then there are a lot of people who can be helped through that.
Yeah, like,
Thank you.
Sanbon.
Greetings.
I'm anonymous. Ngizokhuluma la ngeclinic yangasekhaya eDorinkob.
I'm going to talk about Dorincob Clinic.
Impumelelo.
Impumelelo.
Nginenkinga ke ngaya khona. Mangifika khona ngangena labantu bosizo lokuqala laba aba check temperature.
I got there and it was I had a challenge with the people who need to take your vitals.
Ngangena ngachecka konke. Ngadlula. Ngakhonjiswa ngoba ngangiqala ngakhonjiswa usistom kwathiwa ngiyeke ngizocela usizo kena.
I was directed to a specific nurse which is where I was supposed to receive help from.
Nami ngangazi wakubuza ukuthi yini inkinga yami.
She asked me what is my problem.
Ngamchazela ukuthi yini inkinga yami.
I explained what was my problem.
Wathi inkinga sisebenzisa thini protection ngoba ngangine STI.
Said the problem is that you don't use protection is because I was presenting with an STI.
Wangithethisa ke lokho kwangiphatha kabi.
She scolded me, which did not sit very well with me.
Wathini wathi asizwe wathi angihlale phansi futhi ngimlini.
She said that we don't listen and told me to sit down and wait for her.
Ngamlinda mhlambe 3 hours kanye.
I waited for over 3 hours for her.
Lokho engibuke lokho edlulisa abanye ngoba wayethi lokho ethi ubhizi usabhizi.
She would come in and see other patients and keep saying that she was busy.
Yebo. Ngagcina sengibuza laba baseceleni sengisaba ukuya kuyena.
I even asked those who were sitting close to me because I was now scared to go to her.
Wathiwa vele unje lo muntu lo ngawuzumshintsha.
Everyone agreed that this is her character, this is her nature, and there's no way you can change her.
Wangicasula mina lokho ngagcina sengiphuma ngashiya kanjalo
That
Ngagodu.
upset me, and I ended up leaving the facility and left everything as it was.
Private doctor.
And I
Uyena
went to a
wangisiza.
private doctor.
Ngiyabonga.
Thank you.
Sanibona.
Greetings.
Gama lami ngumlungisi ngantuli ngixoxe voice. Inje style. Story sami simayilana no D clinic.
My issue is about the certain clinic.
So ngelilanga ngiphethwe drop last year ngabo June.
I presented with an STI at around June last year.
So into eyangiphatha kabuhlungu mengifika kunesi cause lapho ufika ubhalise bese uyaqhubekela usuya kudokotela ozokusiza mayelana nale inkinga osunayo la ngaphambili.
Part of my challenge was that before you can see the nurse, obviously you need to register at the front desk before you can go see a doctor.
So mase ngifikile kulo nesi kunabanye abafowethu abawu5 nabo beze kushuthi ngenkinga efana neyami.
There were about 5 other people in the queue before me, and according to my assessment, all of them had pretty much the same issue that I had.
Bese mase kufika itheni yami lo nesi bese ngicela ukuthi ngimhlebele mina inkinga yami.
When it was now my turn, I wanted to whisper to the nurse so that no one else could hear what exactly my problem was.
Angicela ukuthi hayi ngicela ukhulume kakhulu ngoba phela la siyasebenza sishahile futhi ukusiza abanye.
She then told me to raise my voice because this is a work environment and they're in a rush and they need to help other people.
So lokho kwangilimaza bese ngiyamtshela ngoba vele phela ngisuke ekhaya ngoba lento angilali ebusuku usuke ebuhlungu.
This really hurt me, and I even said to her, this is really painful. The reason why I came here is to seek help because I really need the assistance.
Bese ngitshela uhlaphe laba abanye uzothi abaphume ukuze phela angilaphe mina.
I thought that she was going to ask the other people who were in the room to excuse us so that she can at least treat me.
Avela athi awuveze ngibona ubeke la phezulu etafula.
She then said to me, take out your penis and put it on the table so that we can all see.
Kwangiphatha kabuhlungu leyo nto ngoba kwayikona emgaqweni mekuthi kufika isikhathi sokuthi mhlawumbe ngifuna ukuchama ngize ngiyifihle into yami.
This really did not sit well with me because I struggled to even relieve myself.
So mase kufanele ngiveze phambi kwabanye abantu abazokwazi ukuthi mina bengize ngani noma ngisho phakathi kwabantu abaningi abangaziyo shuthi ayisekho imfihlo yami nonesi lapho.
Now talk less of having to undress right in front of other people. Now it's no longer going to be my secret with the nurse, but everyone else is also going to know the issue as well.
So angisho ukuthi ngiproud kodwa ngakwenza lokho ngamvezela.
I'm not proud of it, but however, I found myself undressing in front of all of those other people and showing her my issues.
Wangisiza ngendlela angisiza wanginika namaphilisi ngagodu ukuthi ngizophuza. Kodwa ukuthi esethi angibuya ngiba ngisabuyela ngoba ngangibona ukuthi kushuthi kusazofana nesimo esenzekile.
I got the assistance, but when I was told to return to the clinic, I did not go back because I was scared that I was going to get the same treatment as the previous time.
Ngithe ngisabezele lokho akuphelanga lapho last month ngomhla ka10 kuOctober kwafanele ukuthi ngavele ngavuka iBP ngisemsebenzini ngokusebenza ngisecurity.
Last month I had another incident where my BP went up. I work a very strenuous job as a security guard.
So mengifika futhi ngiya laphana ekliniki kade ngiphinde ngithole same nurse futhi.
I got the same nurse again when I went back to that clinic.
Ngifike ngiyichaza inkinga yami uthi nesi ngithunywe emsebenzini ekliniki yakhona thiwa ngize la ukuthi ngibheke ukuthi kahle kahle iBP yami yini inkinga yayo.
I then said to her, I'm from work and I've been referred from work to come to the clinic so that I can understand what is going with my blood pressure.
Indlela isimo sasiyona ngangijuluka namanje angaze ngiphindele ekliniki ngenxa yesimo engiyisona. Ngangijuluka ngitshela ukuthi angiyobamba ulayini olapha kwabantu obabona ukuthi engathi bayiphilela laba.
So I was sweating heavily and you could tell that I was not well, but I was told to go and get into the queue so that I can be assisted. However, you could tell that other people were not as ill as I was, but I still had to wait for them to be assisted before I could get help.
Ya bangithatha amagazi base banginika lawo maphilisi okwehlisa iBP kodwa ngangabisabuyela kubona ngakusasa.
At the end, they did help me. They took some bloods. They gave me some BP meds. However, it's not a clinic that I'd want to go back to.
Kuphinde hamba kule nsuku ngaphathwa uphenyane amehlo.
As time went on, I had some pain in my eyes.
So ngafaka le ibuade ningibona ngilokho ngiyigqokile ukuze ngiye clinic because amehlo awakwazi ukufacana nelanga.
My eyes couldn't really take light, so I decided to wear sunglasses, and then I went to the facility.
So mengifike clinic vele ilanga seliqala uba phezulu ngingena egate vele ibonga igqokile.
I went to the facility, and the sun was already starting to rise, and then I walked in wearing the sunglasses.
Oh nesi babevele bela bexoxa ama security efaka thina iguli.
The nurses and the security guards were basically chatting outside the facility and saying, here are the patients.
Kwathi mase kufanele kube 10 yami ungena ngathi mengifika kuyena lo nesi ovela ngitshela same nesi futhi wathi oqala usikhumulela izibuko.
When it was my turn to be seen, the same nurse who I had several encounters with said, you should take off your sunglasses.
Ngamtshela ukuthi amehlo ami awakwazi ukubhekana nesimo selanga. Wathi ayike ukwazi ukuthi sikusize thina la ekhaya.
I then said to her, well, my eyes are quite sensitive to the light. That is why I'm wearing the sunglasses. And she said that, well, then we can't help you.
Ngoba ngangifuna usizo wangiphoqa ukuthi ngikhumule izibuko ngihamba idistance engangokusuka la segate la icinema ilanga lihlaba emehlweni ubhekene nalo uyale uthi angimlandele.
She then asked me to take off those glasses, and we had to walk a distance of about 2 or 3 meters where I was facing the sun once again with those painful eyes.
Ekugcineni ngithatha isinqumo sokuthi ngiphinde ngiye ekliniki kade.
I decided that I'll never go back to the clinic at
Even
D.
kuyimanje mengilele ebusuku ngiyajuluka le BP angaze ngiqhubeke ngiyobheka ama results kodwa ngiyabona ukuthi ikhona kodwa ngeke ngiyolanda ama results ngeke ngiye futhi kuyolanda igazi ngoba ukutreatwa kwakhona uyabona ukuthi akukho kuhle.
I have decided that even if it means that I don't go and collect my blood results or whatever the case may be, I am fine with that because the treatment is not good at the clinic. Thank you.
Greetings. Yeah, you
Sanibona.
can turn the camera. It's okay. To me, it's okay. Thank you so much. My name is Letuku Kanya Sishi, known as Letitia. I am a student at DUT, known as the University of Technology. I'm also a trans activist, and I'm also conducting several seminars for trans communities here in KwaZulu-Natal. I am very visible in all spaces, such as the government spaces, which are the clinics and also the hospitals and also other stakeholders that we have here in KwaZulu-Natal. So what I have researched more of what I'm hearing now, and comrades, thank you so much for sharing the statistics that I've seen on the screen. It's very, very sadly to see something which it's so easily to be attended to than to have several problems from the beneficiaries, which is us as communities. So, hence I've mentioned that in all the seminars that I conduct, kunabantu abanokufika besho inkinga ehlukahlukene. Remember, we are dealing with trans women and trans men.
Kulomsebenzi engwenzayo, we do with the job that I'm working at, we do get a lot of people that come with different problems.
Yes, and most problems that we are facing, it's the MMC, which is called uksoka, circumciser, ne? So when you ask a trans woman to come and do MMC, which is circumcision, it becomes a problem because most clinics, they know that they only circumcise abantu besilisa, obviously. So if mina ngizofika clinic ngithi ngizocircumcise, it becomes a barrier because unurse or udokotela would say, we only circumcise umuntu wesilisa. And they're not saying it in a very polite manner because they don't have time, they don't have energy. They just came to work, then they go. So for us to be in a space less comfortable to express or to share into suge a clinic or a special, it becomes a problem. Because now if in figure me a clinic, this also the second question.
Saying that
Sorry.
I need to get a circumcision.
And it becomes a problem now when I need to explain, Uguti, I have a penis that needs to be circumcised. You know, and umutabuza ukuthi unepipi kanjani sisi, sorry for that. Unepipi kanjani sisi like clinic also sick because we only circumcise umuntu wesilisa. And my response would be, as funny as it might sound, angithi you'll only circumcise penises, right? And the answer will be yes. So I brought a penis that needs to be circumcised. Simple as ABC. I think for me to be in a space, or other sisters to be in a space, I was aware that I'm willing to teach. I'm willing to teach Dorotela. Let it be a space and it's a free space and express awuzengithole i-service ngaphandle ukuthi ungivulele iBhayibheli ngaphandle ukuthi uzongitshela wena ukuthi yini ngenze lokho. Just treat what you need to treat. Service me with service that I need. Emva kaloko we are done. Then I'll be able to come. If unomuntu engifuna referral for ARVs, it's going to be simple for the person to get ARVs. If I'm a drug user, ngikwazi ukuthola medication that needs me to be enhanced in. So it's the same thing. To have these dialogues, to have this summit, it really helps because you don't get an opportunity to speak out. Omunye umuntu mayifika ekliniki wena uyibuka, it's very painful ukubona unurse osendlini yomuntu omnyama ezophatha umuntu omnyama ngendlela abaphatha ngakhona abantu emaklinik. So ngiyanthanda kakhulu ukuthi ngifike.
When we enter the clinic and we see that.
Thank you.
Yes, comrades, we are about to close now. I will read these recommendations, and then after that, I will call upon leaders from NAPWA, PWN only, and I will ask comrades to be quick, 2 minutes, and then after that, I do not know whether Umasondo from the District Department of Sekona, and I do not know whether Uspesihle from KZN Health Usekona. If Basekona, immediately after the recommendations, I will ask the two leaders, and then after the two leaders, it will be you, colleagues, to respond and comment, and then after that, we're gonna close. So the recommendations on this one are as follows. National Department of Health and PEPFA should designate at least 2 public health facilities per population per district to serve as key population designated service delivery centers. 1 per province for all key populations will not be enough. Site selection should take into account local context, and facilities may serve more than 1 population, but may not always be appropriate to combine all key populations into a single setting given differential needs between KP groups. These sites must be allocated additional staff and resources to provide comprehensive health services to the specific key population being served. The KwaZulu-Natal Department of Health, Broadridge and Health Systems Trust should ensure that barrier contraception, including condom, compatible lubricants, male and female condoms, are easily available at all public health facilities, not only upon request or in public spaces that makes it difficult to pick up. KwaZulu-Natal Department of Health Broadreach Health Systems Trust should ensure that all key populations are offered PrEP at public healthcare facilities. Department of Health and PEPFAR should ensure that harm reduction services, including drug dependence treatments such as methadone, are made available at public health facilities. Department of Health and PEPFAR should ensure that trans people are able to access hormone therapy and gender-affirming services closer to home. Where people who use drugs and or trans people need specialized care from drop-in centers or public health facilities offering specialized care, they should be provided with easy referral and adequate resources, including transport or money for transport to uptake to those services. Those are the recommendations. I will now call upon comrade, leader from NAPO, comrade uNeli Mqadi, aze ngaphambili athi vandla vandla. Over to you, my leader.
Thank you, my lead. Sanibonani. Ninjani? Thank you very much for this opportunity. I'd like to thank everyone ophumelelile namhlanje ngokushare izitori zabo, and we are proud of you guys ukuthi nikwazile ukuyibamba noma inzima, but impilo yona important to everything. We as NAPWA in the province, we promise you that kule improvement that we see in the facility in this quarter, we'll try our level best ukuthi abosingayo DOH sizongena necapha. They know ukuthi masithi songena necapha what language we mean. They have their own language, they understand most. Ukuthi if you say a security guard, it's for the safety of the facility. I see a new nurse. First thing. Number two, if you say integrate a support group yenzo CCMDD no adherence club, kodwa ungazange u-empower i-staff sakho ukuthi how to treat people in the facility, which means there's something to be done. Empower your team in the facility. The facility, the healthcare system need to be upgraded ngeke. You don't have to open your door in your house and take it to the facility. Ustreet ngathi sikwakho ekitchen. When we came for e-services, those services, they mean human rights under e-constitution yase South Africa. Number three, as a sector yase KZN, we need to promise u-DOH ukuthi njengoba nis-avoida in our meetings sizohlangana. That's a promise. We need to solve issues. Kwi boardroom, masihlulwa i-boardroom, let's go out. Angale kwe boardroom ikhona enye indawo la sihlangana khona. We request ukuthi let's save lives than killing people. Nikhumbule if ungena ithatha uma nithi nizosiza i-community kuma facilities. Nanisho ukuthi nizosibulala nathi nizosiza. Manje manizosibulala, what must we do? The fourth thing, if I'm sick, yes, ukuthi ngizoba ne-attitude. I'm not waiting for you ukuthi now ube ne-attitude back, because we are being trained ukuthi how to deal with the client coming to your facility. I don't want to lie. There are a lot of resources injected good DOH to integrate their systems. You can't mean that at 2022 Mina mangifika Azalea Clinic, if they click my name, they can't get my name and ukuthi mina where do I get my treatment? Ngo 2022, it's unbelievable. That system needs to be upgraded. Nginika 3 months ngale kwaloko mangifika Azalea ngivela eNtseleni clinic kufanele mangifika lapha mabe clicka ku computer they know that uneli lo amqadi uyi treatment uyilanda eNtseleni amagazi when last did she take I treatment yakhe. That's a promise. Thank you, my lady.
Thank you, Comrade Nelly. Sizawubiza uComrade Usmanzuza from PWN. uComrade Usmanzuza bathu sesephandle. Simpa 5 seconds uComrade Usma or else siqhethela phambili. We start counting 1, 2. Uyeza uSmanzuza kanye akayeza uSma or 3 kuthiwa seka la uSmanzuza awuzawuthi 5 qala
KZN. Okay, ngiyaxolisa sengathela ukuhlala bengifaka uphumula eminyango. Okay, njengoba ngilana ngimele uPWN. So ngiyakuzwa konke okukhulunywayo but sinawo ama challenges ema clinic maningi. And lokho abakushoyo kuyikona. Ngoba polyclinic kwaMashu sike saba ne challenge yokuthi makufika abantu abadala laba bahamba ngama wheelchair imbhede so ababanaki kanti umthetho uthi umuntu omdala mengabe efika sikhona sihleli uyamcelela ukuthi adlule so bona abayingeni leyo baze bamdlulise ngoba usuthe awuthi ngishuthe lento ukuze ngiyise la ifanele ukuthi iye khona kuyima betatazela ke so ama challenges ema clinic sinawo maningi eGoodwins into engiphatha kabi kakhulu kweGoodwins ama caregiver khona uma ngabe echeck umuntu awayifihli into yakhe ukuthi kufanele ifihleke iyaziwe uyena ayayimemeza nje hayi waza wena upositive kodwa umnikazi wayo ufike wayihleba unesi unesi mase responda useyayishawoda no caregiver yakhe ibayalekelelani bayahleka kwasho ukuthi ngenhlanhla ngikhona ngizolanda treatment kama hawu ngibuze ngithi mina kuyahlekisa yini so mangabethula ngiphinde ngibuze kuyahlekisa yini njengoba ezolanda treatment akazenzi naye wathola ngoba lento esinika lento yonto emnandi yabo so asingamhleki umuntu ngoba nawe ikusasa awulazi ukuthi linjani baqala bathula ngahamba ngayocela umetron wakhona ngakhuluma naye ngamtshela uSister Mthembu ke unenkinga uhlale ngitshela ethi simami mina nginenkinga onesi bami bayangihlula kade ngasekho 6 months uSister Mthembu sekhathele ukusebenza eclinic ngoba onesi bayam overpower kwasho ukuthi ngenhlanhla vele ngiku clinic committee so sathola yonke information sababiza onesi sahlala nabo phansi sakhuluma nabo kwangathi bayezwa kodwa still language ayiphelile ngiyafisa nje ukuthi nisilekelele ukuthi si educate ngoba onesi aba understand and masifike ema clinic sibachazela nangalento LGBTQIA abay understand so mina ngiyafisa ukuthi uRitshidze uhlangene no PWN no Sanarela kuke kukhulunywe ngalento ukuthi uLGBTQI uma ngabe ufike eclinic awube nomuntu nje ospecific kuLGBTQI ekwazi ukuthi nangunesi ekuzoqondana naye ngoba lento yokuthi ngiye kuwena ungazi lutho kwa LGBTQI inkinga yabo mina khona unesi seke ngambopha ngimbophela ukuthi nje ngangiphethwe isinye mengiphethwe isinye shuthi ngithi awuthi ngihambe ngeclean ngoba sengiyiphuzile ipot seat sengiwaphuzile amanzi la kushiwo wafika ngithe ngilala nabafana abaningi yikho ngigula ngathi mina no mina I'm a lesbian but muthi ngilala nabafana ngiyadideka okusho ukuthi ukhuluma into onganayisho ngoba awukakangicheck ngebhadi ngiyilesbian usho kumuntu orong iki uyabo so ngiyacela nje ukuthi si educate onesi ngenhlanhla ke thina kwamashu sesiyiqalile i-training yama police station kodwa kuma clinic asikakafiki i-training yokuthi sibafundise ngo-LGBTQI ukuthi yini u-LGBTQI umuntu aka-LGBTQI ufuna asizwe kanjani so ngiyabonga ngakhuluma konke kushona la ngasilambile manje
Thank you sizawubiza I do not know whether Umasondo is a Mr. or Miss, but Umasondo or Miss Masondo. Miss Masondo, over to you. The floor is yours. I do not know Gutukupi. Oh, Nanko.
Yes. Ngiye phambili kakhulu nginamahloni njalo ngani yami good afternoon all my name is Nonhlanhla Masondo from eThekwini Health District Office as the Deputy Director of PHC Services looking after the functioning of all the clinics in the Northwest Service area, which is 2 of us that look after the clinics. The other lady, she was here earlier on, she looks after the South and the South Central clinics. Stress, stressed into engakazibonwe. However, ngizoba strong. I would love to thank you all for this meeting and for the feedback from Ritshidze, as well as all other stakeholders that are here. But I would love to thank all the participants more for sharing their experiences in our clinics in the whole province of the KZN. It is beautiful to hear and see ukuthi gubi kangakanani. We know gubi, but today ngibone ngelinye ihlo ukuthi gubi kakhulu. I would love to apologize kubo bonke abangaphathekanga kahle kuma facilities ethu. Siyaxolisa. However, akumele kufike lapho kuphelele lapho ekutheni sixolise. We have to do something about everything that you have actually mentioned here. The Department of Health actually is working hard to improve the services accessibility, of which many of the issues here, it's either medication or the service was not acceptable. Some were refused treatment or medication or being attended in our facilities, so the service was denied. And some did access facilities as early as 5:30 or earlier than that in the mornings, and they stay long hours until they decide to leave because of the worst attitude of our healthcare staff. So the medication was denied to them, or the treatment of their illnesses. The humiliation that has been imposed, or that is imposed onto our people, it is actually so worrisome. We apologize again, but the department is trying to make sure that these things, all of them, improve because we know about them. In all facilities, there are complaints registers, complaints boxes. And all the clinic attendants are actually expected, if they are not happy about the service, to complain. Next to all of them, in the district, we are having about 108 clinics. Next to them, they have a poster that is actually giving a direction on how to lodge a complaint. And over and above that, look around in your waiting areas. There are contact numbers for the operations manager, for the PRO of that facility if it is a CHC, as well as for the CEO or the operations manager for the facility. If you are not treated well in any aspect in the facility or in any corner, you have to look for the person that is in charge. However, some of you mentioned that they had looked for the person in charge and they did not get any joy. There is a number again in that poster where there is a clinic manager's cell phone. There is a PHC manager, a supervisor of a cluster of the clinics that should be called and say, I'm not going anywhere until I'm getting the service, or you ensure that you are here and solve my problem because this is the problem. If you are not getting joy from there, all clinics have got a head who is the CEO that is supervising this PHC manager. You have to call this person because you have to give yourself time so that this does not happen to the next person. It has to end with me. Help us because we cannot be in the facilities every day to ensure that the service is running well. The department has changed the strategy, slowly but gradually. Keep watching, keep reporting, because there has been a tendency that the complaints are not managed accordingly. Now we have changed to investigating the complaints and ensuring that the causes of the complaints are managed, including the staff attitude. Okay. However, having said all these things, in our communities, there are those people that come to our facilities. I heard it more than many times here for people who presented that abasebenzi bayehla bayenyuke. Kwesinye isikhathi ke bayakutshela nje abantu niyehla niyenyuka nicabanga ukuthi nibahle. Okay, that is okay because maybe people do not understand the nature of the work that is happening in facilities. If there is medication, at least even one that is finished in your consultation room, kumele wehle uyilande ubuye wenyuke nayo. And then deliver the service and ensure that this person who is in front of you doesn't lack medication, or there is no excuse to say, I seek medication. Because that as well can be interpreted as I seek ama clinic aphelelwa medication kanti sebebalekela ukwehla ke manje benyuke beyoyilanda le medication. Patients can be very difficult because with what we have said today, I also heard that there were compliments, although there were few, and there were healthcare workers that have done right and that are doing right. However, masesithukwa sebethukwa laphaya akabe kusashiwo kuthiwa hayi unesinozo ongcono kuthiwa nje niyehla niyenyuka nicabanga ukuthi nibahle, and a lot that is being said to them. Sekushiwo nabangenacala. However, umphakathi nawo siyawucela ubambisane nabo abasebenzi bezempilo uma sebefikile ezikhungweni so that bafollowishe the complaints procedures, bashaye nocingo benze konke ukuze our clinics alungiswe. We do complaints, receive complaints, and now the community have changed. Isiwaletha kuthina district office and we ensure that those complaints are attended, or aye head office aqhamuka seqhamuka ndawo zonke. Kuhle lokho, and we would love ukuthi we treat them, the cause of them, until kufike la disappear khona. However, my complaints, we benefit thina as the Department of Health about them, because complaints, they are telling us ukuthi this is where you should actually strengthen your services. This is where you should look at this. This is happening in this facility. This, that, this, that. However, on our side, we are planning and we are trying to manage them correctly. Sibambisaneni bantu bakithi. There is a program called CCMDD, which is which we take people out to collect medication, either from pharmacies or from the pickup points in the communities and adherence clubs. Hey, this service was aiming at decanting our facilities. Abantu bangagcwali eclinic because ukugcwala eclinic abasebenzi bagcina bengasakhuphi with the load that is in the clinic. However, there is very poor cooperation from the patients. Very poor. Angithi manje mawuyolanda clinics akho umuntu ophendulana naye. Akho umuntu othi ufike ngokoratu akho umuntu othini. People do not go there. This district alone, the province actually has got a target of taking these people out 1.2 million, the province. And iTheku Lodwa, we've got a target of above over 600,000 and above. Facilities do decant and register people on CCMDD program, but numbers are not rising because people do not go there to collect their medication. They default. Yet there is some counseling that is happening before you are decanted. You choose where you want to collect medication. Ayilandwa nje medication. Nhlobo. Sebes offerishile ke la, bayas offerisha ke la. Ngoba bafuna sihambe siye ngaphandle, sibuye nje sesizoxilonga kahle, sithathu kahle amagazi ethu kungajahiwe wonke umuntu angakhali ngamuntu osetheni kuyena nongathanga novulile nongavalanga. Asi mphakathi. Siyacela ukuthi kubanjiswane when it comes to this because it's a good tool, ne vehicle of moving our problems from us as well as health facilities. Agabe functional jama health facilities and then nathi si improve sifike nje clinic ungaguli uthi nje ngizocela ningixilonge from head to toe. Uyazi ngiyafisa this happened before I retire. Ukuye nje clinic because awagcwele ama clinic everybody goes out to the community ayolanda amaphilisi akhe. Uma ngena nje clinic athi hayi sister namhlanje akubhlungu ndawo. Ngicela nje ungichecke from head to toe. Ungenze pap smear, ungiteste for HIV, ungenzeni. In my vision nesifiso sami primary health care usho njalo. Ama clinic akuwona okulapha izifo, awokuvikela izifo before they start. Now because sezistartile sekufanele ke phela silashwe, but inhloso ukuthi sivikele izifo. Uma ufika nje uzobuza ngento ekuphethe ethize, ayitreat usister bese yinika ithuba lokuthi akufundise so that it doesn't recur. But now our facilities are so full in such a way, njoba ngihleli nawe la ngilalele kuphela 10-15 minutes, hayi inhlambe semnyango towards me. Kwenziwa kancane la. Bayehla bayenyoka bacawunti bahle abamazi lo phakathi ukuthi uthini. And this usister akakwazi ukuthi asheshise lo amnika poor quality care ngoba ejaha othukayo eminyango. Asibambisene kahle. Yes ba wrong impela bona. Uma be wrong thina siyimisele ngokuba manager benze ngobu right, but nabo they do have challenges. So sizocela nje emphakathi ukuthi sizame ukuthi sikhulume lento yokuthi abalanda amaphilisi abawalanda amaphilisi ke kuze abagulayo ke at least ba treatwe bafundiswe ngokugula then kube right impilo iqhubeke. Adherence to treatment ngizokhuluma ngawo futhi noma ngingezwakala ngathi ngiyawuphinda it's okay. Tina we've got into yokuthi i-treatment sithathe uma sagula thina ke sonke nje nama ngizifake lapho phakathi. I-treatment uyithatha nje usaba nje umkhuhlane ama antibiotics 2-5 days kodwa 3 days mawusuzizwa ungcono awufiki ku5 days namaphilisi. Uma ngiyirong ngilungile kodwa kunjalo kona. Awenyanga ke wona ke wonke aweminyaka siwa defaulter ngendlela engalungile which is very dangerous to us in our health. Because if we default like that, agcine ngasasebenzele amaphilisi ekufanele ngabe yasisiza agcine ngasasisizanga. So ngizocela nalapho ukuthi si-emphasize ukuthi silikhiphe leli gama elithi aqeda amaphilisi adle daily. Sikhulume ngezigulo zethu sisho nje ukuthi hayi nginoshukela nje nginoshukela ngidla amaphilisi ekhaya bakusupport bakukhumbuze ngisho abangani bakho bakuthumelele be open ngoba asikhulumi ngalezi zinto. Namhlanje sizubhlungu mangabe kukhulunywa ngabantwana abasebenza ama-sex workers angibike kanjalo abenzi abajovayo nabadla idakamizwa. our community angisho ema-clinic asikhulumi ngalezi zinto. Akekho ozijwayele lezi zinto, asizijwayeli ngoba owadlayo amaphilisi, odlayo idakamizwa uzwakala mase nenkinga kodwa ube ngakabi nayo inkinga akayikhulumi namuntu lento in the open. Nabasekhaya should they realize ukuthi sekunjalo abakwazi ukuyikhuluma esontweni ukuthi hayi sithandaziseni sinenkinga noma ekhungweni noma umphakathi ukuze uzazi lezi zinto ukuthi zikhona kube nendlela yokuzimanage. Akukuhle lokho ngoba kuzwakala kuyijudgment. Izinto engiyizwile lana ukuthi abantu bajajwa kanjani emaklinikhi ziyashaqisa. However, isendlalelo sami sithe abasebenzi sibhizi nabo abasebenzi baphuma emphakathini odadewenu nomawenu thina laba nobani siyafana nani ikona ukuthi on the other side of the desk base sisemsebenzini. Uma nibabaza lapha yangaphandle nithi hawu uyadayisa. Yilabo mama abaphuma kulowo mphakathi, uma wakho nodadewenu abaphuma kulowo mphakathi ukuthi nje mase bese clinic bangakuleli side lase clinic. However bona bafanele ukuyihandlisha ngendlela ehlukile because bona bafundisiwe ngakho. So si aware of logo futhi as well. We need ukuthi sibe patient uma sibafundisa, uma kune complaint sibafundise more sithi abayeke noma bahandlishe ngenye indlela ukuze kungajwayeleki. Thina izinto asizikhulumi zonke sizifaka istigma. Zonke sizifaka istigma izinto. Ukuthi abantu udla amaphilisi ama-ARVs uyazi umuntu osho openly hayi abantu bambhekisisa kahle uthi hayibo engabe ubhema nhloboni ke lokhuluma kanjena ngalesifo. Ingoba thina asikhulumi bantu abamnyama ikakhulukazi asikhulumi ngeyigulo. Umuntu uyagula from head to toe. Thina la akholwa ukuthi ukhona phakathi kwethu ongathi akashongo mayibona umfana odlula lapha engagezile engakamile ehambe ecosha ukuthi uhlanya lolu. Yile stigma enikhuluma ngaso ukuthi senzeke eclinic lesi esikhomba lapha sithi umfana uyiphara. Same of which thina basebenzi bezempilo kanye nathi siwumphakathi kumele sibambisane in understanding ukuthi umuntu uyagula from head to toe. Singastigmatize ilutho nje because ukuba i-sex worker ukwaba i-decision imposed ama-circumstances in somebody's life. Uma eshintsha lawo ama-circumstances maybe the person will change, but no one ophile South Africa ongakwazi yena ukuthi mina ngakusiza wena ushintshe lama-circumstances zakho. Okwethu ukumtreata as a person, simhloniphe simtreate with dignity. We are working very hard on that. Ngizoshare nje ukuthi uhulumeni ufike wavulela ukuthi abantu besifazana uma bekhuleliwe bangahushula. Angithi? Angithi? Yes, angithi wakho. Hayi. Akekho emakliniki kuyasetshenzwa kufunwa abantu abazosebenza kule section because ayihambisani nama values abo nama religious issues abo bayayistigmatize abayenzani bayenzani. Akulula but uhulumeni nathi sitho osedecide ukuthi yena akayidingi lengane ageze ukuze angafi ku backstreet ageze simkhiphe nje kahle ngesivumelwane into. Ngifuna nani nibone ukuthi ubunzima abukho ngale ngakunina kuphela bundawo zonke because uma esefikile umuntu mina ukuthi ngishade nomfundisi kwami akukhushulwa awuzu understand wena ukuthi mina ngikuleso simo uzothi mawusufikile nje eclinic ufuna ukukhushulwa nje maduzana mina akasekho ngicabangelayo ukuthi nami phela ngiwumuntu lesi simo kufanele sihambelane nami ukuze senzeke mangisemsebenzini nje abangikhushule laba bayafuna abafuni ngivumile akekho ngicabangelayo. So we have to work together as a community ukunderstanda ama-issues and dynamics enzekalayo about ama-health issues in our community as well as in facility. Kodwa labasebenzi abadelelayo cha lona ke is intolerable. Elabasebenzi abadelelayo cha is intolerable. Abavuka abasebenzi noma basayinwe emapostini ukuthi bayodelela abantu basayinela ukuthi bawenzani bawubasiza njengesivumelwano esikhona kwi-contract yabo. Lana eThekwini nakwamanye ama-district sinenkinga yabantu besilisa of all walks of life ukuthi ba-attende ama-health facilities ethu. Because of the staff attitude, ama-long queues, nazo zonke iy'khalazo engikhalaze ngazo la. So kunama-men's health clinics, men's health centers in the CHCs and facilities that prioritize men. Uma ufika ema-facility kuthiwa iy'ngane ziyangala, omama bakhulelwe bayangala, but there is nothing that was talking to men going anywhere. And bayafika amadoda nabesilisa bancane badala, ubezwe sebenxapha kakhulu sebediniwe sebeshiya phansi ikhadi sebethuka behamba because bayahluleka ukubekezelela isimo esuke sikhona eklinikhi. Ngizonicela umphakathi omuhle, spread the word, abantu abaye emakliniki nabesilisa because banama issues abangakwazi ukukhuluma ngawo, banama issues abafuna futhi ukuveza mase begule endaweni eze-private, abanye abathanda ukuvezela unesi wesifazane. So sekushintshile-ke kuya ngokuya kushintsha noma kungakabi iwona wonke, kodwa ke akhona no men's clinic. Bheka ama-signs ala ukhona, ubuze futhi ukuthi abesilisa abaphuthunywa ngakuphi, bakuphuthumeleke kwabesilisa noma benza icebo, but sibhizi ngalezo zinto ukuze nabesilisa mabefikile ema-facility ethu bazizwe be-comfortable nazo zonke izifo abasuke bedinga ukuzenza. I-accessibility to health services kubantu besilisa ayive incane kanti banama-health problems amaningi. Sengiyavala, sengizoqeda. Sesine clinic ke cater for K-pops lapha ngase Eddington. Ngase Eddington Hospital. LGBTQIA clinic. I guess it is not stigmatized, it is well situated in a very busy area. Umuntu ngena lapha akekho dinga ukubuza because there is a lot of services that are happening in this clinic. Nonke yenu LGBTQI is still a clinic. So ungena lapha, please utilize the facility. However, in the presentations today, I heard, whether it's from the comments or presentations, I can't remember, that it doesn't have to be somewhere there. It has to be available all over so that this key population is actually attended and prioritized. Lastly, COVID-19 vaccination. Hayi saze sahlukumezeka indaba ye-COVID-19 vaccination. Hayi umphakathi anibambisene nathi when it comes to this one. Because it's a health matter. No matter uyiphi i-gender, no matter uyiphi i-population type, no matter kwenzakalani ngawe, but COVID-19 uyabulala nje, uyabulala impela kakhulu. So we are experiencing currently a rise in numbers of COVID-19. So be careful wherever you go in the congregate settings, emasontweni, ey'koleni, emisebenzini yakho. I don't know ukuthi usebenza endaweni enjani, but careful around people. Keep your distance, up the game of washing hands and sanitization, but over and above that, please make sure that you have vaccinated and you have received your booster doses. Ama-stigmas nama myths akhona around this. Sengigome kathathu mina ngoba nginesifo sikashukela, so ngiyasaba ukuthi ngoba ngi-comorbid ngizoba nenkinga mangabe kufika umkhuhlane. Ngithi angikusho nje ukuthi sengigome kathathu akukho nje okwenzakalayo kumina, kodwa okungenzeki ukuthi hayi umkhuhlane hayi angikaze ngiwuthole lokwaqala unyaka nje lo, ngoba over and above COVID-19 vaccination ngiyaya emtholampilo la ngihlala ngakhona ngicele bangigome ngalo we-flu ngoMeyi ukuze nje into enomkhuhlane, ngoba u-COVID-19 infection uyakwazi ukuphigibheka akungene kalula ehamba nomkhuhlane onormal. So umkhuhlane onormal won't be known, of which there is a lot of umkhuhlane onormal among people. I would request all of us to be vigilant, sisebenzisa ama-condoms so that we don't become HIV positive. Sidle kahle, sigade ushukela and excess in everything that we do so that we don't become comorbid. Because if you are having these illnesses that I have actually mentioned, bese uba no COVID on top, you complicate. Some people mostly baphathwa yilo mkhuhlane and they die. The numbers of these mkhuhlane osubulala abantu seziphezulu. Kusho ukuthi uCovid ukhona. So with these words, ngizothanda ukuzibongela kakhulu nethuba nokungilalela. bekubalulekile ukuthi nami ngikusho lokho engikushoyo ngoba izimo ziningi. However ngivala abasebenzi abadelelayo nje, ukudelela komsebenzi is not tolerable. Please keep on reporting. Kodwa kungijabulisile earlier on isikhathi engifike ngaso ukuthi presentation ka Ritshidze ithe there is some improvement in complaints management and ama waiting times. Kade kuno some improvement not sabalwa some here siyitheku and other districts compared to the previous years. So we are going to keep on working, and I'm not sure whether Ritshidze is keeping on observing this, and maybe next year sometime so buye siphinde futhi sithole sizo ukuthi ngabe kuphinde kwehla yini noma kuphinde kwenyuka noma kuphinde kwenzijani. We will appreciate that because there is a lot in our community. However, injongo ithi konke akwenzeke kahle because okuthinta health kubuye kungareveseki kahle kuvele kufa umuntu, which we do not want to happen. Ngiyabonga kakhulu.
Siyabonga Mama Masondo. Sizawuya manje kwi KZN Health uSphesihle.
Ngiyabonga kakhulu. Yawa. Oh yeah, ngizwile uMiss Mbambo uthe ngikhonze. uSphesihle is coming from my office. So njoba sengishilo nje hayi ngathi sesiqedile. Siyabonga.
Amandla. 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 Comrades, siyavala manje. But if you can listen to each other, I know it has been a long day. Masibonge from good Department of Health, but also masibonge to the HOD of Health for affording us the opportunity to see presented this report going. You know, as we are closing, comrades, Mama Masondo, Specific Mkulawam, and everybody, last month, Comrade Tandukol, in Nelson Mandela Metro, APE, a NU11 clinic. A patient went to the clinic, a male patient went to the clinic, and then waited there. Then I do not know what happened between the patient and the nurse, but the nurse insulted the patient to a level where this patient could not take it anymore. The good thing, the patient doesn't stay far from the clinic. He went home to fetch his firearm, brought it back to the clinic. The clinic was closed for 2 weeks because the nurses were frightened. They had to go through counseling, and a lot of money was spent. And the person who was blamed is a patient. And the one who insulted the patient was able to go away with murder. What I'm trying to say, comrades, let us not have any room to justify a violation of human rights. Let us not have any justification to to defend people who are ill-treating the patients. I am not responding, comrades, but I think it will be good, Mama Masondo, put especially good, after this meeting, Ritshidze and its district, we're convening a meeting where we're gonna look into all the issues that are coming from the clinics, Zala eThekwini. And then we sit down, we agree with the department as to say, how are we going to work together in terms of addressing all these problems that have been identified, so that by the time we come back here, we are able to report on progress made. Yes, our clinics are overcrowded, but in the same breath of our clinics being overcrowded, they are also understaffed. More than 42 million people in South Africa, out of the 60 million population, 42 million people are public healthcare users. Both private and public, we have less than 400,000 healthcare workers. It therefore means one of the reasons that some nurses are having this attitude against us, it is because they are overworked. They are overburdened. Instead of them venting their anger to their bosses, we become victims as the patients. I think as we're moving forward, the department must sit down with us and agree, Uguti, how can we work together with the department in terms of sensitizing the nurses and also go beyond that and also engage with their trade unions. It cannot be true, Comrade Thando Xolotoro, because of my religious, political, or cultural beliefs, I will refuse people's services. I've signed a contract with the government. And my duty, whether religiously, politically, or culturally, I believe on what? I've got a contractual obligation with the department. Therefore, denying people health services because of my religious, political, or cultural belief, it actually says that I am denying people their rights, and also that is not a standard operating procedure of the department. We are going to convene a meeting, a follow-up meeting with the HOD and the MEC, because even us, we are tired of producing these reports with all of these complaints and nothing is happening after that. We want to see something being done so that people can start going to clinics without having frustrations and all that stress that we go through before we go to clinic. So, on that note, let me take this opportunity and thank you all, comrades, the department, CTC, UNAIDS, and everybody, including the comrades who have joined online. We thank you all. Now we have come to an end of our session. I will also ask Comrade Simpiwe to close this meeting with a prayer. Can we please rise, comrades, and close?
Okay, singavala amehlo. Baba egameni lika Jesu siyabonga baba wethu kuba usivumele wasinika lethuba ukuthi sihlanganyele kule ndawo siqale nawe ngoba ngaphandle kwakho singenze lutho. Siqedile manje siyathemba uNkulunkulu onamandla wonke ukuthi konke lokho sikwenzile angeke kube yizeleze, kuzoba khona okuzoba nenqubekela phambili empilweni zethu kanye nezimpilo zabo bonke omunye nomunye bekhona ngaphakathi kwale ndawo. Sesiyaphuma ke manje sicela uzophuma nomunye sihambe siphephile sifike la siyakhona egameni elinamandla elika Jesu. Amen.
Thank you, comrades. The meeting is closed.